moment. We've been planning this for the last few weeks, as you can imagine. And it looks like we've got, I don't know, between 40 and 50 people in attendance for the first panel of the Spring 2020 Honors Thesis Symposium. So thank you all so much for being here. This is really exciting. A couple of things to note. We just posted the link to the full program in the chat on Teams. And Andrew, I believe you could make that available on the YouTube live stream as well, right? So welcome to everybody who's attending in each different way. And we are just going to go ahead and get started. My name is Dr. Megan Hughes-Zarzo. I'm the director of the honors program. And it has been certainly a journey this semester, as all of you know, for all of us in every class and with all of our students and in all the walks of life that we all occupy. This has definitely been a challenging time, but we found our way to this day. And these particular students rose to the challenge and told me that they wanted to go ahead and somehow put on the Honors Thesis Symposium. And so we began a brainstorm about how we could do this. And the result is what is going to happen over the next number of hours. And I hope it's going to be amazing. I know it will be. The first panel today is titled Exploring Public Health, Mosquitoes, Melanoma, and Traditional Chinese Medicine. And our three student presenters are Kaylee Mackenzie, Deisy Rosales, and Sophia Nem. And we are just going to let them get started and launch this day. We'll have for the first panel, panel 2, and then there'll be a celebration at 11:30 for the grads. So anyone who wants to attend the celebration ceremony can also attend that. And I would just like to give a shout out to people really actually across the globe attending today. I reached out to one of our students who's currently in Germany. All of you in the honors program, I think, will still recognize Ted Richtofen. And I think he's going to be with us today as well, and that's exciting. And some other alum are going to be here as well, Becky Alter. So any other alums that I see today, I'll definitely give a shout out to you, but thank you so much for being here. We're excited to have you. Okay, so let's get started. Panel 1, you can each introduce yourselves and share your presentations. For everyone who's in the audience, while Kenzie's pulling up her presentation, I'll just give a few instructions. We would like everybody to mute your microphones and turn off your cameras during the presentation, but you are welcome to be active submitting questions already during the presentation. If you'd like to submit a question in the chat, either on YouTube or on Teams, we have moderators that are watching both of those and are going to be submitting all those questions to a shared doc that I will have, and then I'll be able to pull up those questions at the end during the Q&A. Each of the panelists will present their talk, and once all three talks are presented, then we'll go to the Q&A. And we'll have your questions there. If you want to save your question until the Q&A, that's fine. If you want to already get it into the chat now, that's fine as well. Do let us know if you would like to ask your question live, and if you would, maybe just indicate that with an asterisk. That would be great. Otherwise, we'll just we'll ask your question for you if you don't indicate that you would like to address the speaker live on either of these channels. I think the most important thing is just to make sure that the speakers are where everyone's able to hear them. And then afterwards, we're really excited to try to have as rich of a Q&A session as we always do, and in spite of this remote format. But thank you for being here. Okay, Kenzie, are you ready?
I sure am.
Okay. I'm going to mute myself so you can take it away.
Awesome. Thanks, Dr. Hughes. Good morning, everybody. It's weird not being able to see y'all, but my name is Kaylee Mackenzie, and today I will be presenting on my paper titled Using a Two-Port Olfactometer to Determine Ideal Attractants for Aedes aegypti and Aedes albopictus mosquito species. So if you couldn't guess, my research is on mosquitoes. If you hate mosquitoes, that means you're probably one of the people that gets bit by them all the time. But if you love them as much as I do, that means that you probably are the ones that don't get bit as often. And what I want to find out with my research is what makes those two groups of people, the ones that get bit and the ones that don't, what is the difference? What biological emissions is your skin putting out that makes you different to get bit or to not get bit? So little key differences between male and female mosquitoes that are kind of important to understand research here is that males tend to have more slender bodies and large antennae for sensing wing beat frequencies. That is wing beat frequencies of the female so that they can find them for mating. As well, there are papers out there that are showing swarming behavior being witnessed in the males so that they can also increase reproductive success. They also only feed on nectar. So if you've ever been bit by a mosquito, it's only ever been a female. And I'll kind of get into that a little bit. But another thing is that mosquitoes are very olfactory driven. So females, as we can see here in this photo, they have larger bodies, they have more simple antennae, and they have needle-like mouth parts right here called the proboscis. And that is used to penetrate the skin of their blood hosts. And then they also feed on nectar, but they mainly feed on blood because that is necessary for them to complete their reproductive cycle. They partake in multiple partial blood meals. That is seen in a lot of the mosquito species that transmit diseases such as dengue fever, yellow fever, Zika, in order to infect more blood hosts. And then also, eggs can take a part in something called photoperiodic diapause, which is a halting of development of the eggs into larvae and pupae because of unideal environmental conditions such as shorter days and colder temperatures. So why should we study mosquitoes? It's very an interdisciplinary study when you talk about mosquitoes. It can be disease, health, pest, just plain old entomology, geography, environmental. It can be talked about anywhere. So disease is obviously, lots of diseases are transmitted by mosquitoes and plenty of other insects as well. But if we can find out what attractants are most attractive to the female mosquitoes, we can use attraction-based traps in order to reduce population sizes, to reduce the amount of people getting infected by these mosquitoes that are carrying dengue fever, yellow fever, Zika, and so on. With pest control, mosquitoes in areas that are not so ridden with diseases, they're still pets. People find them annoying. You go out camping, they're everywhere in your neighborhood. If they're just spawning in your pool in the backyard, they're annoying. So with these pests, by being able to capture them more, and we would be able to have safer protocols for pest control, so using less insecticides, and it would just make the environment healthier, safer, and you won't have to be breathing in these harmful chemicals. If a pest control agency comes down your street, they won't be spraying these dangerous chemicals into your air, into your environment. And mosquitoes, along with environmental impact and geographic distribution, with climate change, we are finding mosquitoes in places that mosquitoes haven't been before. With temperatures changing in various locations, if places are getting hotter, those places are starting to see certain kinds of mosquitoes. Places that are getting cooler, mosquitoes are starting to be able to withstand cooler environments and stuff like that. So it's really kind of important that we study these mosquitoes and study where they're going to be distributed in the future so that we can study potential disease spread, potential environments that they are going to kind of morph into taking on. So the aims of this study, so in my lab, I was able to do some trials that involved temperature and carbon dioxide in combination. So I did some warm temperature and some cold temperature studies, and then also color in combination with carbon dioxide to see if the female mosquitoes were preferring darker colors, whether that's skin color or clothing color, or even if you're just a shadow off in the distance, if they perceive that as a blood host, if they're attracted to that. And then I will also be talking about another study done by Howe in 2012 that talks about lactic acid in combination with various other attractants. However, due to this horrible COVID crisis, what we see here in red is what I wanted to get to, but I could not get to yet. There was no ability for me to do this from home because, well, I can't bring an olfactometer into my house. And if that word confuses you, I will get into that in just a minute here and show you exactly what our olfactometer that we used in our lab looked like. But first, we got to talk about the mosquitoes and how we rate them. So in our lab, we use Aedes albopictus and Aedes aegypti mosquitoes from a strain in Gainesville, Florida. We hatch these eggs using deoxygenated aged tap water, so meaning we put the tap water in a little tub, and we let it sit for about 7 days so that all of the harsh chemicals that we find in tap water and stuff kind of evaporate out. And then we let the deoxygenated water sit with the eggs for about 45 minutes to an hour, and then we count about 200 larvae, not about, exactly 200 larvae into each pan so that we know exactly how many we are hatching at a time. And the pans are approximately 18 by 12 by 3, and so we keep it at 200 so that they're not dwarfed because of overcrowding. Pupae are fed and then all the larvae is fed, and then as they metamorphose into pupae, we pick them after about 10 days after hatching, and it can be anywhere from 9 to 11-ish, maybe 12 if it's taking them a little bit longer to kind of go on to that next life cycle stage. And the temperature of the incubators are 27 degrees plus or minus 2 about. And then there is a 12-12 light dark cycle going on as well in our incubators. Sugar water for the mosquitoes, our adult mosquitoes, are replenished every 2 days or so, and I use unmated female mosquitoes for my research. So for the 2 cage tests that I'm going to be talking about today, we use 2 side-by-side of these 12 by 12 by 12 cages that have acrylic, clear acrylic, and mesh. The mesh is where you will insert a hand. Sorry, I don't know what that was. But so we'll use 2 of these cages, and in each cage were 20 female Aedes albopictus mosquitoes, unmated and never been blood fed, so these are virgin mosquitoes. And we use video recordings to capture each of the tests, and then we reviewed the videos later for accurate tallying. All tests took 10 minutes. So for black versus white, what we did is we did a black glove in one cage, and then we did a white glove in the other cage, and both were nitrile, so the only difference between the gloves were the color. And so I had a volunteer put the gloves on and have their hand in the cage. Promise they didn't get bit, at least they didn't admit to me that they got bit at all. But we were just testing to see if the mosquitoes were landing, purely just tallying any time that the mosquitoes landed on a certain hand. And then for the same setup, we did temperature tests. So for that one, we used baby blue nitrile gloves because those are the gloves that we use during rearing and just regular handling of the mosquitoes. So that's what they should be used to seeing as the control. And then the only change was the temperature of the hands. So we did one trial where one hand was heated and one hand was kept at body temperature. And then the other hand was cooled with ice, and then the other one was kept at body temperature. Second, we had our olfactometer tests, and these were the creme de la creme. These were my favorite. And so the olfactometer conditions were kept at 22 degrees or 27 degrees plus or minus 2. So we liked it in that nice ambient temperature range. It's a little bit warmer than room temperature. Typically, room temperature is about 21 degrees Celsius. The humidity was kept at 50 to 70% in there, and then there was a wind speed being pulled through the olfactometer at 1 to 2 miles an hour. So we used mosquitoes within 24 to 48 hours after their emergence, and we used only 20 females per trial, and all trials were done in the mid-morning. So once the mosquitoes were put into the release chamber here, they were allowed 5 minutes to acclimate to the temperature conditions, the humidity, the wind speed. And then after that 5-minute period, we added the stimuli. And so they had 5 minutes to orient themselves towards the stimuli. And then after that, the testing period lasted for 16 minutes. So black versus white. So here we see our funnel traps and then our stimuli chambers. So each of the funnel traps were covered in either black or white at random. And then for temperature, one of the stimuli chambers had either hand warmers in there to raise the temperature to 40 degrees plus or minus 5, or kept at the 27 plus or minus 2. So here is a little sketch to make a little bit more sense of our olfactometer. So number 1 is where our fan would be that pulls the air through the olfactometer. The wind will be traveling from left to right of this image, and then mosquitoes will be traveling from right to left through this image. Number 2 is the release chamber, where we have the mosquitoes acclimate, and then we use a manual release, kind of like a drawstring mechanism to release the mosquitoes. Number 3 is the flight tunnel that had the wind speeds of 1 to 2 miles per hour. 4 were those traps that I was showing you that had either the black or white coloring over it, depending on if I was doing the color test. And then 5 was where we had the heat or cold stimuli in there. And then 6 is where the humid air is pumped into the olfactometer. So for our statistical analyses, we pooled the trials for both cage tests and olfactometer tests. And for both kinds of tests, we used the G-test of goodness of fit. So let's get into the meat. Alrighty, so for our 2 cage trials, we did 3 different tests. We did that black and white, that warm versus standard body temperature, and then that cold versus body temperature. So for the black and white, our evidence wasn't very significant enough to show a preference towards black or white. So that was that one kind of wasn't enough for me to reject my null of me. I was expecting black to be the more preferred gloved hand, but I don't have enough evidence to support that, and that's okay. That sometimes happens in research, and that just means that more needs to be researched in that spot, or it's something that doesn't need to be researched at all. And then for the warmer temperatures versus the regular body temperature, yes, there was a preference towards the warmer hand, but it wasn't statistically significant enough for it to be a slam dunk. But however, with the cold body temperature versus the standard body temperature, the mosquitoes loved landing on that hand. And that could be evident towards the Aedes albopictus, mosquitoes being a more like a cooler, foresty, more humid type environment mosquito, whereas the Aedes aegypti mosquitoes we'll talk about in a second are a more hot and dry, kind of deserty inhabiting mosquito. So here in our 2-port olfactometer trials, in our top graph, you can see the Aedes albopictus mosquitoes. Again, didn't really prefer the hotter temperature over the cooler temperature. So that kind of follows suit to what we saw in the 2 cage trials. But with the Aedes aegypti mosquitoes, they loved the warm temperature. That is a very significant data point there, and it could be a little glimpse into the preferences of these mosquitoes in their microhabitats due to that desert versus forest kind of environment. But when we tested the Aedes albopictus mosquitoes with the black versus white, we saw the same thing, that there was really no preference one way or another over the black or the white. Excuse me. And so here we can see a little bit better of a breakdown with capture rates here. So for the black and white, the capture rates really aren't too different. All of our trials were done in triplicate. So we got the average means of the numbers captured from each, and then the capture rates here are not too different. The warm versus ambient temperature, you can see that there is a little bit of a preference for those Aedes albopictus mosquitoes towards the ambient temperature of 27 plus or minus 2 degrees Celsius, but still it's not statistically enough to completely support that they only prefer the ambient, and it's obviously not enough to support that they prefer the hot. Whereas here with the Aedes aegypti mosquitoes, you definitely can tell that they preferred that hotter temperature over the cooler one. So here is that study done by Howe in 2012 over lactic acid in different combinations. So dichloromethane is not emitted by the skin on a human being, but it has a sweet aroma that is very attractive. And when in combination with mosquitoes, it is the most attractive of things listed here with 43.8%. Lactic acid in combination with acetone, which is a chemical that is emitted by the skin on a human. It's also very attractive at 40%, but when lactic acid alone wasn't nearly as attractive as the other two. And then human odor for comparison was 31.2%. So there we can see that lactic acid is a good attraction, but pretty much when it's in combination with other attractive chemicals, that's when it's the most attractive. And that can be used in future studies as well. And we can even test that in our lab someday, maybe, probably the next group after me. So further research is probably going to be done by someone in our lab once I leave, is that female attraction to males of the same species. I'm kind of exploiting that swarming behavior, and then female attraction with females of a different species, which can be also exploiting their blood host seeking abilities, and then allowing kind of just feeding off of each other, letting someone else do the work for you. So why is this all important? So if we study these attractants, and then if we even get down to the species level of specific attractants that are more attractive to one species over another, we can develop traps that exploit these natural host-seeking behaviors in order to develop population control measures and traps to reduce dangerous pesticide use, and then it makes the environment safer and healthier, as well as reduces the amount of mosquitoes that are out there to transmit those diseases as dengue and yellow fever and whatnot. So hopefully you guys take away from this that mosquitoes aren't as bad as you think, and thank you all for listening.
Thank you, Kenzie. A wonderful presentation. Daisy, are you up next? There you are. Hi.
Hi.
So as Daisy is pulling this up, I'll just remind everyone that we will stay muted and with our cameras off until after all three panelists have presented, and then we'll jump right into the Q&A. And it looks like Daisy's ready to go.
Awesome, thank you. So hi everyone, my name is Deisy Rosales, and my honors thesis is on traditional Chinese medicine as an alternative to treating asthma and allergic rhinitis in children. So we are all familiar with the Western medical system, which is our healthcare system, that does not really consist of many integrative or alternative options. Eastern medicine, such as traditional Chinese medicine, has been doubted in its efficacy. It itself, with other alternative systems of medicine, have been seen to be energy medicine that is based on traditions, beliefs, etc. Thus, this is one of the misperceptions of these systems that is to why it is not widely known yet or incorporated in our healthcare system. Even though the research is very limited, especially with the use of traditional Chinese medicine in children, the studies that we'll go over with you today are very promising, and not only for overall health in these children, but also for the field of complementary and alternative medical systems. So the Western and conventional medical system that we are accustomed to is based on the philosophy created by Descartes, where he views the human body as separate from nature. He also, in this philosophy, he includes that the human body works kind of like a machine. So for instance, let's say you have an earache, you go to the doctor, you would most likely be treated for your earache and anything else that is related to that. They won't really evaluate your mental, emotional, or other states of your health. A little background in traditional Chinese medicine. It's been used for thousands of years. It goes back to the Shang Dynasty, where there were a few tortoise shells that were found with writings of traditional Chinese medicine. It wasn't until the 19th century when Chinese immigrants migrated to the U.S. for the California Gold Rush, but it was until 1971 when James Reston, a New York Times reporter, was in China, and he had to undergo an emergency surgery for his appendix. After his surgery, he received acupuncture, and he was able to see the benefits that it brought him to his body and his overall health. Once he returned to the U.S., he wrote an article in the New York Times about his experience with traditional Chinese medicine, and that was one of the first few times that the general American public was introduced to this medical system. So, as opposed to conventional medicine, traditional Chinese medicine views the human body as part of nature. It views that humanity cannot really be separated from nature because we are nature itself. So everything in this matrix or life is all connected and mutually dependent of each other. So in nature, we can see processes, cycles, and conditions that exist, and these same patterns are seen in the human body as well. One of the main concepts in traditional Chinese medicine is qi, and qi is defined as the life force that is present in nature and in human bodies. It is responsible for moving the blood, water, and other bodily fluids inside the body. Even though it is an invisible substance, it is a motive force that manifests itself in all living entities. It can manifest itself as all physical and mental activities, such as sensing, cognitive functions, feeling, digestion, and more. And in traditional Chinese medicine, when there is illness, it can be caused by a lack of qi or an excess of qi in the body. So overall, when there is a disturbance of qi or this life force, that is what causes the illness. And for qi to flow through the body, there are meridians known as Jinglu, which is a channel system that connects all aspects of the body. It can follow the muscles, clasp between the muscles and bones, and it collects in small hollows and depressions of the organs in the body. And these meridians can be compared to blood vessels and capillaries. So even though they are not visible like such, and they don't really follow like the blood pattern, it could be seen as like a kind of like a highway system for the energy, which is known as qi. So asthma in children, let's go into that. The prevalence in asthma in children has been increasing. So according to the CDC, 1 in 12 children experience asthma in the US. So that brings it about to 6 million children that are affected by that. And 1 in 2 of these asthmatic children experience asthma attacks. So what is asthma? Asthma is known to be one of the most chronic respiratory diseases among children. The chronic diseases, this disease affects the bronchial trees of the lungs, and it causes an obstruction of the airway, which is then caused by a hyper-responsive response due to various stimuli such as allergens and other nonspecific triggers. And these triggers initiate the production of eosinophil infiltrates, IgE antibodies, and pro-inflammatory cytokines. All of these can also be measured in the blood. So when it comes to research, specifically, a child or an individual that is experiencing asthma or has a high, it's a very severe asthma, they have higher levels of these in their blood. So as a result, the common symptoms that are associated with asthma in children is wheezing, chest tightness, dyspnea, and coughing. There are a few treatments that are used in conventional medicine for asthma in children. The two categories are quick relief medications and controller medications. So the quick relief medications are also known as reliever medications. They're short-term and directed at targeting the symptoms and bronchoconstriction. Examples of these short-term medications are something like albuterol, and they are also known as beta-2 agonists or SABAs. And the mechanism of these medications is through the activation of B2 adrenal receptors, which then stimulate the bronchodilator effect for approximately 4 to 6 hours. There are a few side effects that have been noted with the use of SABAs in children. One is that it has been shown to have low efficacy in children under the age of 2. And since these medications are used for long term, it increases the risk for the side effects of tremors, tachycardia, and palpitations. The other category of medications used in asthma in children are controller medications, which include inhaled corticosteroids and long-acting beta agonists, or LABAs. So inhaled corticosteroids are designed to manage mild, persistent to severe asthma. there have been a few side effects that have been found with these. One is that it has been shown to affect the long-term growth in children, and it affects their adult height. It has also been found to suppress the hypothalamic pituitary adrenal axis, regardless of the dosage or how long it was taken. So this HPA axis consists of the hypothalamus, pituitary glands, and adrenal glands. And this axis takes part in a few important functions in the body, such as the immune system, digestion, and more, but is mainly known for the role in the stress response since it produces the hormone cortisol. And the other type of controller medications are long-lasting beta agonists, or LABAs, and they have a much longer bronchodilator effect that can last from 12 to 24 hours. These medications are usually recommended for the maintenance and treating pediatric asthma, along with inhaled corticosteroids, when asthma itself cannot be controlled by the inhaled corticosteroids. So there are a few side effects. One is that there is a concern with the use of LABAs because it can actually mask the patient's perceptions of a worsening asthma. So since it does treat the symptoms, it reduces the symptoms, but it doesn't really reduce the severity of asthma. So therefore, the use of LABAs and inhaled corticosteroids do not really provide a reduction in the severity experienced in children, and there is no really an improvement in quality of life or a reduction in the use of these medications. So traditional Chinese medicine can be used to treat asthma in children as well. One of the ways that traditional Chinese medicine can be used is through herbal granules. So in traditional Chinese medicine, asthma is seen to be the deficiency of qi in the lungs, spleen, and kidney. So therefore, the treatment approach would then be to tonify the qi and kidney and replenish the spleen. These herbal granules consist of several Chinese medicine herbs that all are combined to treat the asthma through tonifying the qi and the kidney and replenishing the spleen. So a clinical study done in 2016 in China put this to the test. Children from ages 2 to 5 years of age took these herbal granules twice daily for 3 months with no other treatments, and the results show that the airway resistance was decreased even 9 months after treatment. Traditional Chinese medicine has also been shown to significantly lower the severity and hospitalization frequencies among children treated for asthma. Another way to treat asthma in children through TCM is through combined traditional Chinese medicine therapies. So in 2014, the Taiwan government sponsored a program called Project of Outpatient Healthcare Quality Improvement with Combined TCM Therapies. And the combined TCM therapies used were herbal drugs, acupuncture, massage, herbal pastes, and music therapy. And in this study, they evaluated 190 asthmatic children from 6 hospitals that were in this program. They also measured the IgE levels in their blood and measured their pulmonary function test as well. The results show that the emergency visits and hospitalizations were decreased, and the IgE levels in their blood was also reduced. And it also found that overall pulmonary function was also improved even 3 months after treatment. So these results show that the combined TCM therapies did not only reduce the symptoms experienced, but also improve the lung health and improve the quality of life. Allergic rhinitis is also a reaction that is very common in children and has a treatment approaches by both conventional and traditional Chinese medicine. This condition can often also coexist with asthma in children since it also affects the respiratory system. So an exposure to either indoor or outdoor allergens such as pollen, dust mites, insects, and others can stimulate the allergic rhinitis. So what is allergic rhinitis? At the cellular level, the exposure to allergens causes a cascade of inflammatory response. So there are 2 types of responses. It can either be immediate or late phase. In the immediate phase, it's usually very acute and it causes a small production of a nasal mucosa, so essentially just like a runny nose. But in the late phase, it happens hours after exposure to the allergens, and it causes a continuous inflammatory reaction, and which essentially causes a hyper-responsive production of nasal mucosa, and it obstructs the airways, as we can see in this lower diagram. The majority of children that have allergic rhinitis, though, experience the late phase reaction, which can last up to 12 hours after being exposed to the allergen. And the symptoms experienced are usually a runny nose, itching, sneezing, dark circle under their eyes, and nasal congestion. The inflammation and the lack of drainage in the body can also lead to other complications in children, such as infections. So conventional medicine has a few treatments for allergic rhinitis in children. The two categories are antihistamines and nasal corticosteroids. So antihistamines are one of the top treatments for pediatric allergic rhinitis. They are mostly common in the treatment and prevention of itching, sneezing, and runny nose. They can be taken orally or through the nose and are both effective with a rapid onset of action. Overall, these antihistamines are safe and effective for children with no reported adverse effects. The only restriction that comes with the use of these antihistamines is that it is not really effective when reducing the nasal obstruction, which is essentially the real problem. The other category are nasal corticosteroids, which are designed to reduce the inflammation in nasal passages and generally considered safe. The only concern that comes with this is, as I mentioned earlier, with the inhaled corticosteroids, is that it is known to suppress the child's HPA axis. So traditional Chinese medicine can also be used to treat allergic rhinitis. And one of the ways is through acupuncture, which is one of the therapies known in traditional Chinese medicine. In a double-blinded randomized placebo-controlled trial performed in 2004, the use of acupuncture for children with allergic rhinitis was evaluated. So children of 6 years of age and older participated in the study with a treatment group receiving acupuncture for 8 weeks. And in this study, they recorded nasal symptoms and the severity of asthma. They also measured the total blood IgE levels in their blood. And the acupoints that were used were Ying Tang, which is like a point in the middle of the forehead, and Shang Ying Zing, which is a point on the side of the nose, and Su Zong Li, which is a point in front of the knee. The results of the study showed a significant decrease of daily rhinitis scores, even 12 weeks after treatment, and there were no serious adverse effects that were identified either. So it is evident that the use of acupuncture in children for the treatment of allergic rhinitis significantly decreased the symptoms experienced by allergic rhinitis. So what can we take away from all of this? Even though the research on traditional Chinese medicine in children for asthma and allergic rhinitis is very limited, the studies that are available are very promising, not only reducing the symptoms and severity, but also improving overall health. Furthermore, I believe that there is a great need for further research in this area, not only to promote the overall health in our children, but to also raise awareness on these amazing complementary and alternative systems of medicine, such as traditional Chinese medicine. So thank you all for being here and listening to my presentation, and special thanks to James Gilchrist, who was my advisor. Thank you.
Thank you, Daisy. That was great. We are excited to engage with you in the Q&A. Right after Sophia. Sophia, are you there?
Yes, I'm here. So I just wanted to tell everyone that I have to stream my presentation, so I'm not going to get on camera during this part. I'm just going to try to get the presentation to get going. It's probably going to be like maybe 10 to 15 seconds of buffering, but once it loads, I will play it. So I'm going to mute myself and get my presentation going. Oops.
Okay, we're looking forward to it.
Hello everyone, my name is Sophia Nem. I'm a senior in the MSU Denver Honors Program, and today I will be finally presenting my honors thesis that I've been working on for the past year. It's titled The Early Detection of Acral and Subungual Melanoma, a proposal on education protocols for increasing awareness and referral patterns in nail salons. Whew, that was a lot. But before we dive in, let's start at the beginning. What is melanoma? Well, melanoma is actually the deadliest form of skin cancer. And it's actually ranked at about 15th for most common cancers worldwide. So to keep things simple, melanomas generally begin in cells called melanocytes. And these cells actually produce pigment, aka melanin, that gives us our beautiful skin color. And just like any other cell in the body, it's subject to proliferation and becoming cancerous, which would then present as a clinically abnormal area on the skin, which would later be diagnosed by a medical care provider as melanoma. So now we know what melanoma is, but what is the difference between acral and subungual melanoma? Acral melanoma is a rare form of melanoma that occurs on either the hands or the feet, while subungual melanoma, which is a rarer and subvariant of acral melanoma, occurs on either the fingernails or the toenails. So we know what acral melanoma is, and we know what subungual melanoma is, but why do we care? Well, I'm glad that you asked. Although acral and subungual melanoma are really rare forms of melanoma, they're deadly. This is very much reflected in their 5-year survival rates. When we look at general cutaneous melanoma, we find a 5-year survival rate of about 91.3%. It drops down to about 80.3% in acral melanoma and even lower to 40% in subungual melanoma. This is due in part to delayed diagnosis. Not only are acral and subungual melanoma particularly difficult to diagnose, when we add in factors such as limited patient knowledge, lack of awareness of lesions on one's body, and also access to skincare experts who are experienced in diagnosing these forms of melanoma, we run into a bigger issue. This is where advancement and metastases become a really big problem. When we have delayed diagnosis, we allow melanomas the chance to advance in severity or even worse, metastasize to other portions of the body. And once we reach this state, treatments become pretty aggressive. For acral melanoma, treatments can involve wide local excision, which involves taking either a 1 to 2 centimeter margin around the melanoma site, which is pretty invasive. And for subungual melanoma, it can even involve amputation. So these two deadly forms of melanoma are diagnosed at advanced and metastatic stages due to delayed diagnosis. So what do we do about this? Research has supported that prevention via screening has a beneficial impact on melanoma-associated mortality, and prevention can come in a number of layers. Primary prevention involves catching things before they're actually melanoma, while secondary prevention involves diagnosing melanoma in its early stages. And you can either choose to educate the general public, or you can choose to educate high-risk populations that are more at risk of developing melanoma. And prevention is where my thesis comes into play. But how exactly did my thesis come about? What do acral and subungual melanoma have to do with nail salons? Well, lucky for you, there's a story. I've actually been a medical assistant at a general dermatology clinic for almost 4 years. And during my time there was one thing that I always noticed as I was scribing during full body screenings. Patients seemed to be unaware of what acral or subungual melanoma were. But of course, at the time, that was purely anecdotal. So I thought to myself, if our own dermatology patients are unaware of these melanomas, what about the rest of the general public? And then it dawned on me. I thought back to what the PA and dermatologists that I work for would always say to patients every time they had a skin exam. Barbers and hairdressers are some of our best patient advocates, and there has been research that showcased the ability of hairdressers to identify melanomas that patients couldn't easily see. So I figured, why not extend this to nail salon professionals? People who spend more time with their hands, feet, fingernails, and toenails than we might, with the aim of creating educational protocols that can be utilized in nail salons to educate the public. So how did I do this? I'll break it into 4 parts. First, I needed to figure out if patients knew what acral and subungual melanoma are. Second, I needed to figure out common medical sources that patients were getting information from. Third, I needed to figure out how patients actually preferred to get their medical information. And fourth, I would propose some form of education protocols based off of the previous data. Research took place in a general dermatology office, and we utilized a convenience sample of 81 patients. In regards to frequency, research took place 2 times a week over a period of 4 weeks. When I was the medical assistant for a patient when they came in for an appointment, I would first get their chief complaint and address everything that they were in for. I would then proceed to ask the patient if they would like to participate in my research. If they agreed, I would provide them with an informed consent, outlining my research and what would be expected of them, and provide them with an anonymous survey to fill out. The survey that I developed utilized a mixed methods approach. I had multiple choice and short answer responses. The multiple choice questions served as a yes or no, do you know this or do you not? While the short answer response questions allowed me to paint a bigger picture and elaborate further on yes or no answers. I also asked for demographic information in order to describe my population. Once survey responses were collected, they were input into Excel and tabulated for analysis. So what did I find? Well, first, let's start with the demographic data. In regards to sex, I found that majority of my population was actually female at 61.7%, and males were much less at 35.8%. In regards to age, I found that my population generally trended towards older, with about 23.4% of the population being in the 50 to 59-year-old age range, even 18.5% in the 60 to 69-year-old age range, 17.3% in 70 or older, but there were a considerable amount of people in the lower age ranges like 18 to 29, 30 to 39, and 40 to 49. In regards to race, the population was predominantly white at 88.9%, with all other races numbering less in comparison. In regards to income level, majority of patients did not want to disclose how much they made annually, but we still see a trend in individuals being higher income, with 19.8% of individuals being in the $100,000 to $149,000 income level, and 18.5% of people being in the $150,000 or more income level. In regards to education level, I found that majority of my population had some form of education, whether it was some college, a master's degree, high school education, 4-year university education, vocational training, and even doctorate PhD schooling. Now we get to move to the fun stuff, the anonymous survey. When looking at general acral and subungual melanoma knowledge, I asked patients, do you know what acral melanoma is? And majority of them said no at 91.3%. Similarly, I asked patients, do you know what subungual melanoma is? And 86.4% of people said no. Next, I asked patients, would you like to know more about acral and subungual melanoma? Why or why not? And majority of patients said yes at 72.8%. And while it's good to know that patients wanted to know more, I wanted to know why. So, I asked. Of those who said yes, they would like to know more about acral and subungual melanoma, I found a few interesting trends. The first was knowledge. Patients reported knowledge is power. The more I know, the better. I like to be informed. I want to know about all types of cancers, and it would be beneficial for me to know the signs to watch for. The other trend was family history. Patients reported, it's important to me because I have a family history. I have many moles and I have a family history. My sister-in-law had melanoma and survived, and I've had atypical results and would like to be knowledgeable. For those who said they would not like to know more about acral and subungual melanoma, there was one general trend that I noticed, which was no personal need. Patients reported, I am not fair-skinned and do not have a family history. I figured if I was affected, I would know, and there's no point in scaring myself, and unless it's a concern, I have other things to be researching. Next, I looked at primary medical information resources. I asked patients, where do you normally get your medical information? And majority of patients reported that they got their medical information from their medical provider. A good majority of patients also reported that they got their medical information online, and that was followed by printed materials, by word of mouth, TV, and other. Next, I looked at preferred education methods, and I asked patients, what teaching method do you prefer, and briefly explain why you prefer this method. Majority of patients reported that they preferred one-on-one teaching at 49.4%. Graphics and visuals came second at 27.2%, and fact sheets came third at 25.9%. Pamphlets or brochures and YouTube videos were tied at 18.5%, and the other materials such as videos and DVDs, posters and charts, PowerPoint presentation, and other fell short. And just like I wanted to know why people wanted to know more, or did not want to know more about subungual and acral melanoma, I wanted to know why patients preferred certain teaching methods. So of the top 3 preferred methods, I noticed a few trends. And of those who said they preferred one-on-one teaching, the ability to ask questions was a huge factor. Patients reported, I prefer individual methods because questions are asked freely. I can ask questions as we go. I can ask more questions to clarify, and I'm able to ask follow-up questions. In regards to graphics and visuals, patients reported that they were visual learners. They said, for me, seeing is the best. I'm an artist, so visual learner is the way I retain better. In terms of medical cancer, if I saw pictures, I could identify it and visual cues stick in my memory more. In regards to fact sheets, easy reference was a big determinant of preference. Patients reported, I enjoy reading and I can keep fact sheets for a reference. I like quick info sheets and I don't have to spend more time on it than necessary. So what were we supposed to get out of all of that? First is that patients seem to be unaware of acral and subungual melanoma. And this was slightly alarming, as my convenience sample consisted of dermatology patients who have been in the realm of dermatology, have been educated multiple times throughout their appointments about skin cancer, yet they were still unaware. But what was promising is that patients wanted to know more. And this showcased that there was a niche that needed to be filled with education protocols for these forms of melanoma. Next, we found that patients obtained a lot of their medical information from either medical care providers or online. And this is problematic in a number of ways. First, if patients are only receiving medical information from professionals, it's great, but if they don't have access to these people, then potentially they're getting that information online, which can be very problematic as not all online resources are credible and or reliable. Last, we found that patients prefer one-on-one teaching, graphics and visuals, and fact sheets, which would be all great things to implement in a proposal for education protocols. So what do I propose? The first is the development of a seminar for nail salons that would teach nail salon professionals how to identify abnormal lesions and how to direct their clients thereafter. Second, I propose that these graphics and visuals and fact sheets be provided to nail salons at free or low cost as an aid when they're educating their clients. And last, a referral network amongst nail salons and dermatology clinics should be set in place so these nail salons have somewhere to send their clients when they identify an abnormal lesion. Just like any other research, my study had limitations. One was time constraints. I didn't have enough time, so I didn't give enough data. Had I had more data, maybe my results would have been different. And this leads to the elephant in the room, which is the diversity of my population. The demographic represented in my study was white, educated, and high income. And that's not necessarily representative of the general public. And because it's not representative of the general public, the proposal on education protocols that I made may not be something that can be utilized for the general public. So while my data solidified something such as lack of awareness of acral and subungual melanoma and the want to know more about acral and subungual melanoma, preferred education methods and medical information resources may not be as representative of what's actually sought out by the general public. But luckily, my research was the start of a bigger conversation, which is how can we utilize other people in different fields to help spread knowledge about melanoma. And that's a conversation that can be continued far beyond my own research. So what does the future of acral and subungual melanoma look like? Well, we need to make sure that we educate diverse populations. My research showed that dermatology patients may be skewed to being white, educated, and high income. And this is a problem. We can't leave out individuals because they don't have access, so we need to find ways to educate these populations, and that could mean the actual development of an education protocol that I proposed. If we're able to use these protocols in action in nail salons, we could reach a wider range of people and spread melanoma knowledge across different communities. Finally, we can recruit other non-healthcare professionals like tattoo parlors and massage therapists also as advocates like we would with nail salon professionals. I would like to thank Dr. Sinley for all of her guidance throughout my thesis process. I would like to thank Dr. Hughes for all of her advice and encouragement. I would like to thank Dr. Petkoff for his assistance with my written thesis. And finally, I would like to thank my mentors in dermatology clinic for allowing me to conduct research. Here are my references. And finally, I would like to thank everyone who took time out of their schedule today to be here for my thesis presentation.
Thank you, Sophia. And thank you to all three of our panelists. Wow, this is great. Yes, I'm hearing some applause. We will definitely take time to do a group applause at the end, but I'm already hearing it, and I'm with you. I know we're running a little bit late, which is why I want to move us right along into the Q&A, but we have 15 minutes between the panels, and we will learn as we go in terms of how much time it actually takes to do this online, apparently more than we thought. So let's jump into the Q&A, and if we need to take the 15-minute break to use as the Q&A, that's fine. I think we just go ahead and do that, and then we'll move into panel 2 after a shorter break than we had intended. But we want to give everybody time to ask questions. So I'm seeing some questions already in the chat. I know we have a couple that we fielded along the way. And so the first question is from Dr. Ravi Mahalingam for Kenzie. Is the surface of CO2 levels important? Is a surface CO2 level or levels important? Sorry, I misworded that.
CO2 levels as in like the percentage of like the CO2 in the air, or just CO2 levels at like a respiratory rate, if that can be clarified a little bit better. Because in my test, I just used breath, the human breath, as the carbon dioxide that I referred to in my PowerPoint. But there are definitely studies out there that go more in depth up to like percentage of carbon dioxide concentrations in the air they use. So I didn't focus on carbon dioxide more as it was a control measure to orient the mosquitoes to what they're supposed to be attracted to.
And Robbie, feel free to jump in if you're here. There's one thing I wanted to say too. What we always do at this point is to make it clear that advisors for these students are invited to make sure that your questions get asked and answered at this point as well. We usually invite advisors when we do this event in the caveat to ask the first round of questions. I'm seeing a couple of other things pop up. Also for Kenzie, have you thought about, actually we're getting back from Ravi, skin is the word that I see in the question. Does that make sense to you, Kenzie?
I'm sorry, one more time.
What I'm seeing my moderator say is that Ravi's answer is skin. To your clarification, your request for clarification. Okay. Got it?
Yeah, carbon dioxide is not referring to skin, it's referring to human breath.
Cool. Also, another question for Kenzie. Have you thought about testing the scent of people with autoimmune disorders versus for people with non-compromised immune systems? A question from Brianna Winkler.
That's a great question, Brianna. And I have not. No, in my lab, we used people that were non-compromised. Both myself and Sean Ward were the ones either breathing into the tubes, or he was the one that was having his hands stuck into the cages. Neither of us are immunocompromised, so that would definitely be something that could be tested. Probably much more at a grander scale. We would have to get IRBs and that kind of stuff. So.
Great. And Ravi responds that there seemed to be a notion that some people have higher CO2 levels on their skin, just as a follow-up there. Daisy, there's a question for you. Have you looked into the benefit of acupuncture for other medical conditions, such as chronic pain and other respiratory issues? If so, what have you found? That's also from Brianna Winkler.
Okay, yeah. So for the purpose of my thesis, I mainly focused on asthma and allergic rhinitis in children. Acupuncture has been found to be effective for many chronic diseases, from like rheumatic pain, for migraines, and for other chronic diseases as well. But yeah, for this, for my thesis, I just focused on that.
Great, thank you. So question for Sophia. Do you know how the 5-year survival rates for these melanomas differ across groups with different socioeconomic status? Question from Rachel Sinley.
Thank you for the question.
From Dr. Sinley.
I actually didn't look into that. I know that for acral and subungual melanoma, a lot of times we see it more predominant, specifically for acral melanoma in Asian races and then also in African American races, but I actually didn't look at the 5-year survival rates across different races and socioeconomic statuses. But I would love to for future research.
Great. I'm not seeing another question pop up yet in the chat, but I invite the audience, if someone has a question, you're welcome to unmute yourself and ask the question as well. And also, I just wanted to acknowledge that there is a bit of a lag between the two. The YouTube live stream is a little bit behind the teams, so there may be some questions that come in a different order as we go through this process. I'm seeing some comments here. Okay. Just a little bit of a dialogue going on those questions for Kenzie, but the same questions are there. So for Sophia, do you have, this is a question from Dr. Petkoff. Do you have any information about these cancers in men versus women?
I do not have any information on that per se. I know that working in a dermatology clinic, I kind of get like bits and pieces of knowledge from the docs and the PAs that I work with. I know that for melanomas, like certain areas are more prominent in men than women. Like for men, melanomas are more prominent on the back, and then for women, we statistically find it on the backs of the legs for women. But I didn't actually look into the acral and subungual melanoma in regards to the differences in men versus women, which would also be good for future research.
I have a question for all of you. Just a little bit about the impact of this semester and having to do your work in a different way and not being able to work on campus. Could each of you say just a little bit about how that impacted your research?
Yeah, sure. I guess I'll go first. It's rough. I mean, I only have half of the research that I planned to do this semester because of all the closures and stuff, and it was very disheartening, but I was still really glad that I was able to still get the opportunity to present what I had, and hopefully whoever's in my lab next after me will just kind of pick it up where I left off, and you guys will see the rest of this research in the future. But it was rough, because we weren't sure for a while if anybody was going to be able to get into the mosquito lab. But luckily, I think Dr. Hancock has limited access enough. So yeah, that was not fun.
Yeah.
I'll second what Kenzie said. My research was off campus at the dermatology clinic that I work in, but because of COVID, the IRB shut down all research that involved people, and so then I couldn't survey any of my patients anymore. And so then I had 81 patients, but I wanted as many as I could get to, make the data more reliable. I was kind of like bummed. I wasn't sure if the results that I got actually were really indicative of anything. So I would have had differences had I had 200 patients that I surveyed. So I was kind of bummed about that, but I was glad at the ability to be able to do it and to actually curate my own thesis. So I'm still thankful for that part of it.
Yeah, I didn't really have much complications just because of the nature of my thesis was like a literature review. So all the research I had to do was online, luckily. So yeah.
Thank you. I think this is an important part to recognize in all of these projects. Daisy, there's another question for you. Have you tried, or has someone you have known tried TCM? And if so, what was your or their personal experience with it? Did it help or not help? And this is from Daniel Lepiscopo, one of our students in thesis seminar.
Mm-hmm. So, sorry, I have like reread. So I have actually this semester I took the course of traditional Chinese medicine with Dr. Gilchrist, and we were exposed to different therapies that are used in TCMs. So like Qigong is one of like the simplest ways that you can do it, which is like a incorporation of like the mind and the body. And I've done that, like I did that for a while for like every day, and it like really improved the quality of sleep, my energy, and like my mood overall. And it's like, it's free. You don't really have to go to like, ND for that. You could just like watch YouTube videos. But in terms of like acupuncture, and no, I haven't had that experience yet myself. But I hope to do that soon. Yeah, I had an appointment scheduled, but yeah, COVID. So.
Right. I have another question for you, Daisy, from Colton Lee. From your observations, does racism play a role in how different medical practices are perceived?
Well, I guess I don't know if it would be really racism, but I think it's just like that misperception that, you know, the medicine, like acupuncture or like traditional Chinese medicine or Ayurveda or herbal medicine is kind of like, you know, like not based on research, or it's not based on facts. It's mostly like energy or, you know, on beliefs or traditions, and doesn't really have much research behind it. So I think that's the main reason why it's like perceived the way it is.
Mm-hmm. Thank you. I see a question in the chat that I don't think is actually a question, but I think it's about if the mosquitoes in your lab are missing you, Kenzie.
I responded with a probably not, but I definitely miss them.
And we miss you, Eric. Shout out to one of our alums. Thank you for being here. Yes, Liz, go ahead and ask a question. Be brave, do it.
Hey, I had a question for the traditional Chinese medicine. So the one thing I kind of think of is, do you think it might be a little bit dangerous for people just to jump on board with something when there isn't a lot of science to back it up, when there could be medical treatments they could be doing instead? Because I think that's a part of what people are very hesitant to do things.
Mm-hmm. Yeah, of course. So I think before anyone decides to do any type of, you know, medication or prescribe themselves anything, they have to talk to their PCP, because it is all just based on each individuals, whether they have any chronic diseases or anything else. But once that they have an okay with that, they can also go to like a naturopathic doctor. And I would also like to say that naturopathic doctors have their licenses. They have the, you know, they've gone through their medical training. So it's not like you're going to like, you know, well, most places, obviously, anyone, wherever you go, you would have to do your research on who you're going with and make sure that they're credible and reliable.
Thank you.
Yeah, thanks.
We have time for one more question before we start to move on to the next panel. Anyone have a last question? Okay, so now we're going to do an experiment, which is if everyone could please unmute yourselves, and let's give this panel a big round of applause, or you can throw some applauding gifts in if you know how to do that. Thank you all. We're so proud of the work that you've done in this challenging situation, and we are excited to engage with it in other ways. So that everyone knows, these videos will be made available on the Honors website, and you can check them out again later. We are also, the students are working hard to get their written drafts of their thesis projects finalized over the next weeks, and those will also be on our website and in the digital archive in the Auraria Library once that's all finalized. So you'll have a chance to hear more from these projects if you'd like. Thank you, panel number 1. You did a beautiful job starting us off today, and we're very proud of you. So let's move on to getting panel number 2 queued up. And we hope some of you will stay with us and check out the next discussion. Panel 2 is called Reclaiming Heritage, Interracial Adoption, Mayan Linguistics, and Indigenous Literature. Coming up quickly.
Unknown participant is now exiting.
Do you want me to just hop on? And you're muted.
Thank you. I was typing furiously to my moderator, so I was trying not to be loud. Furiously meaning fast, not furiously. But so are you up first, Liam?
I think so, yeah. Okay.
So we'll wait for about 1 minute and give some instructions here, and then we will start panel 2. Andrew or Colton, would one of you want to post the full program one more time at the start here so we can mention that?
If Colton can do it in Teams, I'll do it in the YouTube.
Perfect, thank you. Okay, so we are going to go ahead and get started since we know that the technical aspect of this makes it take just a little bit longer as we transition from talk to talk. For those of you who are just joining us, my name is Dr. Megan Hughes-Zarzo. I'm the director of the Honors Program, and I'm really happy to welcome you all here today. This is such an exciting turnout already. It's really motivational to see all of you here out supporting these students today. And just shout out to all the advisors who have been helping with these projects, the students who've been working so hard to get them completed, our alumni who are here. Thank you all for being here. And students in Honors Thesis Seminar, thank you for being here. I see you're all out in mass today, so that's amazing. Thank you. And we're already getting compliments on your shirt, so ready to Okay, so just to let everyone know, we're going to get started. We ask everybody to mute your microphones and turn off your cameras during the talks, but feel free to already be putting questions. If you have questions that come up for each of the panelists, you can type those directly into the chat, either on Teams or on the YouTube live stream, and we'll collect those into a document and ask those during the Q&A. And you're also welcome to ask your question live during the Q&A, which we would love for you to do. So feel free to jump on during the Q&A and engage with our panelists. You can find a link to the program in the chat on Teams or on live stream on YouTube. And we are going to go ahead and get started, and I'll let the students lead the way. Thanks, Liam.
No, thank you. I'm gonna pull mine up. All right. So, my name is Liam Price. This is my thesis presentation called Vowels and Cultures, a Sociophonetic Analysis of Chort T Mayan. I'm a linguistics and anthropology double major at Metro. And I got involved in this work through my job at the ethnography lab. We'll talk a little bit more later on my personal involvement with the work. But for right now, the overview of this presentation is we're going to have 3 main parts. We're going to first try and answer the question, who are the Chort T? We're going to try and answer that in a couple of ways. Then we're going to answer the question, what is acoustic phonetics? And specifically, how does acoustic phonetics help answer my research question? And then finally, we're going to go over the findings and conclusion that I had. So the research question that I started out with was, have the Spanish and Chort T vowel spaces merged? That might sound a little bit abstract right now, but we're going to dive right into it. But let's begin with the Chort T. So there's a couple of different ways to answer this question. You can do it geographically, historically, linguistically, culturally. We're just going to kind of do a brief overview. Geographically, the Chortí people live in this region of the world. We can see this is Guatemala and Honduras, and the 4 departments that ethnic Chortís live in are Zacapa, Chiquimula, Copan, and Ocotepeque. Now, specifically, if we zoom in a little bit more, we can see this darkened area here is the Chortí speaking area. Our estimates say that there are about 20,000 Chortí speakers that live in this area in the towns of Jocotan, Camotan, and San Juan Ermita. Jocotan is where all of our research was done, Jocotan and in the surrounding villages. So let's look at a little bit of linguistic history now, just to help us zero in on who the Chortí are. The Chortí speak a Cholan language. It's important to recognize that. Oh, a lot of echo. It's important to recognize that that a Cholan language is part of the Mayan language family. We're talking about Mayan languages here. Now, the Cholan language branches off into Western Cholan, which has Chontal and Chol. These are both spoken in Mexico. We're really not going to talk about them much, but it's important to know that they exist. Now, in the eastern branch, we have Choltí and Chortí. Now, as you can see in this diagram here, Chortí, by most accounts, died off in the 17th century. But there is a little bit of, discrepancy here or controversy. Some people hold that Chortí didn't necessarily die off, it just evolved into Chortí in the same way that Latin evolved into Spanish. Again, that's pretty controversial. Right now, this is the traditional standard view of seeing things. Also, I'd just like to mention that the Mayan glyphs that we all know were written in a language somewhere in here. It's also very controversial specifically which language the glyphs were written in, but we're certain that it was written somewhere in here, which means that the Chortí speak the last living descendant of the Mayan glyphs, of the language of the Mayan glyphs. So let's look a little bit more at broader kind of cultural history. Due to some time constraints, we're going to kind of zoom past a couple thousand years of history and land right in about 1954. But if you would like a better, more in-depth analysis of the classic Maya period and this writing system, the classic Mayan writing system, then you'll just have to read my thesis because I don't have time to cover them today. But if we fast forward to 1954 in Guatemala, we have what is the end of the Democratic Revolution in Guatemala. Now, the Democratic Revolution was is classified by the election of 2 leaders, 2 presidents, and the popular disposement of one. So this general this dictator was disposed by popular demand, and then 2 democratically elected leaders took his place. These leaders had somewhat socialist leanings and were very interested in giving land back to indigenous Guatemalans. Specifically, Guzman, the second of the 2, fought very hard to get land back to indigenous Guatemalans. And sadly, this was again in the 1950s during the Red Scare in the United States, and America didn't like that very much. America didn't want socialist or communist leaning governments in this side of the world. So America began Operation PB Fortune under the Eisenhower administration, which included air raids in Guatemala and a misinformation campaign against President Guzman, and then culminated with the training and arming of an army to hold a coup d'etat in the capital of Guatemala and take over Guatemala and impose another dictator named Castillo Armas. Now, the beginning of Castillo Armas's reign is generally considered the beginning of Las Ruinas, a period, or the ruins, which is a period of Guatemalan history that is kind of categorized as a very dark and bloody section of history. It has war crimes and genocide, attempted genocide against Mayan individuals. The guerrilla fighters who were fighting against this new regime often recruited and lived in Mayan villages, and because of that, in certain parts of Guatemala and at certain times during the Civil War, or during this administration, which resulted in a civil war, speaking a Mayan language in public was actually a enough to get you executed in public. You were essentially, if you were Mayan, it was equivalent to being a guerrilla fighter, which meant that the government had a right to kill you in their eyes. So that had obviously left a huge stigma on Mayan languages in Guatemala. Now, the Civil War lasted for about 30 years after Castillo Armas was put into power, and the peace accords ending the Civil War were signed in 1996. So since then, since 1996, things have kind of started to calm down in that area. The Chorti, or Mayans in general, and the Chorti specifically, are no longer threatened by, sorry, there's a motorcycle passing, of course, are no longer threatened by US-backed air raids or war crimes. Now the Chorti are threatened by climate change. So in eastern Guatemala, it's become increasingly difficult to farm, where the ancestors of modern farmers could have gotten 3 yields, 3 harvests out of their crops. Now they're lucky to get 1. So this has created a little bit of an exodus out of eastern Guatemala into other parts of Guatemala, other parts of Central America, and of course the United States. Now this exodus, as we'll talk about a little bit later on, also has a huge effect on the language. So now that I've kind of laid out some of this history and set the scene for the linguistics that we're going to be talking about, so the linguistic scene, let's dive into the next part of this presentation, which is what is acoustic phonetics, and how does it help me answer my question of have the vowel spaces merged or not. So acoustic phonetics is the acoustic study of speech sounds. And as we can see, this is a tool that phoneticians use to complete that study. Up top, we have a waveform, which represents the peaks in amplitude. We have time on the x-axis down here, and hertz on the y-axis. So this is representing the peaks in amplitude in hertz. And then down here on the spectrogram, we have the density of these peaks in amplitude represented. The spectrogram is mainly what we're going to be focusing on, so let's zoom in a little bit more on the spectrogram. This is the word pach, which means lemon in English. And I'm going to play this recording. I heard it was a little bit quiet, but hopefully you guys can still hear it. So let's break this down a little bit further. We have all of these sounds, and then as we can see in these vowels, we start to get a little bit of a pattern where there are these 3 lines, or excuse me, there are these dark bands that begin to appear. And if we look even closer, we can see that we have these first 3 of these are what's called formants. Phoneticians use specifically the first 3 formants. We're going to mainly focus on the first 2, but specifically the first 3 to classify the vowels of a language. By measuring their frequencies and graphing them accordingly, we can see generally where in the mouth these are produced. So if we zoom in even further and just look at the first syllable, ba, we can pull out the measurements of these first 3 formants in hertz. So we have the first format at 703.8, second at 1374, and the third at 2161 hertz. By taking these measurements and then putting them all onto a huge spreadsheet, a very large spreadsheet, we get F1 and F2 here, and then F3 obviously on this, but like I said, we're going to be focusing mainly on F1 and F2. We put all of these into this big spreadsheet, and then we run it through some statistical processes, and we can get these graphs, which I'll show you in a second. But first, I want to kind of zoom out a little bit now and talk about how this data set, or how these data sets are gathered. And these data sets are gathered by talking to people. Linguists or researchers will put a recorder down on a table and hand a speaker or participant a word list and ask the participant to read the word list aloud. So the ethnography lab where I work has done 2 trips to Guatemala, one in 2017 and another in 2019, to collect this data. I was a part of the trip in 2019 and was able to collect the Spanish set of our data. The Chorti set of the data was collected back in 2017. So, like I said, you get this by talking to people. So let's talk a little bit about the people, again, who we talk to. These are some distribution graphs of some demographic factors. As we can see, as a box and whisker plot of the age distribution, we have the median age of our participants right under 30 years old, but the majority between 20 and 40. What's important to recognize here is that, again, the peace accords weren't signed until 1996, which means that the majority of our participants have personal experience with the Civil War in Guatemala. And even then, we had a couple of participants who are well into their 60s who have extensive experience with the Democratic Revolution and then its consequences. And then over here, we have a sex distribution of our participants, a little bit skewed towards men, but for the most part, pretty even. Now, let's look at some of those graphs that I mentioned earlier with the findings. So this is what happens when you plot formant 2 by formant 1 with all of the every single pronunciation of every vowel. You get a really messy looking chart. So what we do is we kind of simplify that by just looking at the means and standard deviations. This is for the short T vowel space. These are the 5 vowels in short T. We have A, E, O, and U. Now, if we do the same thing with the Spanish vowel space, we can see very similar looking vowel space, A, E, O, U. But when we compare the two, one thing that stands out are these huge standard deviations. This represents 2 standard deviations from the mean. And what this is essentially saying is that E and E are pronounced statistically the same, and O and U are pronounced statistically the same in both the short T and the Spanish vowel data. So if we go back to my research question, I was asking if the Spanish and short T vowel spaces have merged. So we did a quick ANOVA to test that, and we found that they have, in fact, statistically merged. These are the p-values for the ANOVA of the F1 means and F2 means for each vowel. And obviously they are not significant, which means that the two vowel spaces are statistically insignificant in their difference, otherwise known as they have merged. But we run into a little bit of a problem with these standard deviations. Because the variation is so high, we can't really be certain. So I wanted to propose a couple of future veins of research that should be followed to help better pinpoint this question. Specifically, I want to ask for a little bit of a better documentation of the short T dialects and Spanish dialects in Guatemala. There hasn't been a whole lot of acoustic phonetic research done on Mayan languages in general, but also specifically on Spanish in Guatemala. And I think that if there are better documentation efforts in that region of the world, then we'd have a better chance at answering this question. Also, there's a couple of explanations that I want to propose for the short T variation. One of them being that we essentially captured a wide range of competencies in the short T language. Like I said earlier, a lot of people are now leaving Guatemala because of various economic factors and environmental factors. Because of that, they're not staying home to teach their children short T as the first language. So we have some older speakers who may have learned short T as their first language and Spanish as their second language. And then younger speakers who had the opposite of that. Spanish was their first language and short T was their second language. Because of that, we may have captured, like I said, a wide range of competencies in both Spanish and short T, which could be resulting in this large variation in the pronunciations. Another proposal I had for this was recall that short T is a Cholon language and was related to Chol T, Chol, and Chontal. Now, short T, according to all previous attempts to document the vowel inventory, has been documented with just these 5 vowels. But every other Cholon language has 6 vowels, and that 6th vowel would be right here on a phonetic spectrum, the vowel or schwa vowel. I would like to do some tests in the future to see if the schwa vowel is still extant in some environments in short T. I think that following down to some of these further documentation efforts would really help us to better answer these questions, and would have a lot of consequences for a lot of other fields of linguistics as well. So that is my research. Thank you all for coming. These are my references, and I wanted to specifically thank these people. They were all very important to my research, and my research wouldn't have been done without them. So thank you all for coming.
Thank you, Leanne. That was wonderful. Okay, next up, I believe we have Shayla.
Hi.
Okay, you're ready?
I think so. I'm pulling it up.
And just a reminder to everybody, you can go ahead and start putting questions if you want in the chat on both YouTube and on Teams, and or save your question to ask out loud during the Q&A.
Let's see.
I've already got questions for you, Liam.
Great, thank you.
So I seem to be struggling here for a minute. I may need to leave this and then come back. So, sorry, teams.
Okay. Technical difficulties? We didn't think about including some elevator music for these moments.
We can all do some a cappella.
If it does come down to it, I can go ahead of Shayla if it comes down to it.
Thank you for whoever's adding in that whistling. I know, Nick, I forgot to get Girl from Ipanema. That's hilarious.
Liam, where did you get that picture of yourself speaking to that participant?
I believe Dr. Forgash took that picture. Yeah.
I'm going to give Shayla a call and see if we need to change the order. Thank you. Jeancasia, let's go ahead and have your presentation up next, and we'll see if we can get through the technical difficulties on the other end with Shayla.
Okay. I would like to say that yesterday I was suffering a little bit of technical difficulties in the middle with my sound. So if you ever need to jump in and say, hold on a second, we can hear you, please do. Thank you.
Okay, we'll do. We're looking forward to your presentation.
Oh boy. Okay. My presentation is called The Perils of Interracial Adoption and Why It Should Only Be a Last Option. My name is Jeancasia Nolen. My major is in Human Services, and I have a concentration in at-risk youth. This is an analysis of the consequences of interracial adoption.
Is your presentation uploaded? Can we see have you shared your screen yet?
Yeah, I shared it. You don't see anything?
Can everyone see it?
No.
No.
No. Okay, hold on. Let me try that again. Share.
Try turning the camera on. That might be what's wrong.
Okay.
Okay, now we're starting to see it.
You can. Okay, good.
It's not full screen yet, though. There we go.
How about now?
Yep, it's coming up.
Okay, great. Let me start over.
Okay.
Go for it. Hello. My name is Jeancasia Nolen, and I'm a major in Human Services and with a concentration in at-risk youth. And this is a presentation on the perils of interracial adoption in America. And it's also an analysis of the consequences of interracial adoption in America. I would like to just forewarn everybody, this is controversial. And this is something that in previous talks has very much triggered some people. Just fair warning. Dr. Robert J. Lifton, a very famous author and psychiatrist, once wrote, "The adoption experience cannot be free of dislocated human arrangements. For the most part, our society handles dislocation by offering a substitute family, but at a price. That price is suppression of the adoptee's life story, the psychological and practical excision of his or her personal history and biological connectedness. What has been excised is replaced by fantasy, the adoptees, the adopted parents, and societies." His wife, Betty J. Lipton, who was adopted herself and a big proponent of adoption reform, once wrote, "I say that society, by sealing birth records, by cutting adoptees off from their biological past, by keeping secrets from them, has made them into a separate breed, unreal even to themselves." So here's a quick history of interracial adoption in America, very brief. Interracial adoption in America didn't really start gaining traction until the 30s and 40s. The Boys and Girls Aid Society had what they called Operation Brown Baby in 1944. And Noah Turner, who was Chinese, was the first child adopted under this. In the 1950s, the agencies started rating children by adoptability, by their age, their gender, their skin color, and if they have disabilities. The National Association of Black Social Workers in 1972 wrote this. The NABSW feels that it must reaffirm its stand against transracial adoption, although we strongly agree that a permanent home for a child is preferable to life in foster care. It does not seem that transracial adoptions are a necessary or a viable alternative, as there are many Black families willing and able to adopt. In 1978, the Congress passed the Indian Child Welfare Act. I'll talk a little bit about that in a minute. And then the Multicultural Placement Act passed in the United States in 1994, saying that they will no longer try to place children of the same race with adopted parents, that they will not consider race anymore in adoption at all. And then in 1994, there was the Hague Convention in the Netherlands, where countries came together and agreed that it was best practices to keep children in their birth country and stay within their culture as much as possible. It wasn't until 2008 that America decided, they adopted it, but they didn't implement it until 2008. Epigenetics is the study of DNA that scientists have reason to believe can carry things such as inherited fear, inherited memory, and the bonds of biology. How does one's history affect them today? There was a famous study done of Holocaust descendants who had greater levels of cortisone and PTSD levels, but did not actually experience the Holocaust. And there is reason to believe that there were inherited things from their relatives. I've decided this morning to weave in my own story with this to try to keep more context. I myself was interracially adopted. I was born somewhere in Bogota, Colombia, and when I came, I was adopted at 3 months old by a white American who already had a 7-year-old biological son. With the epigenetics, I often think, would this explain my phobia of mice? I don't know. Baby shopping is big business. Up to 1,000 parents have adoption profiles at each adoption agency, and many use multiple agencies for better chances of getting picked. The average adoption at an agency costs about $40,000, give or take. Most would never be chosen by a pregnant mother because of supply and demand. There's just so much demand and so little supply. The average income of an agency executive is over $100,000 per year. And lots of times, agencies use pictures, and orphanages use pictures as propaganda. There are many experts to adoption, and here's just a list of some of the experts in adoption. And these are the people who get to decide, ultimately, who goes where and who gets who. And they are not actually in the tree. The triad, of course, is the birth parents, the child, and the adopted parents. I believe there needs to be more training. Many agencies have recommendations, but no mandatory training in different cultures. If you were to adopt interracially, it's not followed up on if you present that child's culture to them. It's just recommended. The focus should be on keeping families together. And there needs to be more than just heritage camp, which is camps designed to send children to in the summer and introduce them to more of their culture. There needs to be more recruitment. There needs to be a reducing costs and requirements for minority prospective parents. A lot of prospective parents that are minorities don't adopt because they can't afford to. There needs to be a better reach out specifically to those communities through churches and leadership. There needs to be offers of stipends and incentives. There needs to be advertising and education.
Hey, Jeancasia, I'm going to interrupt you for just 1 second because I'm getting some messages that the mic is cutting in and out a little bit.
Okay.
I don't know if you can hold it in a certain place.
Oh, I see the notice now. Okay.
Just keep on going.
Okay. So legislation in December 2019, United Nations unanimously voted to abolish all orphanages. This just happened less than 6 months ago. So the UN decided that orphanages were bad for children, and all the participating countries are going to close all the orphanages and keep the children as much as possible with their biological families. If there are no biological families, they're going to keep them in family homes and not in institutions or orphanages. And it is time to reverse the Multi-Ethnic Placement Act of 1994. And I'm going to show you why. First, let's look what society thinks. There are lots of shows and movies that depict interracial adoption. And here's a list of a few. In The Jerk with Steve Martin, one of his opening lines, this was a late 70s movie, was that he was born into as a poor black boy. Obviously, Steve Martin isn't black. And it was funny because it showed a scene of him crying with his black mother in Mississippi, asking if he's always going to be that color, and he didn't want to be. So it was kind of funny. But most of these things show interracial adoption as nothing but beautiful and happy and wonderful. The celebrities, dozens of celebrities have interracially adopted, and here's just a picture of a few. And they kind of turned it chic, maybe, and something that that it seems as though this is just a cool thing to be doing. There was an interesting study that a lot of adopted mothers, and I can't qualify a lot, but many adopted mothers, according to adult adoptees, qualified as narcissists, meaning that one of the reasons that they adopted was for validation, a kind of look at me quality, a kind of a sympathy from people of how generous and kind they were, but really they had ulterior motives. Interracial adoption is done by people who can afford it. Usually it's white, middle, and upper middle couples who adopt. Empirical research studies find a new form of colonialism and cultural imperialism. Others even suggest a cultural genocide. Interracial adoption comes down to supply and demand, plus economics and privilege. Here's a quote from a mother who adopted interracially, and she said, "Black babies cost less and take less time to get." If you know anything about interracial adoption, the darker the skin the child, the less money it costs. And that's, you can ask any adoption agency. They don't like to advertise that, but that is the truth. This little girl right here, she said, people want to hear that I'm happy that I was adopted. And she says it's just not that simple. Here's a couple more pictures of interracial adopted families. A lot of times the parents say, we didn't care about skin color, and that might be true. But they didn't realize that their children very much cared about skin color. And then sometimes there's a white saviorism. A lot of times people think that they're taking these children out of dirty, poor, bad situation and then giving them a better life. And they're kind of saving them out of a bad situation. These are some pictures of things you probably don't see. On the left is an Indian couple who adopted a fair-skinned, blonde-haired, blue-eyed girl named her Goopa. She's speaking, she's saying hello. And then on the right, this is a Kenyan couple who adopted a fair-skinned, red-haired, green-eyed boy with freckles and teaching him Swahili. His name is Kwame. He's saying Jambo, which is hello. It's just not something you're going to find. So the Indian Child Welfare Act passed in 1978 because 25 to 35% of all Native children were placed in white homes, and that made it to where they have to get the consent of a tribe before any child gets adopted to anybody else. Biological parents, the silent member of the triad. Here's a picture of the child's perspective. Now, these are all quotes from adult adoptees that when they were a child, the things that they felt: the loneliness, unprepared, ashamed, confused, worried, depression, different, does not fit, talk about, my last name doesn't fit me. I have some friends who have a very German last name, and their children are from the Philippines. So when people look at them, they're like, why in the world would you have that last name? You're obviously not German. And then Aaron Morey, he did a project called Side by Side, and he interviewed dozens of adult adoptees, and they gave their own accounts of what it was like. I did a research study, and I asked these questions. Which culture do you identify with and why? Of 27 adult interracial adoptees. And the results were they adopted more closely with their white American parents than their own culture. And a lot of them were not happy about it, but it was the way it was. Most of them weren't exposed to it. All of them said there would only be pros if they felt that if they were adopted within their own race, and there were no cons. Stereotypes, more than half of them experienced stereotypes within their families, their adopted families. As far as some of the Asian kids said that people said things like, we expected you to be so smart because you're Asian, that type of thing. And then most of them would change something about their adoption. A few of them would have preferred not to have been adopted at all. And I would like to say that 4 of them wouldn't have changed anything about it. They said they had great lives and great parents. So these are some of the results. And just briefly, some of the things that adoptees face that they don't think most people realize, and that is things like code switching. Depending on who you are talking to, these adoptees have to learn to change the way they talk and act, meaning you learn to talk one way with your adopted family, but when you're around your friends who are the same, maybe culturally as you or race as you, you talk differently so that people don't get confused as to why you talk so maybe Caucasian or something. How can you honestly answer ethnicity questions on questionnaires and surveys and applications? Because you might be ethnically one thing and then, or your race another thing. So doctor visits are difficult, as you can see in a lot of our presentations already. A lot of things go back to what you inherit or your DNA, language, cancer, medical questions. And just try for 1 minute, imagine waking up every morning and not seeing one face that looks like your child. It's very difficult. And some people felt like they were just abducted by aliens, which isn't far-fetched. So that's about it. Thank you for coming, and I'm glad you came.
Thank you, Jeancasia. We're looking forward to engaging you in the Q&A in a few minutes.
Thank you. Can you see me?
Yes, we can.
You can't see me?
Yeah, I can see you now.
Okay, so, I'm not sharing my screen anymore, right?
Nope. Nope. I think yes. You may be still. Can you push that little button with the X where it says share or stop sharing?
I thought I did, but I will try to do it again.
Okay.
Okay. Are we good?
I think so. Shayla, are you up next? Are you ready?
Yes, I think so. Let's hope that my computer works with me here.
Okay.
Can we see my screen?
Mm-hmm.
Okay. Good. Yay. Okay. Is it viewable?
Yes, we can see it.
Okay.
We can hear you.
Oh.
And we will, again, we will do all the questions that I'm starting to see appear in the chat, and we will save those for the Q&A after Shayla's presentation, but I see some of you are starting to put questions in. Thank you. And are you ready to go, Shayla?
Sure, yep.
Okay. Just a reminder for everyone else to mute your microphones and to turn off your cameras during Shayla's presentation, and then we'll see you back during the Q&A.
Go smudge yourself. The smoke from a burning sage bundle washes over the body, cleaning and protecting the spirit. When First Nations and Native Americans smudge with sage, they are healing. When Indigenous youth read Indigenous graphic novels, they are engaging in a process of healing and empowerment through cultural and spiritual cleansing. Graphic novels are literary sage. My name is Shayla Bischoff, and I want to dedicate this presentation and research to the incredibly powerful Indigenous women in my life. I am a member of the San Carlos Apache Nation. I am a part of the Seneschine clan, and my reservation is located approximately 100 miles east of Phoenix in Arizona, deep in the desert. So my literary journey begins with Kaya. Kaya is an American girl doll whose books were written by Janet Shaw. Kaya is from the Nez Perce tribe, and as far as my research has shown, Janet Shaw is not a member of the Nez Perce tribal nation. I encountered Shaw's books when I was in the 1st or 2nd grade, and at that young age, I realized that this was not the literature that I wanted or needed. It was not literary sage. As I grew and changed, the indigenous literary scene did not. Indigenous youth are still not being adequately or accurately represented in literature. Historically, colonial powers within North America strategically stripped Native Americans and First Nations people of their language and culture. By systematically silencing them, colonial powers had hoped to eradicate Indigenous languages, and what is left is meagering representations for Indigenous youth. So my search for literary sage led me to graphic novels. They are the perfect medium to engage youth. Graphic novels are easily accessible for all ages and reading levels, and they are used in schools K through 12 to encourage youth to learn to enjoy to read. Graphic novels enable Indigenous youth to engage meaningfully and with historical and modern texts. So decolonized literature is the undoing of rhetoric and ideas, colonial rhetoric and ideas. It is the recreation of the Indigenous voice in a way that is totally representative of their culture. Decolonized literature is the active resistance to colonial imperialism and the embracing of Indigenous traditions. So there are two primary theories that are used to analyze the graphic texts: survivance and rhetorical and visual sovereignty. So survivance literature was coined by Gerald Visner of the Chippewa Nation, and the term survivance is born out of the two words survival and resistance. It is a theory that spans decolonized pan-Indian literature and is critical to how Native Americans are portrayed in literature written by non-Native people. So, to understand survivance theory, it's important to know the terms that Visner uses. The first one is manifest manners, which is parallel to manifest destiny. Manifest destiny is essentially manifest manners, is essentially the colonial perspective of indigeneity and colonial written literatures. Simulation is the term used for Indigenous characters created by colonists, and those characters are usually stereotypical in nature. Post-Indian warriors are Indigenous people creating Indigenous literature with cultural relevancy. So what are some examples of simulations and manifest manners? Well, Janet Shaw's Kaya is a simulation, and their book series is Manifest Manners. You may know of Tonto from The Lone Ranger and Tonto. Well, he is a simulation, and their TV show is a Manifest Manners show. Disney's Pocahontas is a simulation, and the Disney movie is a Manifest Manners film. Post-Indian warriors would be the Indigenous graphic novelists that I'll be talking about today. So most tribal nations have sovereignty over their land and people. And rhetorical and visual sovereignty means that they should also have control over how they are viewed in colonial spaces. So rhetorical sovereignty is the concept that Indigenous people must exercise control over how they're portrayed in rhetorics and writing. Visual sovereignty is the same concept, but with how they're portrayed in images. As you can see in this image, the Indigenous people do not have full visual sovereignty because the man is rendering the Indigenous woman invisible with all the stereotypical images society has created of her and for her. So out of the dozens of Indigenous graphic novels that I found, I chose these four because they each approach social issues in unique ways. They broach topics like violence against women, cultural trauma, Indian boarding schools, and blood quantum. This first graphic novel is Super Indian. This is by far the most humorous out of all four. And Super Indian is about an Indigenous man who eats commodity cheese and gains superpowers. And in this graphic novel, he must save his reservation and elders from a conquistador vampire named Blood Quantum. So this graphic novel approaches the political issue of blood quantum in a funny way. Blood quantum is essentially the quasi-scientific way of measuring the percentage of an Indigenous person's blood. So for instance, I'm 1/4 Apache and 1/4 Blackfoot, so that must make me half Native American. Blood quantum was used by colonists to limit the amount of Indigenous people claiming tribal heritage. Essentially, it was a primary tool in genocide. So Aragon Starr, the author of this graphic novel, criticizes the continued use of it in tribal nations because it is based on colonial suppression and not tribal traditions. Surviving the City is centered around two young indigenous urban girls who are struggling to live in a city. They find themselves in constant danger from men and end up joining the Missing and Murdered Indigenous Women movement. Now, in these three images, you can see visual sovereignty at work. The light blue shadows are the ancestors watching over the girls, and the black monstrous figures are the colonists that target indigenous women and girls. And in the final image, you can see them at their protest. So Deer Woman in anthology is centered around the myth of a deer woman. Deer women are symbols of protection for women, and they instill fear in predatory men. In this anthology, women take on the deer woman form to protect themselves from sexual assault, domestic violence, and police brutality. But the main topics that I want to explore in this graphic novel are colorism and political activism. So colorism is the discrimination against your skin tone. So in the first image, you see two indigenous women who have different skin shades, but are both equally the same amount of indigenous. A person's blood quantum is often directly tied to the issue of their skin color, but that's not necessarily the case. You may be half Native American and be darker, or half Native American and have a lighter skin tone. Let me see here, sorry. The second image depicts the Dakota Access Pipeline movement, and I believe that seeing the call to action in a comic book may encourage Indigenous youth to get involved with their communities and their social movements. So 7 Generations, a Plain Cree Saga, is the thickest out of the 4. This story follows 7 generations of one single family from the beginning of colonial imperialism to modern day times. Now, the first image is the second generation dealing with the epidemic of smallpox, which we all know decimated tribes across North America. And the second image is of the 6th generation being forced to endure Catholic boarding schools whose mottos were infamously known as "Kill the Indian and Save the Man." These two images show how the cultural trauma builds over time from oppressive colonial rule. In this image, we see the 7th generation overcome his suicide attempt and confront his cultural trauma in a powerful movement of ceremonial healing with his ancestors watching over him. The author of this graphic novel depicted the crippling effect of cultural trauma, but it ends with reconciliation and healing. So at the heart of this project is Indigenous youth, and originally it was my plan to take these graphic novels to Indigenous youth of my community and discuss it with them. But of course, due to COVID-19, I had to cancel the project. I hope to pick this back up in the future and maybe pursue it in graduate school. So graphic novels are the future of Indigenous literature. They're gaining in popularity around the world, and there are pockets of Indigenous communities creating decolonized literature all over. I have found evidence of them in Aboriginal communities in Australia and in Ainu communities in Japan. So Indigenous graphic novels are just getting started. These novels are decolonized for Indigenous youth, and these 4 graphic novels can be healing. They have forced me to confront my own cultural trauma and left me feeling better after reading them, just like when I smudge myself. I argue that these can do the same for Native youth working through their own cultural trauma under the suppression of colonialism. And reading these graphic novels can be a process of ceremony for other Native youths, and graphic novels are literary sage. Thank you.
Thank you, Shayla.
Thank you. Sorry, I missed that screen sharing.
We'll do a big applause at the end of the Q&A, but thank you everyone for already getting that started as well. let's move right into the Q&A. We've got some questions that have already been posted in both of the chats, and I can start to read some of those. And then if some of you want to jump in and ask a question live on this chat with any of the panelists, we're welcome to do that as well. So let's just start. I know we're running a few minutes late again, but we're just going to take the time that we had originally scheduled for between the panels and just use it for our Q&A. Okay. Liam, I have questions for you. How long did it take you to do this research? Was the first one, and then I'm going to ask a second one as well. What sort of impact might individual variation in mouth structure, vocal cord length, or other biological factors have on such research? And are there ways to account for those confounding variables? The first question was from Autumn Schwinn, and the second one was from Jared Dubiel.
Great. Yeah. So just to get at the first question, I started working with these data sets back in fall of 2018. So it's been almost 2 years now. I collected my own data set, the Spanish data set, in November 2019. And I've been working with that since then. But so almost 2 years, one and a half. And now to answer the second question from Jared, I'm really glad you asked that, actually, Jared, because my advisor and I were talking about this morning, actually, just before the presentation started. So there are ways to account for those personal physiological differences through a process called normalization, which is just putting all those measurements through there's a bunch of different formulas that normalize the data, but you just put your measurements through a formula and it will normalize it and should try and erase any of that confounding variable of physiology. But because we were comparing samples that we thought were representative of the populations, we didn't normalize the data because we wanted to look at the whole of pronunciation of those vowel spaces with all of those physical differences included. If we were just comparing one speaker to another, then that normalization would become a lot more important. But because we were comparing 40 speakers to 40 speakers in another language, we didn't feel that normalization was that important for that. But that's a great question.
Okay, so one other question, and I wanted to also mention that I want to make sure that we give a clear invitation for the advisors of these students to ask your questions. We'd love to have you engage if you have questions for your students. Dr. Forgash, I see you have a question for Liam. Do you want me to ask it, or do you want to jump in?
Go ahead and ask it if you like.
Okay, so Liam, can you talk more about your data gathering experience? Where, when, with whom? Who specifically were the participants, and can you tell us about your interactions with them? How was the project presented to participants? Did everything unfold as expected? Any surprises? What did you learn from the experience?
Yeah, well, there were a lot of big surprises. Well, at least one big surprise. But I'll just kind of start at the beginning of that, I think, and just talk specifically about the Spanish data set that I was present for the collection of. We had 2 research assistants, myself and another former Metro student who graduated last semester, Roman Hamov, doing the collection. So we would, the participant would walk into the room, we'd have the recorder on the table, we'd greet them, we'd do a quick little demographic interview of just how old are you, is Chorti your first language, things like that. And then they would start reading the word lists. And we went through the Chorti word lists and the Spanish word lists, and then sentences in both of those languages. That was right after they had just come from slightly larger or longer interviews with Dr. Forgash and then the research assistant, Miranda. So while we were there, the main group that we were working with was the Academia, which I mentioned in my special thanks. This is a branch of the Mayan government, or the Guatemalan government, that is focused on documenting and teaching Mayan languages. And we were specifically working with the Chorti section of that. So the majority of our participants came from teachers or students at that academy, or people generally related to the academy, which does slightly skew the sample, which is why I was kind of asking for a broader documentation effort. But we did end up having, the one big surprise was we began recording in the academy itself, but then because of some political discrepancies, we ended up having to pick up in the middle of recording and move across the town to another place and finish our recordings in a woman's house, which was a little bit of a fun ride for all of us involved. But we got all the recordings safe and sound, so it all worked out in the end.
Great. I have a couple of requests to ask questions directly to Jeancasia. So let's start with you, Liz, and then Colton.
Hey, so kind of where my question, I guess, is going towards is I'm curious about are there more programs that are more effective in helping parents who adopt interracially, like help their kid in knowing like their culture and understanding everything that's going on besides like those camps? And like an example would be, I've heard of a lot of programs people started just so they can learn how to like actually take care of their kids, so even like hair care and stuff like that. And I've known people who have adopted interracially that will often actually will go visit if they're like from different countries too, where they're actually from, so they can get a bigger picture of like where they came from and everything.
So you're asking if there's more programs for people?
Yeah, so like, or how effective are different programs for those kids and the parents?
Sure, yeah. Well, kind of the issue isn't necessarily about how much is out there that parents can learn. It's the fact that it's not mandatory. So a parent can immerse themselves into that child's culture as much as they want to, whether there's a specific program or they just go to visit the country, learn a second language, whatever that be. But kind of the issue is more that it's up to the parent how much they want to do or how little they want to do. And it's not at all regulated. It's not at all looked into how much they're going to expose that child to their own birth culture. So I'm sure there are, on most adoption agency websites, it has little blurbs saying you should teach them about their native food. It's a good idea to. They're all suggestions, but there's no concrete. This is what you're going to be mandated to do to let that child know their own culture. I hope that answers your question.
Yeah. So like, there should be more like, I guess, regulations or mandates on parents. Like if you're going to make the commitment to adopt this child that's like completely different from you culturally and everything, you need to be doing these things, is what you're kind of getting at.
Yes.
Okay, cool.
If I think it should be a last option, but if somebody does adopt interracially, there should absolutely be mandatory for years, not just, for a couple years. I mean, until that child is grown, that you need to do these things. You need to show them these things and that sort of thing. I believe, yes. Mm-hmm.
Okay, thank you.
Mm-hmm.
Go ahead, Colton.
Yes, hello, thank you. My question is actually for all three panelists, Liam, Shayla, Jeancasia. My question is, what does the term white savior mean to you? And very quickly to Shayla, I want to thank you for bringing up blood quantum, and also Shayla, if you could speak briefly to the shortage of sage and how that may pertain to white women.
Okay. I can say my thing. I did put that in my my slideshow. There's even a movie. It's kind of funny. There's even a movie called White Savior. But anyway, it's this sense of, I know you're oppressed, right? I know that you're discriminated against. Here, let me get you out. Let me help you. Let me use my privilege and help you out of this thing. So I'm going to tell other people, hey, you can't talk to so-and-so that way, or hey, that's not right, because they're talking to somebody their same race, right? And they're advocating for somebody of a different race. So they're kind of coming in and saying, don't worry, I know how to talk to this person. They're going to listen to me because we look alike. Hey, don't do that. I'm going to save you out of this situation. That's the way I look at it, and the way that that's from my understanding. And it's kind of funny. Like I said, there is a movie out called White Savior, and it's a comedy, and it's with Seth Meyer, and he's making fun of white saviors who step in and kind of, Superman their way. Don't worry, black person, I got this, and so it's funny. Sorry, go ahead, everybody else.
I think to me, it's pretty, the idea of white savior is pretty intensely linked to paternalism also. Kind of this feeling like these people can't take care of themselves for whatever reason, and that we have to step in and help them because they're not equipped to do it. And I think that just comes from, probably most likely from ignorance. And also maybe feelings of guilt. I think that is a very complicated issue. Yeah, that's my thought. Is paternalism probably has a whole lot to do with that.
Yeah.
So I agree with both Jeancasia and Liam, but I think that there is a bit of naivety involved with that. That there are people who think that they're they mean well and that they're doing stuff to help, but not realizing the damage that they may be causing in the meantime. I think there's a difference between a white savior and an ally, and I think it's important to recognize those who help and help build these communities, people of color communities, versus ones who try to bulldoze their way through. And then to answer your second question, Colton, white sage is endangered, and if you are not Indigenous, you should not be using it. That's the way I view it. There are problems of people just finding it online. There are smudge kits made and sold by Sephora or big box companies, and that's not okay. Sage, for the most part, should be gifted to you. And if there are plenty of other healing and cleansing things that you can use, sage is really important to Indigenous communities. And I encourage you to search out a lavender bundle or something that's more widely available and sustainable.
I am going to jump ahead on the questions to a couple of the advisors. I want to make sure we get these questions in. Dr. Wyden, would you like to ask your question, and then Dr. Ray? And then we'll go back to the list of questions that we've got growing in this chat. There are a lot of questions, you all, so we may get to, we'll get to as many as we possibly can over the next 10 minutes.
I expected this. I'm happy. I'm excited.
It's a good thing. Yep. Dr. Wyden, do you want me to ask the question for you? I can do that. It was in the chat. Okay, so Shayla, if you've been able to complete your interviews, what do you think you may have discovered from your subjects?
I was hoping that they would have reacted the same way I did, which I had really novels, other than literature like Sherman Alexie or other Joy Harjo, literary authors that I've read. It was different seeing it visually and seeing characters that looked like me, that had gone through experiences that were similar to me. And I was hoping that these, other youth would find similar things or relate to it in a certain way. And I think, honestly, the primary reason I wanted to do the action project was because I just wanted to show other Natives that this existed and that, they are being represented. We just have to kind of search a little bit.
Thank you. Dr. Ray, do you want to ask your questions?
Yes. First of all, I want to commend this panel. You all really have done an extraordinary job, and I'm very proud of you. I would like to ask Shayla, can you give us any insights into who is publishing Native American graphic novels? And is it Jeancasia?
Yes.
Okay. I want you to give us some insights into what do you to reabsorb children in foster care into the community again through adoption. And then for the entire panel.
And Super Indian, they do sell their graphic novels online, and these are accessible. I think you can even buy these on Amazon. So they are, you know, not widely available, but easily accessible. And as far as dismantling white privilege, I think when it comes to graphic novels and Indigenous literature, it's not that they can't read it or it's not for them. But when they read it, to remind themselves that they are the secondary audience and that this is primarily meant for Indigenous people, and, you know, evaluate how they feel when they read it. Do they feel any sort of colonial guilt? Do they feel bad, or does it affect them negatively versus feeling empowered? And it's their job to dismantle those feelings, and it's not mine. I hope that answers that question.
So as far as social services is concerned, because of MEPA, the act I was talking to you guys about, they're not allowed to say, you know what, it would be better if this child was placed in a same race culture or as themselves. So I think that should be repealed. But as far as communities going, it comes down to education, and it comes down to advertise. I mean, I don't like the word advertising, but it comes down to communities don't know. Communities aren't maybe aware that there might be so many children within their own culture and their own race that need homes. So if it's like out of sight is out of mind kind of thing. So I think that there needs to be a bigger push to tell communities, we really want to find homes for these children in their same culture, in their same race. And do you have an extra? Are you a decent family? Do you have an extra room? Even, you know, whatever it is. We might even help you be able to do it if it's a financial issue. It should never be a financial issue. But people just don't know that, I think. So I just think there needs to be a better outreach to minority communities. Oh, as far as privilege, wow. You know, I could talk about this for all day. I mean, I could have done my presentation for hours, honestly. There's so much I couldn't tell you. I didn't have time to tell you. But as far as privilege is concerned, this is the key thing. Whenever you look up a perspective on, say, interracial adoption, on, say, economics, on, say, most any topic, you're going to get the perspective of white, middle class, or upper class people in the media, for example. So if we could somehow give people other people's perspective more often to teach them, that's your perspective, that's how you get to see things. But let me tell you how we see things, to help put people into other people's shoes. That would open up people's eyes into, you know what, I never thought about it that way, I never saw it that way. I only saw it my way because that's all I hear about. You know, that's all I see all the time. So I did my thesis not from an adopted parent's view, and that's what's important to know. I did it from the adoptee's view, and it's very different than the parent's view. I know there was a question earlier about, and I got this before this presentation, I've done this before. So are you saying that we should just leave Black kids in foster care? I'm definitely not saying that. I would never say that. What I am saying is that I want us to be able to find homes that better reflect these children's culture and race, so that when they're growing up, so everybody look at me, look at my face, okay? Look in my eyes. I have never looked into my mother's eyes. I've never heard my mother's voice, okay? Every day I woke up, I saw people who didn't look anything like me. My culture, my heritage is Colombian. But when I visited Colombia last June, I was a stranger. I couldn't speak the language. I looked like everybody else, but I couldn't speak the language. I didn't know their norms. And I felt it was taken away from me. I feel like it's taken away from my own children. They won't know that culture. And before this picture of my family, before you say, well, you shouldn't say that nobody should interracially adopt, I have to tell you, I have an interracially adopted child myself. My son is white. It's a long story, okay? I didn't go out and do this, but I will tell you that he looks like me. I mean, we could pass as biologically, and we expose him to his culture as much as he will tolerate. And we hope to keep on doing that, which would be Irish. And he's actually half Mexican. So we try to do that as much as he will tolerate. And we let him decide how much he wants to learn and know. So I just don't want you guys to think I'm totally against interracial adoption. I can't be. My own child is a white child. So, and his father is black. My husband is black. So it's a weird, but it's what it is. So there you go. All right, sorry, go ahead.
Yeah, just to touch briefly on the second question too. I want to look at a little bit like the wording. I think that dismantling white privilege isn't necessarily the goal. Obviously, as we can see, privilege is not evenly distributed. And I don't think that the goal should be to tear down privilege, but it should be to raise everybody else up. So I think that the way to do that is by recognizing gratitude and recognizing the asymmetry of it all. Like I said, I don't think that dismantling or tearing apart one group's privileges, however they may have gained them, is necessarily the best way to increase in other groups. I think that it's obviously a cultural thing that needs to be done internally, that we need to start recognizing and being way more aware of the asymmetries and way more aware of all of the little ways in which we are privileged. And I think that taking that even a step further and into action of how do we smooth out the asymmetry and how do we bring other people up is to me the way forward. But
I think that's certainly a more comfortable approach. And yet we have to not ignore the fact that so many people from other cultures and nations have built up the U.S. And we do claim ourselves as embracing all. So we may need to really reconstruct how privilege is determined. And it might mean dismantling in order to rebuild.
Thank you all. We are at the end of our time for this, but we have probably, 10 questions that are kind of in the queue and unanswered. The good news is I've got them all saved in a document and I will share them with the panelists, and there is some chat conversation going on the side already. And I think that this conversation will also be continued in part through the rest of the afternoon. But let's unmute our microphones and give this panel an applause as well. Thank you very much, you all.
Thank you all.
You did a great job, and we are excited to celebrate you. We are going to have a celebration ceremony that was scheduled to start at 11:30, but I think we'll take about 10 minutes and we'll have it start at 11:45. I will try to just post a Word document so that people that are logging on right now can see that we're going to start in about 10 minutes. And we're going to celebrate these graduates. And then this afternoon we'll have 3 more panels, and there'll be 2 student panels each. So they're shorter panels, but we've got 3 more amazing combinations of topics for you this afternoon, and we hope to see a lot of you there. Thank you so much.
Thank you very much.
Thanks, everyone.
Liam, are you there?
Hello? Hi?
Hey, you're not able to see this document, are you, that I'm trying to share?
The honors celebration?
Yeah, does it show that?
Yes, I see it.
Okay, I don't know why it doesn't show it on my screen as that's what I'm sharing.
I can see it, Megan.
Okay, I kept on taking it down because it wasn't showing me that it was sharing. Okay, great. So, I want to also practice just for a second with my PowerPoint to make sure that it's going to share. So maybe one of you, I could log off and just call you and make sure that it's going to show correctly. Hey, Jen, could I call you?
Yep.
Okay, so I'm going to hang up on this one, and then I'll call you separately, and we'll just check my PowerPoint, and then we'll come back here, okay?
Hey, Liam, can I have a powwow with you?
Sure. I don't know what that means, but
I'm thinking about, excuse me, I'm thinking about words like tuk-tuk and people who could not be converted to Czechoslovakians. So I was wondering in this time we have here now, what are some of your thoughts on some of your favorite words?
Geez, if I could pronounce that Turkish word of these are the people who cannot be converted to Czechoslovakians, then that would probably be my favorite word by far. Tuk-tuk's pretty good too. I don't know. What are your favorite words, Colton?
My favorite word is tintinnabulation. Noun, the sounding of bells.
Wow. That's quite a word.
Yes, 16 letters, I believe. Tintinnabulation.
Great. Yeah, I love it. It's fun to be champ.
Hi, everybody. I think we're ready to get started again.
Hi.
Hi. Are all of the students here and your advisors are here? I see a big group here. Here's somebody. So thank you for being here. We're going to go ahead and get started with the celebration ceremony for the grads for spring 2020. For anybody just joining us who doesn't know me, my name is Dr. Megan Hughes-Zarzo, and I'm the director of the honors program. And we are just celebrating our grads this semester and this undertaking to have the Honors Thesis Symposium online. This has been an exciting morning so far, and we have 6 students left to present this afternoon, and we hope that many of you will continue to stay with us and get to see more presentations throughout the rest of the afternoon. And right now, we just want to recognize all of these students, their hard work in a particularly challenging semester. Normally, we would have this event on campus hosted by different entities on campus and in the space in the cavea, which is always a really wonderful thing to do together, to come together and see these presentations on the wonderful big screen that they have there, and then get to interact in person together and share the Q&A and then go to lunch. And so we're trying to replicate as much of that as we possibly can in a remote form. And it is different, right? But I really do sense this feeling of community today, and that we're all together and we're working together to try to, talk across time and space in this interesting way. And I've seen so many really great questions and ideas in the chat this morning. We're going to try to capture all of those and share those out with the students. I don't have the chat on, so I'm sorry, I'm not looking right now to see if anybody's letting me know. But we're gonna get going with a presentation that we've created. We have a PowerPoint that is kind of a representation of each of the students, going to tell you a little bit about each of them and about who they are and where they're going next. And so I'm going to share that with you all. Hopefully it will come up. Oh, whoops.
Hello,
That's not it.
everybody. My name is Daisy Rosales, and my honors thesis is on
Sorry, Daisy, I'm
Chinese
sharing yours
medicine
again.
as an alternative to treating asthma and allergic rhinitis in children.
Sorry, everybody, I don't know what happened there. Let me get my PowerPoint. I do have one, I promise. There it is. Can you all see this?
Yes.
Yes.
Okay, so without further ado, we'll get started. So welcome to the MSU Denver Honors Program graduation celebration for spring 2020. It was hard to try to put this together this time because I wanted to try to capture a little bit of, I guess, in a way, the sense of loss that a lot of us have felt, not being able to be together on campus, and not just honors thesis students, but all the students across our campus who did not get to finish the semester on campus and didn't get to graduate together in a ceremony next week. And it was kind of impossible to do this presentation without saying something about that. But then I also want us to capture the sense of celebration and accomplishment that comes with having made it through this semester in spite of all the challenges. So the first thing, the first images here are some of images from the past of what this day typically looks like, right? Where we would get together, like I said, we would present these presentations in the cavea, and then we typically go to the Tivoli and have a luncheon there with really nice catering from Serendipity, and we get to use our beautiful white tablecloth and spread the cords out and all of your certificates. And many of you were looking forward to putting your robes on and graduating next week. This is probably what a lot of you were expecting. Some images like this, right? And instead, we are in a situation that looks a little more like this. So Jen and I have been facilitating a lot of things in the last week and working with our student employees and with all of the thesis students, trying to make sure that these students also receive their certificates, their cords, their pins for the thesis, and all of the things that students would typically receive. So the envelopes that you see in the right-hand corner on the bottom are the packages that we ended up making to send out all of those things to the students. We did also send gift certificates to either the bookstore or to a great place to have lunch for each of the students, depending on which neighborhoods they live in and what they preferred, so that they could also have that, I guess, in an asynchronous form, right? We'll eat some good food together. But the picture on the upper left is one that probably needs a little bit of explanation or not, but I'm going to go ahead and explain it. One of the things that happened as we were trying to get the certificates ready for this semester was that I needed to bring my printer home from my office, and somehow in the process, I think the toner cartridges got jostled around and messed up. So when I was ready to finally print these nice certificates we have for the students for completing the program and the thesis, they had blotches of ink, yellow and red ink everywhere. And so I had to figure out a way to solve it because I thought they looked terrible and I didn't want to send them certificates that had weird streaks of ink across. So I took them outside, and it was a windy day, and I weighted them all down with some mandarin oranges, as you can see. And my son is standing there in the background looking at me like sort of in awe of this strange project that was going on. But we ended up with certificates that were spatter painted this semester. And so this year's group got kind of a different certificate of completion. And I hope that that's okay with everyone. It could end up becoming a tradition going forward, or maybe it will just be something special that happened this year. And I've told them all that if they want a clean one, when we get back on campus, we can make one for them. But this is how we ended up commemorating with certificates this time around. So I want to share with you a little bit about each of these students. The students are here in the order more or less of their panel presentation. So first up, we have Kaylee or Kenzie Mackenzie, who's a biology major. As far as achievements, awards, and scholarships go, Kenzie has just completed the honors program with highest honors. Kenzie says about honors that one thing she loves about it is that we treat everyone like they're family. Her future plans are to report to Officer Candidate School in South Carolina and serve in the Marine Corps for a minimum of 4 years and then going on to veterinary school. And one other thing that she said was, I'm so happy to have been a part of the MSU Denver Honors Program and glad to have met all the people I have. Kenzie, I just want to applaud you. So if everyone wants to give an applause to Kenzie, great job. And we hope you come back to visit us. You promise.
Oh yeah, for sure.
Right? If you have your cords there, you're welcome to wear them, but you know. Sophia Nem is a biology major and a chemistry minor. She completed the honors program with highest honors as well, was named to MSU Denver Provost Honors Roll, is a member of Sigma Alpha Pi Honor Society, interned at the Anschutz Medical Campus in the Critical Care and Pulmonary Disease Division, and aided in HIV research. She became a TA in Anatomy and Physiology too, and created an original podcast. And her future plans include becoming a doctor. And she says, so I can help not only on an individual level, but also on a public health level. And I also plan to pursue a master's degree in public health. A couple of things that Sophia said about the honors program. I think there's a mic that might need to be muted. Hopefully it's not mine. Sophia said, being given the opportunity to curate my own original thesis as an undergraduate student has been a once-in-a-lifetime experience. It's provided me invaluable academic and life lessons. And I really believe, Sophia, that I think it doesn't have to be a once in a lifetime experience. I think that you can continue to do individual research as you go along because you're wonderful at that and you should definitely continue to pursue it. Something else that Sophia mentioned was that this was her second time around in college. She says, my first degree was from CU Boulder, and while I will always and forever be a buff, I can now proudly say that I will forever and always be a Roadrunner thanks to all the amazing professors, classmates, and opportunities I have found here at MSU Denver. Sophia, congratulations. Let's give Sophia a round of applause. Great job, Sophia. Next up, we have Daisy Rosales. Daisy is an integrative healthcare major and was a Dream.us scholar. And I'm not sure, Daisy, if this is pronounced Duhop. That's how I would say it, or D. I'm not sure. You can let me know if that's incorrect. And also presented at the MSU Denver Undergraduate Research Conference. Daisy will pursue a master's degree in public health with a focus on child and maternal health. And she said about the honors program that the flexibility and at the same time all the support when it comes to exploring her interests were both appreciated. And Daisy, we so appreciated you and we're super glad to have had you in the honors program. Let's give Daisy a round of applause too. It's really hard doing this without being able to hug you all, by the way. It's really weird. Okay, next up we have Liam Price, who is a linguistics and anthropology major. Liam received the Charles Fisher Award and the first annual Linguistics Endowed Scholarship this year, and also completed the honors program with highest honors. In the future, Liam says, I plan to take a short break after graduating to work on a few papers and hopefully start translating professionally. Then in February, I will be joining the Peace Corps and moving to Guatemala to work as a rural agricultural development facilitator for the next 2 years. After that, I plan on applying to graduate schools to further my education in linguistics and anthropology. Liam says that the honors program has always been a home away from home. I will always be grateful for the time I was able to spend in the house, surrounded by such amazing and intelligent people. The kind of learning and growth that happens in the honors community is something that can't be found anywhere else in the university. And I genuinely feel like without this community, I wouldn't have been able to complete half of what I did in my undergraduate career. Thanks, Liam. And let's give Liam a round of applause. We also hope you will come back to visit and or join us online when we maintain the online portion of the symposium as we go forward, right?
Of course.
Next up is Shayla Bischoff. Shayla is an English major and an IDP in Global Studies, an individualized degree is what that stands for, if you don't know. Shayla, you cracked me up when I read this. What Shayla submitted on her bio under the Achievements, Awards, and Scholarships was this quote, "There are none. I bought chickens." But Shayla has completed the honors program with highest honors, and I am sure that there are more things to be added to this list if we would think about it and add some of your honors on here. There are lots of things that Shayla has done for the honors program, and I'm going to tell you about some of those right now. She says, as far as future plans go, for now, I am ready to be with my family, my chickens, my garden, and get a civilian job while applying to graduate school for international relations. Shayla also says, I've been on the Student Honors Council for about 3 years and have worked intricately with the honors program leadership during my time at MSU Denver. I also created the honors program newsletter, Nerd Herd News, with the help of fellow honors students. Without the honors program, I wouldn't have found a place to call home, invest in myself and my studies. And the Nerd Herd News edition for this semester actually came out also in spite of the situation that we've all been in, and that is going to be posted sometime soon on our website. So thank you, Shayla, for your leadership in all these ways, and let's give her a round of applause as well. I will also mention here, I forgot to say this, but Shayla has been my TA for this past semester during this global pandemic situation, and I really am so appreciative of all the help that I've had for for teaching the thesis seminar course. And for all the thesis seminar students who are here, I promise that I will have all of your work read by the end of Monday. Thanks again, Shayla. And congratulations. Next up, we have Jeancasia. Jeancasia Nolen is an IDP in servicing vulnerable populations. You know what this is? I want to make sure there's something missing here. Jeancasia, you're a major in health services, human services, right? I think I added that this morning, but it must not have saved. I'm sorry about that.
Yeah, I am.
Is that all that's missing? Is that right? And at-risk youth is the focus, right?
Right, yeah.
Got it, okay. Jeancasia is graduating cum laude, and Jeancasia is a thesis-only student, which means that how I explain this to many people that ask about it is that sometimes students find the honors program later in the game and still are interested in completing a thesis project. And the philosophy of our honors program is that if you are a student who really wants to do an honors thesis and you have an advisor who wants to work with you on that and you've got someone who's recommending you, we go ahead and facilitate that process, because a lot of times there's a viable project here, and there definitely was here for Jeancasia, and that was really exciting to see come together. So Jeancasia, I commend you for jumping on board and for pursuing your thesis project. Jeancasia says her future plans are applying to graduate schools in Florida, and she hopes to one day open a nonprofit for teens in foster care or who have aged out of the system. Jeancasia also says, I'm a non-traditional student who actually started at MSU in 1993 when I was 17. I'm doing an IDP. I'm a married mother of 4. My oldest son is USMC combat war veteran, a chef, and a sheriff's deputy. My second oldest is serving in the USMC in Hawaii flying drones. I also have 2 teenagers currently in middle school. And many times when Jeancasia and I have been meeting online for things, we both had children in the background, but we have been able to continue to have productive meetings and get this project to this state today. So congratulations, Jeancasia. You did a great job, and let's all give her a round of applause.
Thank you.
You're welcome. Next up, we have Anna Erickson, who is doing an IDP, completing an IDP in rhetoric and design studies. Sorry, I had something over the top of the screen. Anna is also completing the honors program with highest honors. And she says, after graduating, I will be working with my mom on our sewing business. I currently am trying to bring the business online through social media and online sales. I also design new products and make the products that have been a part of the business for a while. I will also be working on my own fabric designs. Throughout this time, I will be working on getting my interior design degree and the certificates associated with it. Anna, I have to let you know that when I read this, when I read about your future plans and I was selecting the designs for the slides today, I thought about you and I thought about amazing fabric designs, and that's part of the reason why I picked this background. So, yeah. Another thing that Anna says is, one thing I loved about the honors program was that I got to continuously see the same people in all of my honors classes. This helped me create new friendships and intellectually dig deeper during class conversations. Anna, we're so glad that you were part of the program, and we congratulate you. Let's give Anna a round of applause. We'll be hearing from Anna after lunch today in panel 3, starting at 1:15. Colton Lee is a double major in philosophy and Americanist studies, is also completing the honors program with highest honors. And in response to the mini bio request, said that something that stands out is, my first semester in the honors program, I took business ethics. My second semester in the honors program, I took symbolic logic and feminist philosophy. My third semester, I took professional and scholarly writing and philosophy of language. My fourth, I took the American dream. My fifth, I took adventures in podcasting. My sixth, I took honors thesis seminar. My seventh, I took existentialism. My eighth, I took cravings and addictions. My ninth, I took senior honors thesis, and here we are. And here we are. So Colton will also be presenting in the first panel after lunch today. And let's give Colton a round of applause. Congratulations. Next up, we have Nick Sundstrom, who is an environmental science major. Nick received the Undergraduate Research Mini Grant Award, was a recipient and presenter, and almost presented at Western Regional Honors Conference in 2020. Many of the students that are graduating today were scheduled to travel with us to Cedar City and to present at the spring conference that was going to be held in March, but was canceled due to the COVID-19 pandemic. And so, yeah, we have also published a lot of the abstracts for that conference in the Nerd Herd News this semester, as it's going to come out this week. So that's a wonderful place to also see that research and a bit of what was going to happen and what has happened in terms of what these students have been working on. So I was glad you mentioned that, Nick. That was an important thing to also recognize. Nick's future plans include seeking meaningful employment in the environmental field, where my skills and new knowledge can make a positive impact in the world. I really liked what you said, Nick, about coming back to school. Nick says, I came back to school because I was becoming worried about the many issues I saw in our world, both environmentally and societally. After joining the honors program and getting to know some of my peers, both in class and out, I am more at ease about our future, knowing that these are the people who will be our future leaders and innovators. This is what stands out the most to me. I think our future is in good hands. And that was a really great paragraph for me to read this week, Nick. So thank you for that. And I think that your classmates also are grateful for that attitude and for the way that you share encouragement with us that way. So let's give Nick a round of applause. Congratulations, Nick. Next up, we have Sarah DeHabra, who is a criminal justice and criminology major. Sarah was named to the Provost Honor Roll, also received an academic achievement scholarship and completed the honors program with highest honors. And in the future, she says, I plan to attend law school and become a corporate lawyer or family lawyer. Sarah says, my journey with the honors program wasn't easy, but it made me a stronger person. The honors program is an entity that amplifies the students' success and helps them adapt with whatever comes their way. And she also adds that she would like to commemorate her parents and friends for standing by her side. And she says, helping me to get to where I am. I am thankful for the people in my life and I won't let them down. Sarah, thank you for your dedication. I know that each of these projects has had their challenges along the way. And I think that it's great to recognize that and the fact that you work through them and you get to this stage. So we're excited to hear from you this afternoon as well. Congratulations, Sarah. Next up, we have Stephen Liu, who is an aviation and aerospace management major. Stephen is graduating summa cum laude, was selected as the Outstanding Aviation and Aerospace Management graduate for 2020, which I didn't know until I was creating this presentation. So congratulations, Stephen, on that award. Stephen says, regarding my plans, in February, I started my journey towards my private license in a C-172. I'm excited to continue and work towards completing my first solo flight. Academically, I will be pursuing a master's degree with my long-term vision to work in the airport or airline environment in a management capacity. I am researching MBA programs to help broaden my academic and professional portfolio to strengthen my skills in being an effective leader. Current programs that I'm interested in are CU Boulder or Regis University. Stephen also says of the honors program that something that stands out is how supportive and inclusive we are in honors. Also, the colloquium courses were most memorable to me as they helped broaden my academic view into other subject matters that I would have would not have gotten a chance to experience if I were not in the honors program. It was a pleasure to have you in the American Dream course a couple of summers ago, Stephen, and I'm going to try to teach it again this summer, so we'll see how that goes in the current situation. But it's been a pleasure to have you in the program, and congratulations to you. And last but not least, we have Jeanne Villalobos, who's a criminal justice major and a legal studies minor. Jeanne says, I am the second youngest of 6 children and am a first-generation student. I was also able to obtain my bachelor's degree with 0 debt. And Jeanne is completing the honors program with highest honors. In the future, she says, I will be attending Creighton Law in the fall of 2020. I was awarded a Dean's Fellowship and a $24,000 yearly scholarship. Sorry about the typo there. If all goes well, I should be graduating in May 2023 with minimal debt. Congratulations on all of those achievements, Jeanne. Another thing that Jeanne says about what stood out to her about the honors program was the extra challenge it gave me with academics. I was already a good student, and classes sometimes got boring to me because of how easy they were. The honors program gave me the extra challenge to stay engaged. And Jeanne, thinking about your project and the presentations we're going to hear this afternoon, this morning I've been listening to the news. Sorry, everybody, it always happens at some point. And I just want to say that every semester, for the past few semesters, I have had students whose projects who have challenged me on many levels. And I've been really, I've been amazed to see over and over each year we've had a student from CJC who has had a project that really speaks about, sorry everybody, about the criminal justice system in our country and about social justice. And I commend the bravery and the courage and the voice of our students, your willingness to stand up and to say something about things that you see that are injustices. The last panel also was a panel that engaged in those topics, and so many of them are controversial and bring up a lot of conversation. And as we saw, we weren't even able to address most of the questions in the last panel. But the news has been challenging lately, and in particular this week, in addition to the pandemic, we've also heard a lot about the Ahmaud Arbery case, and a lot of us have been impacted by the news about that. And I just want to say something about that today, and just to say that every semester I'm encouraged about things, and like Nick said, about the future and the hands that the future is in because of some of these projects that you all do. And so this afternoon, I think when we hear from Jeanne, we're going to hear from yet another student who, coming out of the MSU Denver Honors Program, is wanting to talk about the criminal justice system in our country and challenge some of the ways that it treats people, and in particular people of color. So thank you for doing that, Jeanne, and for raising your voice on this particular topic that continues, unfortunately, to be in the news on almost a daily basis in our country. So that's one of the things that I just wanted to say today. I know that's a serious issue, but many of the issues that you are all presenting on are serious and complicated and challenging. And I know that many of you have been even nervous to present your projects because you felt like sometimes you were challenging the status quo. And I just want to say I'm so proud of you for continuing to do that, all of you. And we're going to see a lot of that this afternoon in many of the presentations, fighting for the environment, fighting for social justice, fighting for corrections to history and to the way that people in our society are treated. And I see that over and over and over in these passion projects that honor students present. So thank you all for raising your voice and for dedicating time to these things. I want to say thank you to a lot of people that have been involved along the way. Myself and all the associate directors and our program coordinator, Jennifer Odell, we would all like to say thank you. especially to thesis advisors and second readers. They're all listed on the inside of the program, and you are here today, and we know that these projects are absolutely impossible without your guidance and expertise. The Honors Council members, they're all listed here in this thank you as well. Dr. Sutton, Dr. Hernandez, Dr. Melvin, Dr. Schaefer-Fry, Dr. Schliemann, Dr. Martin, Dr. Flynn, Dr. Herman, the Honors Student Council. Your leadership this year has been amazing, and we are going through student council elections again right now to bring a new group of leaders into the fold next year, and it's going to be another challenging year. And I think it's exciting to see how we've got student leaders who are stepping up and saying, I want to lead in this time in spite of the situation that we're all going through. Still want to say thank you to Kavya and Sarah Harmon, Luann Tran, Petra Schumann, Ned Howich, all the staff that generally help us in the Kavya. They helped us start to get ready at the beginning of the semester, and although we couldn't present there, we still thank them for the ways that they were supporting this program. Alumni Relations and Giving, and Alyssa Joseph is our point person in the advancement office, helping us with all kinds of projects. And we've got advisory board members who have attended part of the presentations today as well. AHEC Integrated Marketing and Communications, Kristen Morrison designed the symposium poster and program this semester again. And the Office of Academic and Student Affairs and Provost Vicki Golick, and Undergraduate Studies Director Dr. Elizabeth Parmalee. We thank all of you for your support on this. Dr. Golick is retiring at the end of this semester, and one of the things that I've seen in many meetings over the last number of weeks have been expressions of gratitude for her leadership. And I've also really appreciated the way that our university has been able to embrace a moment of change and departure and saying goodbye, and has recognized the emotion in that. Over and over, I've seen people express how they feel, and I'm appreciative of the fact that on our campus, that's okay, and that we can express how we feel in these times. And I appreciate that leadership. The Honors Program Advisory Board, I'm so grateful for this project that is growing. We're going to connect students this summer with workshops with the advisory board, and keep continuing to get you in touch with external community members who can mentor you as you are graduating and moving on to the next step. Our student employees are invaluable to us. They help us do all of this, and we could not have put this day together without the help of Christopher Erickson, Andrew Pena, Shayla Bischoff, and Colton Lee. Thank you all. I want to give a special round of applause to that group. Thank you. And a special thanks to the Writing Center, Auraria Library, Eric Baker, the IRB, Dr. Jeff Helton, Dr. Michael Heathcote for helping us through IRB projects, the Undergraduate Research Program, and Sean Meek for providing workshops for the thesis course. All of these were of great help to us as well. And I also want to just give a shout out today to the panel moderators who are helping us. Allie Berkowitz is a student who's also in the process of working on her senior thesis. And Dr. Forgash has been helping us this morning to moderate and take the questions from the chat. And then Dr. Bolton is also going to jump on board this afternoon and help us with that. So thank you so much for helping to make this day possible in that way. And I am absolutely sure that I'm forgetting to thank people. For example, downstairs, one of the honor students, Olivia Sornecki, is here helping babysit right now, which is an immense help to me. And my husband, Manuel Urrutia, is also an amazing help to me and has been helping to help get this event up and running. So thank you to them. I don't know if they're watching downstairs right now or not, but so many different people who help along the way. I know that your family and friends, the honor students at this point, generally we give an opportunity for family and friends and for faculty, advisors, to also receive a round of applause at our luncheon. And so I think that right now, honor students, can you join me in just thanking all of the people in your lives, your advisors and your family and your friends who have helped you to get to this day. Let's also give that group a round of applause.
Woo-hoo. F yeah.
Yes. And last but not least, you all still owe me a fork.
Boo.
So we had intended to have this year's, or maybe I was the only one. It's very possible that I was the only one who had the intention of having a new tradition start this year, which was that you could only graduate from the honors program if you were willing to replenish the disappearing cutlery from the honors house with at least one fork. So I found this image without doing very much searching at all on the internet. And I don't think we need all these kinds of forks, but you know, take your pick. So there you go. Thank you someone for, you know, laughing. I think that was you, Liam. Okay, so that is my slideshow for now. And I want to say that one of the things that was also mentioned in a lot of the, hang on, I'm going to try to stop sharing. How can I get back to my team screen? One of the things that was also mentioned in a lot of the extra comments that students wrote was a thank you to the program, and a thank you in particular to Jennifer Odell and to myself. And I just didn't want to repeat that over and over, but thank you all so much for that recognition as well, and for just for recognizing the honors leadership and the ways that we support you. And I would just say it's our honor to be able to do that. We are so happy that, at least I speak for myself, but I think I speak for both Jen and I, and Jen, you can just jump in here if you want to, but we both talk to each other a lot about how much we love our job and enjoy the people that we work with, and feel so grateful on a daily basis for getting to work with this community. So that thank you just kind of goes right back at you.
Let's give a round of applause for Megan and Jen, you guys.
Yeah, yeah. I concur with Eric.
Yeah, we love you. You guys are so great.
You guys. So thank you all for that you do for us, and that you've done for so many of us over the last however many years you've been a part of the program. So no crying.
Back at you. I know, I was going to wear my sunglasses today.
Only wear those at night.
Okay, so that is what I have, and now I think that we have until 1:15 before our next panel begins, and so we can kind of take this time just to hang out if you want, and those who need to take a break and go get some food, do what you need to do, or, you know, take a little bit of a break. Otherwise, we can chat and catch up a little bit and try to have a little bit of informal time on Teams if you want.
Found time, maybe?
Thank you, Megan.
Yeah, thank you. Jen, do you want to add anything?
Nope, I think you did great, and I didn't cry this year. Good. I bawled last year.
That upsets me. You guys definitely needed to cry.
Well, the day
Cry,
is young.
Jennifer Odell.
You might still cry before this is all over. That's my hope.
Well, you know, normally what I do is I secretly put onions under all the tables.
Yeah.
To try to get everyone else to cry with me. Don't know if you ever noticed that in the past. But
I cried this morning before I did my symposium. So
yeah.
Yeah.
So while you were talking to me, Megan, I opened my package because I purposely waited to open it until you know, you had like introduced me. But sorry, you hear my husband in the background being weird.
I was trying to figure out what that was. I didn't know if that was a person.
Yeah, it's James singing. It was James singing. They had all waited in the back bathrooms, and as soon as I was done, like they had their ears to the door or something, but everybody emerged from the back of my house to go to the bathroom. It was kind of comical, like all dogs and people just moving forward. But these certificates look so hilarious, but also so good, and I love them.
Good, I'm glad.
Also,
you waited until today to open it. That's great.
I did, yeah, because I needed to make sure my draft was written.
Great.
That was a personal goal. And you know, the little thank you from Coldo, or congratulations from Coldo, it was so sweet. Tell him I said thank you.
I will. He wanted to do that, so
yeah, amazing. Such a good kid.
It was fun.
I'm wearing my pin. Thank you very much. I didn't wear it because I forgot about it, but I wanted to show you.
So people can see.
I have my pin on, and here's my certificate, and I want to thank you for it. Yay.
Absolutely. This is the honors thesis pin, and I'm not wearing it because I didn't write one as an undergrad, so I can't wear it. But you all get to be the proud wearers of this. I did everything I could to get out of research writing at the end of my senior year. So, so that you know. And, you know, I mean, sometimes you all know how to do this. You're smart enough to figure out how to convince your professors to do something different, right? And yeah, I probably shouldn't have done that. I probably needed research experience at this stage, and somebody let me write a short story instead. So not necessarily proud of it, but I don't get to wear one of these for that reason. It's not a very good short story. You wouldn't want to read it. I also told him he can't wear this because he wanted to, but not yet.
I'm intrigued by this short story, and I want to read it now.
No, it's actually, I'm so mad that I even brought it up. It's really bad.
I'm like now looking at this pin, and I'm thinking about what we all said the first time we got it. Should we tell everybody if they're here what we think it says? Do you remember?
What?
Honors Thesis. Now nobody can unsee it. If you have your pen, and look at it and tell me if it looks like honors or honors.
Shayla.
Sorry, I'm allowed to cause trouble now. You gave me my certificates. It's happened.
Thanks, Dr. Pantos, for being here.
Okay, well, I must go run errands, but I will watch these presentations later. Where is this doc that we can answer the questions on?
From the panel?
Yeah.
I will just create that document from your panel questions and then share it with you all, okay?
Oh, okay. Cool.
Okay. The moderators have been putting the questions, all the questions, hi Z, have been putting them all into a document, into a shared doc, which is nice. So I have that on my computer and I'll just share it with you afterwards.
Great. Thank you, Dr. Forgash and Allie, for being wonderful moderators. I know it's tough, so I appreciate the hard work.
And how?
You're welcome. There's a little communication lag between all the different platforms that we're working with, and sometimes I would cut and paste a question into the document, and then I'd see somebody else, and Megan had gone and cut and pasted it, so then I was like, wait, she didn't see mine, and then I was, this has been really fun. You all had a great, all the presenters did such a nice job.
Yeah.
Thank you.
Thank you, Dr. Forgash.
Yes, thank you for doing that. It worked pretty well, I think, didn't it?
Yeah. Multitasking is not my forte. Yeah.
Yeah, well, I don't know. We've got this Google Doc open, and it seems to be working, so we'll just keep on going. So what's everybody going to have for lunch?
An apple.
An apple.
Tortas. I'm going to go get tortas.
I had leftover Indian food.
I think we need to figure out how to use the snail fork and the oyster fork and the lobster fork.
Yeah, I don't know. That's not going to happen in my world today.
Doesn't that just mean you eat those with a fork?
Well, in that image, there were all those different kinds of forks, right?
Yeah, I know, but if you eat a snail with a fork, doesn't that make the fork a snail fork?
I think they're special. Like, I mean, they're, if people who know about these things, They know exactly which fork they're using and where it goes in the place setting and all this stuff. Now, you know, I don't know. It's like a little bit of antique knowledge of certain areas of U.S. society.
So I have a problem. Tonight, I volunteered to DJ a pajama dance party. And this is for the Epic Scholars at MSU. And I've told a few people my playlist, and the young people are very like, what in the world? I do not know any current popular dance songs that my Epic Scholars could appreciate. And I have to try to figure out, because sometimes I listen to some suggestions, I'm like, ooh, really? So I thought about making it a retro dance party. That would excuse my music, because then I could be like,
let's style of the event. You're good.
But I do need suggestions for popular dance music. I've never DJed before in my life. But
do not relent, Jeancasia. Change nothing about it. Just keep all the music the same.
Really? You don't even know what it is. What if you're like, what?
I trust you, Jeancasia.
You do? Nice.
Of course.
Also, Shayla, you could share the Nerd Herd. Oh, Shayla left already. The Nerd Herd News has a song list in it this time.
Allie, it doesn't matter what it is.
So those were suggestions from honors students of music?
I think it was one student who made a song list, a playlist. I'll see if I can find it. But I don't know if it's what you want. I think it's more like happy songs. I don't know if it's dance songs.
I need dance music. I want everybody out of their seat and going nuts.
Well, I would send you stuff that they would also not recognize maybe, but it would still be good.
Yeah.
Seriously,
that's what I told
Jeancasia, ask Christopher.
Yeah.
Okay.
I was gonna say the Epic Scholars created a playlist that Miguel shared with everybody. And so I think some of the Epic Scholar students have put some of their music on.
The thing is, so that's on Spotify, right?
Yeah.
So I listened to some of those songs and they're not dancey. They're not get up out of your seat and shake your tail songs. So I will reconsider. I'll try to listen to some again, but they're more like chill, like sit back. But I want club, like get out, get crazy kind of songs.
Rave.
Hey, you're going to come tonight, right, buddy? To the party, right?
Are you talking to Kaiba?
I'm talking about the guy who just talked.
Yeah, Kaiba's here, everybody. By the way, I love you, Kaiba.
Hi.
Thanks for being here.
I graduated in December, so I don't think I am allowed to or something, but
just crash it, Kaiba.
Yeah.
I'm not the
I'm sure
moderator.
Miguel would be
I'm not the
fine,
administrator, so I'm not really sure I don't even know what platform they're going to use. So I would send you a link, but I don't know how.
Yeah, it's all.
I want everybody to come. I want as many people to come as possible. I have a nephew that I called yesterday because I just remembered, and he's local famous, and he's a rapper, and I asked him to DJ, and he might DJ tonight, so we might even have a celebrity special guest star.
Just play Dancing Queen by ABBA and everyone will be happy.
That's the thing. I suggested stuff like that, and my nephew was like, what? No, that's songs that your generation would like. not early 20s is probably the what we're looking at. And he said people want to know the words to the songs that you're going to play, and they're not going to know those songs. I was like, oh, I see.
I would definitely appreciate Dancing Queen. I'll just put that out there.
Good, good.
Kaiba knows how to party.
I feel like I have a good mix of kind of like older songs and like newer songs, but yeah.
So what else is everyone else going to do this weekend? Sleep?
I'm going to edit my paper.
Yeah,
Edit your paper? Still have projects?
Yeah.
Mostly everything's due tonight, so.
Yeah?
Yeah. I have some wine tastings due, so I'm going to get wine drunk after this.
There's wine tasting due?
For my wine class.
Wow. Was that class attached to a study abroad, perhaps, that didn't go?
No.
Because I heard last year that there was going to be a study abroad that had to do with wine tasting. Or they proposed one.
3 wine tasting classes. I'm in like the very beginning one.
Mm. You can't taste wine abroad until you've at least done the 101 version. Interesting. I think it was going to go to Italy or something.
Yeah, that picture that I sent you was actually in France at a wine festival.
I wondered where it was. I knew it was, somewhere in that region, but not sure where.
Yeah.
Nice. Where at in France?
Saint-Emilion.
Mm-hmm. Beautiful.
Mm-hmm. Definitely my favorite place ever.
Were you working on projects yesterday when I called you?
Yes.
I could tell. You were like, here you go, bye.
I was working on my textiles project that I've been putting off because I thought it would be easy, but it involved way too much math.
Yeah. Everybody's really busy right now. But we're really close to the end, so it's expected.
Good.
Do you all have any other graduation celebration stuff happening this weekend or next weekend, or is today the main thing that you're doing?
My dad's coming to visit.
Cool.
This is the big one for me.
Same.
Mm-hmm. Well, I'm glad that we are able to do this. It seems like, we're making it through, and there was a few technical difficulties, but I think that for the most part, we've been able to do what we intended to do. So good job, you all. I'm amazed.
Yeah, it's worked really well.
Did you guys not hear a lot or just a few moments when I was having in the middle of the technical difficulties?
I could hear it. I didn't lose anything. There were just sometimes when your voice faded out a little bit, but I didn't lose any of the content.
Okay, good to know.
Yeah.
Is that how it was for the rest of you?
Yeah, it was just like you could still understand everything totally fine.
Okay.
And like I said to Jeancasia, it got better after Megan mentioned it for some reason.
The weird part is it was in the same part as when I practiced with Liam and Shayla yesterday. It was the same part, and I don't know why. I made sure that my kids weren't on any Wi-Fi. We turned everything off to, if it was traffic was the problem. So it's kind of weird. I don't know.
Yeah.
Jeancasia,
What?
Sorry, Liam, go ahead.
Oh, I was just gonna say it was sound wise much better than yesterday. Like that
Really?
because I could understand everything.
Good.
Today. When you were
Thank
practicing
goodness.
yesterday, there were parts that I couldn't get, but today everything came across. So it was good.
Okay. Well, my dog screamed in the middle of my presentation yesterday with Liam and Shayla, and I was like, oh gosh, and I looked over and like, what the heck are you doing? And I was like, do you not say anything? Like pretend like you didn't just hear a scream in the background, or do you acknowledge? There's something going on over here. I don't know. So,
I think because your dog scream sounds so much like a human scream, you might want to acknowledge it.
Right.
But thanks for that happening.
Jeancasia, for your presentation, you had background music with it, right?
Yeah.
Like, yeah, that's what I think it was. It was competing like with your voice, and it was just going back and forth. I could still hear like both pretty much the whole time, but that's what I think it was.
Okay.
Yeah, and there's a lot of people posting in the chat that they were able to hear it all in spite of the little, interference, whatever it was.
Okay.
They were still able to make it all out. That's what I was hoping, that they could understand everything. Because on my end, I could hear the interference, but I could understand everything. So.
Okay.
Cool. And also, Jeancasia, in case you didn't see in the chat, the song Flamingo.
I can't see chat. I don't know how. I wish I could, but I can't see chat.
You can't access the chat.
Ever?
This time. Sometimes it's going, and sometimes it doesn't, and I don't know why.
So do you know where to find it on that little bar? Like if you get all the buttons up, can you see them?
Yeah, I have the buttons up.
Do you see the one that looks like a conversation bubble-ish type thing?
Oh wow, I can see it, but it's so small I can't read it. I wonder how you make it bigger. Okay, well I can at least see it now. Thank you.
Okay.
This whole time I was like, I don't know what they're saying.
Yeah, there's a chat.
Hey, Jeancasia, yeah, since you weren't able to, Christopher actually just posted the link to a song that Kaiba and I referenced for you to look up. You could write it down, but it's Flamingo by Kiro Bonito.
Flamingo. Who? Kiro.
Kiro Bonito. Which, thanks by the way, Christopher. And yeah, also, like I said, ask Christopher about music.
That's what I was gonna say. I second the idea that Christopher probably has a playlist that you could just use if you really wanted to abandon yours.
Do we know each other, Christopher? I don't know. We know each other. I will, suggest a way.
Yeah. We met once a while ago, yes. So I think I am going to find something for lunch. I don't know what.
Do it. Get an apple. Also, I texted you, Dr. Megan Hughes-Zarza, just so you know.
Okay, I'll see what it says. And then I'll be back in a few, but feel free to carry on hanging out if you want, and I'll be back in a few after I figure out what is in the fridge.
Okay.
I'll be back. Okay.
Oh. So, like, Liam, I wanted to tell you, I really toned it down, I think, from yesterday, because it was kind of, from the feedback I was getting from not just you and Shayla, but I did tone it down quite a bit and not sound so attacky.
I think that, yes, but then like your tone came back in the comments section.
Like, yeah,
what?
I know. I'm passionate about stuff.
Yeah, I think it was good. I think it was all great.
Oh, good. Thanks.
Bolton and Anna, are you guys ready?
Uh-huh.
It was confident.
I mean, I'm just stressed about getting it on the screen. It's all pre-recorded.
Oh, sure.
I wish I had known those bios a long time ago about everybody. I wish I had known more about everybody instead of the last day,
Yeah, I was thinking about that. We didn't really get to, hang out as much as I think other thesis classes did, just because of all of it. But
yeah,
that's okay.
I have a question. Can I screen share and turn off my mic and my camera, and it will still like play everything without a problem?
That's how it works for me, yeah.
Yeah, I think that's what Sophia did.
Because I don't want to like awkwardly be like sitting in the corner just like staring at my face.
No, I think Sophia turned everything off.
Yeah.
Okay.
Colton, what are you listening to?
It is girl from how's it pronounced?
Ipanema. Yeah. Uh-huh.
Colton, can I have a bite of your apple?
Yeah, come over.
Perfect.
You know the story behind that song, Colton?
Tell me.
A few years ago, I took a class called, I don't remember if it was Jazz Appreciation or History of Jazz in America or something like that. And we learned about that song. And as far as the singer, she happened to be like a girlfriend or a wife of one of the musicians, and it was like a last minute. Oh, my wife can add some vocals to this track, and it was a local person, I believe, where they were, and it was very organic and legit. I mean, there's way more to it than that, but that's what I remember.
Cool. It's a good song.
So Colton, that's actually your beard.
Oh, Kelsey, so you got on. Can you show yourself?
Sure. Hi.
Hi.
Hey, Kelsey.
Okay.
Hi, Colton. That's your beard? I thought it was a mask. It
Hey,
looks
give me
really
one
cool.
second.
Yeah, let me see it.
Yeah, so can you see that?
No.
No. Okay.
Well, I'm stuck on Jeancasia. I don't know what happened.
I can do off my camera.
Oh no, please don't ever. You are strikingly Jeancasia. Oh no. No.
Okay, I see your icon now. Oh, there you are.
Colton,
That's your beard.
What are you trying to do? You trying to butter me up for something?
No, I'm just trying to butter you up, period, not for any reason, just to do it.
All right.
No, I'm kidding. Yeah, so I don't know, Kelsey, should we like try some test or something? You're muted.
I believe you now. It looks like a mask, but I can see it now. That's like your beard.
Thank you. Is that racist at all? Because like you couldn't see it because of the darkness?
I just think it's because like the camera quality probably.
Oh yeah, you're right. So you're racist by saying that I'm poor because I'm black, right?
Why are you exposing me? How many people are watching this right now? No, I think it's a lot to do with the fact that your mustache isn't as full. So like it's just hard to tell.
Sure. Okay.
All right, I'm gonna go away now because I just feel like you called me out.
Okay, I love you, Kelsey.
Okay, bye. I love you.
Colton,
Jeancasia.
tell me, what is your nationality, your heritage?
My nationality and hair. Well,
If you know. Some of us don't, so.
there are 20 people in this meeting. Okay, everyone leave, and then I'll answer the question. No, I'm kidding.
No.
No, I'm kidding. I was born here. That's my nationality. I was born in Denver.
Okay.
Yeah.
Well, what
Wait,
mom and dad?
hold on 1 second. Enrique said I look like Karl Marx. That's the best compliment I've ever gotten before in my life. Sorry, what'd you say, Jeancasia?
What were mom and dad?
Well, so Jeancasia, I'm Pangean.
Exotic. You know, so in some of my research, people wanted to tell people, hey, being called exotic isn't a compliment. And people think that's like a compliment. It's like, that's not a compliment.
And you just did it to me.
In a jokey way.
Yeah, no, it's cool. You know me, Jeancasia. Now I'm always tongue in cheek.
Mm-hmm. Yesterday when I was practicing with Liam and Shayla, I went to 20 minutes. I think I went over 20 minutes. So I tried to speak really fast, and I did cut things out. But I certainly didn't get to say everything I wanted to say. No way.
Yeah.
That would take forever.
Yeah. No, I think it worked well. I didn't time you, but I don't think there was any kind of...
My daughter was right next to me showing me the stopwatch, and it got to over 15. I was like, okay. And then I think it was probably almost 17 minutes, probably. Because I was like, I can't stop. I have to say this last part. And then,
Yeah.
So.
Shayla asked me to time her right before she went on. And she was at about 12 minutes, I think.
Okay.
So it all evens out. Yeah.
Also, again, Kai, thank you. I love you.
I want to butt in and say hi from Germany.
Ted!
Hi, Ted.
Hi, I don't know if my camera's on. Hold on.
Here's looking at you, Ted.
Hey, guys.
Hey. How's
Your
it going?
hair!
Oh, gosh.
That's amazing.
Thank you. It's bad luck that this is happening, but good luck because I can participate rather than just live stream. So,
Indeed.
Good to see everyone.
Yeah, it's
You
amazing. That's not Ted. Ted has short hair.
It's been a year, so a lot can happen.
Time has passed.
Presentations are great so far, you guys. I can't wait to see the rest.
Thank you. Yeah, it should be great.
Do you see this, by the way, that I still have this?
I can't see Colton. Let me see. Yes.
Oh, let me keep talking. So yeah.
Yes.
Yeah.
Oh my goodness.
Thank
You're
you
amazing
again.
that you still have that. I don't even think I still have one of those, even though I made it.
Of course, I'm always gonna keep it.
Oh, you're sweet. All right, I'll jump off to let current students continue to talk, but I'm really happy to see everyone.
No, you're good. We love you. Thank you.
Good to see you, Ted.
Love you too, guys.
Cool. Okay. Do you guys want to meet my cats?
Please.
Yeah.
Absolutely.
This is Ellie.
What was that noise?
Ellie,
I'm just so excited.
Oh my gosh.
Is that a bell on the collar? Are you kidding me?
This is Luna.
Hi, Luna.
And then there's one more somewhere. 1 second.
This is the best day ever.
Herding cats.
This is Molly.
They're so cute.
What's this one's name?
This one's Molly.
Molly?
Because she has an M on her forehead.
I agree, Enrique. I think that's a perfect name for a cat.
My
Let
friend
me know
wanted
if the
to
music
name her
is too
Captain
loud,
Marvel.
if I should turn it down.
I can't even hear it.
Oh, you can't? Never mind then. Now can you hear it?
No.
Nope.
No, really? Oh, okay. All right. Never mind then. Thank you, Riley. I'm glad you're here.
Wouldn't miss it for the world. Don't want to impose on your symposium, so I'm keeping myself muted because I'm at work. But I've got this pulled up on my phone in front of me.
No worries. Thanks again.
So what does it say about us that we have almost as many people attending while we're just sitting here?
That maybe we're attractive people.
It says that I'm avoiding my homework.
It's good to hang out, right? We just all need a little hanging out.
This is my social enrichment.
Yes. Yes, Kai.
Alright, I'll give you guys privacy. Mama.
Mommy might even give you a treat once in a while, put some flavoring in it.
Hey, Jen and Megan, are you there?
typing a message to you, Ted. It was like, tell us how you are. I'm trying to finish.
I don't want to take up too much. I don't want to take up too much time. I already said hi, but I wanted to say hi to you too.
Yeah, hi. How are you? It's so good to see you.
Good to see you guys
I'm
too.
muting myself because I'm finishing up my lunch. But talk. Tell me how you are.
Good. Normal. I mean, as normal as anybody, I guess, in this situation.
I love your hair, Ted.
Oh, thank you. Yeah, it's
Awesome.
down to my shoulders now.
It looks great.
Thank you. Yeah, it's past sunset here, but yeah, online classes are yeah. I miss being in person, but I think everybody feels that way. Or a lot, but yeah, we're good. And I was saying this before, but it's kind of a weird good luck thing in my case. Not that anything about this is good, but hey, I can participate from Germany, whereas otherwise I would have just seen the live stream. So it makes me kind of happy.
Well, I think that there are certain things, there are for sure certain things that we want to keep on doing in the future, right? Like this is really cool, and we need to really improve our outreach to alumni, as I said to you in my email. But and then do this so that people can participate, because it's cool. It's so good to see you. I was so excited when you responded right away.
Yeah, it's a Friday night, so I'm not doing anything except being home. So, I could be doing homework, but that's, always the case, right?
Right. Yeah, Friday night during a pandemic.
Right, yeah. It's a party for sure.
Yeah, how's the program been going there?
It's pretty good. It's very, very different than the United States academia. Don't want to complain, but I definitely miss the honors program, let's just say.
Wow. Yeah, every academic experience is a different world, right? But you learn so much.
Oh yeah. I'm
so dynamics,
totally
right?
Person. Oh, say that again?
Just the dynamics of different programs makes you learn.
Yes, absolutely. And I actually really like my cohort because there's only one student from Germany. Even though we're in Germany, there's only one student from Germany, and the other 6 of us are international students. So I just think it's a really enriching program in that regard.
Yeah.
Absolutely. So yeah.
Yeah, in all of my graduate programs, it was like that. It was really, really mixed.
Yeah, it makes me really happy.
My first experience was exactly like that, only in Kansas, and there was like only 2 of us from the U.S. So
wow. Okay, that's great to hear about Kansas. I wouldn't have expected that.
Yeah, I also would not have expected that.
At the graduate level, weird things happen, right? Okay. See you guys. Thank you. Have fun.
But anyways, I wanted to say hi. I miss you guys. Thinking about you. Really grateful that I'm able to participate in the thesis symposium, and the presentations are great so far. And
what time is it for you right now?
It's 9 p.m.
Okay.
Yeah, the sun's still kind of out, or not? Well, it's set, so it's like it's a little bright, but yeah.
We're so glad that you were able to join us. That's so cool.
Absolutely. Thanks for the invitation.
Yeah. Oh, it's yeah.
I said hi in chat. I just want to say in voice too.
Hey Andrew, so good to hear from you. Miss you guys so much.
What was that?
All right, I'm gonna sign off, or not leave, but I'm gonna sign off.
It's good to see you.
Everyone.
We're so glad you're here.
Good to be here. Bye.
Allie, thanks for helping moderate this morning. That's been so helpful.
Yeah, it's been fun.
You guys are killing it on that. It's good. All the questions just appear.
What's it look like over on the live stream side? Just, can you see a lot popping up in the chat? Is that how it works?
Yeah, so there's just like a comment section on the side.
Okay.
I don't think it's quite as popular as the Teams one, but there's definitely some discussion going on.
I had them both on initially. That was not good.
You were like in an echo chamber?
Yes. And I was like, nobody else seemed to be hearing it. And then I was like, oh yeah, I remember them talking about that as being a problem.
You were in the past and the future, or in the present and the past?
Yeah, something like
at the same
that.
time?
Yeah.
We had my mom has the live stream on YouTube going on downstairs, and she's got it on the TV.
With the surround sound?
Yeah, so every once in a while, if it gets too loud on this, I can hear it down there, like 30 seconds later.
That's funny.
After the presentations, I was downstairs, like, grabbing some food, and I hear Megan, you go, Liam, are you there? And, like, run upstairs real quick.
Well, I was trying to see if anybody was there that could help me with whatever I was trying to do at the time. Yeah, that's funny. Well, you had an audience of like 3 or 4 people in my office at one point during your presentation, but the 4-year-old peeled out pretty quickly, and then, you know, Koldo stayed for like 5 to 6 minutes, and then he was like, it's good. I think I'm going to go.
Good.
So it was cute.
Yeah, that's awesome.
And his stuffy, Mr. Sloth, was also here.
Oh, great.
Mm-hmm.
Yeah.
Along with
Olivia.
Olivia.
Mr. Sloth would come.
Yes, Mr. Sloth. So it was good.
Yeah, that's awesome.
Yeah. Yeah, no, I have the YouTube pulled up on my other screen and it's silent, but I just saw us laughing a second ago.
Oh, no. So will that be like the recording then?
Yeah, we have that all recorded on YouTube. And then I think Andrew will help us with it if we want to slice it up. I just assume because clearly I won't be doing that. Somebody else who knows about that will be doing that. And usually that's Andrew.
I heard my name. What did I do?
You can't ever graduate because we need you to help us forever and ever and ever with the technology.
Oh, Megan, I did remember what I was supposed to put in chat, and I did put it in once. I'll go ahead and say it in voice for anyone who's listening. If you want honors credit, make sure that you appear in the YouTube chat at least once, and if your name isn't obvious, that you also write your name.
That really messes with certain people's incognito style.
Thank you, Andrew.
Whoever this is posting as Kelsey Percival, that's clearly Lucas' stuff, so I'm gonna say Lucas.
What? Clearly. What? Oh, that's funny. Steven, what are you putting in there? What's this link? Oh, is that just us? Is that just our link? Yeah, it is, right?
Yeah, and it was just asking for the link.
Thank you. I see it. I thought it was going to be a, you know, list of dance music. Are you ready for your presentation, Stephen? You ready to go?
I think so.
You are. I know you are. It's going to be great.
My mom just knocked on the door and walked in.
Yeah.
And wanted to give me my graduation present.
What?
I have my own stuffy now that is colored.
Yeah, wow. He could definitely be friends with, well, I don't want to assume, but your stuffy could be friends with Mr. Sloth.
Yeah, it's safe not to assume, but.
I mean, you know, you'll just have to, you'll present them with the name at some point, and then I'll address them properly. That's funny. Come in.
Todavía de cháchara.
Yeah.
What's your plate?
It's right there.
Oh, sí.
We're just on our lunch break and then we're going to start.
Ahí estoy yo. Hola, Liam. ¿Qué tal?
Hola. ¿Qué tal?
Felicidades.
Gracias.
Estás muy elegante.
Pues gracias. My mom was like, no, that shirt's too wrinkly. You can't do that. And I was like, no one's going to see past here. Pero también llevo pantuflas. Entonces es...
Está bien.
Can't be that bad of a thesis.
Arreglado, informal a la vez.
Yeah.
Arreglado e informal.
Mm.
You're the modern man. Muy bien.
It's been a good day.
Pues yo me voy a...
You know, Liam, some newscasters are foregoing pants because they know nobody can see from like there down, and unless the camera, I don't know, is a funny way, but I think that's hilarious. I almost did my presentation from my phone this morning because it was such a long trip to take my kids' friends home. So
yeah, that would have been fun.
Right, but I managed to make it back home in time.
Good.
Yeah, I'm glad you didn't have to do that from your phone.
That would have been weird. Yeah. I would have turned my camera off so nobody would have known.
That's funny.
You could have heard honking though or something maybe.
Where are you going to put the owl?
I don't know. I'm trying to decide. Like, do I want it in the background for everyone to see?
Well, sure.
There we go.
Yeah.
It's good.
Except I block it.
It goes with the. Well, now we can't see it. There you go.
Yeah.
It looks like they're in that landscape.
Yeah. Maybe I should hang it from the plant so it looks like they're flying.
That would take a little bit of,
I can't. Yeah. A little bit of engineering.
Yeah. What was I going to say? I was going to say something. Oh, I don't remember. Something about the owl and trees, but oh, yeah, it just went along with our theme, for that poster.
I was going to say something. Oh, yeah, I don't remember.
And then I did remember. I'm sorry. Oh.
Holden, don't attack Megan like that.
Listen, I attack everyone, Allie.
That's
everyone.
fair. You're very fair about it.
Yeah, I'm equitable in my attacks.
Wow. If that's the worst thing that happens today, I guess we're good. So, I'm going to make sure that we have everything we need, actually.
Hey, Megan, if Jen is, I don't see Jen. Maybe she's here. Hold on.
Here. No, I see.
She is. Okay.
Yep.
All right.
So, Jen,
thank you for taking over the moderator.
Yes. And you're ready to go. You're in the document, right?
I just asked permission.
You asked permission. Do I need to go to my email and get you in there?
You might.
Okay, I can do that. Okay. Okay, there it is.
Thank you.
Yeah, that should do it. Did it just come back to you? It's loading. Okay, I'm sending it again.
Okay.
And we'll just scroll down and to the bottom and just start there with panel 3.
Got it.
Perfect. Okay. And then if you just pull the questions that pop up in the Teams chat, then we should be good to go.
Okay.
And then Allie will be populating the ones from the YouTube. Thanks, Allie, for doing that again.
Melissa Camp. Hi there.
Is now joining.
Welcome,
Okay.
Melissa Camp.
Yeah.
Thank you.
Okay, so it is 1:16 by my phone, so we're already a minute late. We're gonna get going, right? So yeah, welcome everybody. Thanks for being here. And sorry, I'm just pulling up one. Okay.
Hi, Colton.
So
Mute yourself.
I will. I just want to say hi first.
Well, thanks for being here, everybody. My name is Dr. Megan Hughes-Zarzo. I'm the director of the Honors Program, and I'd like to welcome you to the third panel of the Honors Thesis Symposium for Spring 2020. The panel title is A Beginner's Guide to Designing a Library, What Rhetoric and the Creation of the Universe Have in Common. So, kind of a simplistic title, right? Anyway. I'm going to see what our panelists have to say about that. We have Anna Erickson and Colton Lee here this afternoon to present on this topic. And I just want to give you a few instructions before we get started. We would just ask that everybody please mute their microphones and then turn off their cameras during the panel presentation. And after both presenters have presented, we'll open it up for Q&A. But during the presentations, please feel free, if a question comes to your mind, to type it into either the chat in Teams or the chat in YouTube. And we will start populating those along the way into a Google document so we're ready with the questions for the Q&A. If you would like to address the speakers directly, you can indicate that with an asterisk or just say you'd like to ask a question, and feel free to do that. We will put the questions into the Q&A in the order that they're received. So the sooner you get it in there, the more likely we'll get your question out there. And we'll also have advisors be welcome to ask the first round of questions once we get to the Q&A. So yeah, we'll go ahead and let the panelists get started. You can also find a link to the program if someone wants to put that up. Colton, do you mind doing that one more time? Link to the program in the chat. I know Andrew's going to get that on the YouTube chat, and then we'll get it.
Trying to find it, yeah.
Okay, perfect. So Anna, are you up first?
Yes, I am.
Okay, well go right ahead.
Can you see this?
Yes.
Yes. We can't hear it though if it's playing.
You can't hear it?
No. Do you remember to click that box that says share the audio? You might have to stop sharing and then open up the sharing again.
Hello, everyone. My name is Anna Erickson, and my project is on spatial rhetoric in relation to industrial. Sorry?
It's working. We can hear it.
Okay. Hello, everyone. My name is Anna Erickson, and my project is on spatial rhetoric in relation to industrial and interior design. My goal for today is to dive into how Aristotelian rhetoric can bolster a designer's ethos, pathos, and logos. The specific topics are: what is rhetoric? Where do we typically see rhetoric? Rhetoric in design, pathos of design, ethos of design, and logos of design. What is rhetoric? The word rhetoric often sparks controversy and fear due to the modern day use. We often associate rhetoric with corruption and politics. Fear is used to manipulate the public into making decisions based on what powerful people want. Is rhetoric only used as a means to instill terror into an audience? Can rhetoric be used in another light to spark passion and new ideas? The misconception of rhetoric in today's society is dangerous because rhetoric applies to almost everything. My goal is to bring light to a different idea of rhetoric. Rhetoric can have a positive influence on an audience rather than a negative impact. In English, we typically define rhetoric as the art of using words effectively in speaking or writing. This type of rhetoric is mostly seen within speeches, books, and essays. The history of rhetoric is quite extensive, and rhetoric had origins in Athens, Greece, within the second half of the 5th century BCE. But today I won't be analyzing the history of rhetoric too deeply. First, we're going to cover the rhetorical triangle and the most important aspects of it. As you can see, there's a little bit of terminology associated with the rhetorical triangle. Today we're going to be focusing on ethos, logos, and pathos in their most basic definitions. Ethos has to do with the credibility of the speaker, pathos is the emotion that the audience feels, and logos is the logic or fact of what is being stated. The 5 canons of rhetoric are invention, arrangement, style, memory, and delivery. Aristotle came up with these canons to help people prepare for speeches. The canons help people use rhetoric as an art to effectively communicate their message. The canons help you prepare to write or speak by helping you understand what your purpose is and how you can most effectively communicate your ideas with an audience. By utilizing the 5 canons of rhetoric and the rhetorical appeals within the rhetorical triangle, the information you are trying to convey to an audience will be strengthened. Historically, rhetoric is associated with public speaking and writing. But today, we aren't going to be looking at rhetoric and writing. We're going to be looking at how designers can utilize Aristotle's ideas of rhetoric and apply them to make designs both more effective and meaningful, and how they can use rhetoric to take on a more ethical approach to design. So where else do we see rhetoric? Some examples of visual rhetoric would be advertisements and logos. Marketing materials use rhetoric to draw users in so that they can make more money for a product or service. Art is also a great example of rhetoric. There are many pieces of art that we draw ideas from based on the colors, lines, balance, and patterns that are used. While the artist may have not intended to have a rhetorical effect on the audience, their color use could affect different emotions, such as happiness, sadness, and anger. The artist may have used red because that was their favorite color, but while analyzing the piece in a deeper context, the deep red color palette could evoke anger along with any abrupt pink strokes that lack uniformity. Therefore, intent doesn't always equal meaning. When considering products and design, their color, shape, and usefulness all are extremely rhetorically effective. Now let's begin talking about rhetoric in design. What's visual rhetoric? Visual rhetoric uses rhetorical devices to draw viewers into one design rather than another. This can be done by using the psychology of color and the use of various fonts and photos to appeal to pathos, which, as you can recall, means emotion. Visual rhetoric also appeals to the credibility of the brand or the author themselves. Facts can also be used to persuade the audience. We often see this when companies use percentages in their ads. Logos are a great example of visual rhetoric. Many companies create their own fonts to go along with their logo, which helps create a brand and helps people remember their brand. Although not all companies decide to use typography within their logo and they just use an icon instead. Utilizing visual rhetoric in this instance is important because you want your logo to be remembered. Because if there aren't words on there, sometimes it is kind of hard to remember which company it is associated with. This is an iconic ad that Apple came out with that so many people always refer to, and it has great iconography, and it also uses wording to help people remember the brand and help them remember what the brand is about. While this ad for cigarettes is rhetorically effective, it isn't portraying an ethical idea. Smoking may have not been heavily researched when this ad came out, but it's convincing people that smoking is healthy because it's just what the doctor ordered. We can consistently see cigarette companies using rhetoric in their advertisements, but they're using it in a way that manipulates the audience in order to make more money. Now that we've discussed visual rhetoric and rhetoric within 2D design, let's move on to spatial rhetoric and 3D design. Spatial rhetoric relates to how spaces and objects can rhetorically influence the user. Spatial rhetoric also has to do with the thoughts and emotions experienced when entering a space or interacting with an object. and exploring a space or object through aromatic, visual, and tangible means. Spatial rhetoric within design uses the senses to create a design that has an impact on the user. Take a moment to look at this mug. How would you feel if you were holding this mug? The ceramic could be warm or hot, and it might burn your hands. Luckily, there is a handle. Nothing about this mug seems like it wouldn't work. But now compare this mug to the new mug that's on the right side. The use of 2 layers of glass could help reduce the risk of being burned by the material on the outside if you don't grab the handle. This mug could also be more aesthetically pleasing to you. Imagine having a cappuccino out of this mug. You could see the different layers of all the ingredients. While both mugs can hold a hot liquid and they both get the job done, it really comes down to which one is more aesthetically pleasing. The one on the right-hand side is more rhetorically effective than the plain, white ceramic mug. Although, just because something is more aesthetically pleasing does not mean it's more rhetorically effective. What makes something more rhetorically effective is often associated with it being more effective for its intended use. And on the other hand, these 2 products are not rhetorically effective because they don't have a use or a need in someone's life, other than just to make them laugh because of how they wouldn't actually work. Take a look at this room. How would you feel if you entered into this space? Would you feel calm? How do the colors affect how you're feeling? What about the plants? Is the arrangement of the furniture all right with you? Arguably, this room is very rhetorically effective because of the long windows and the bright light that is entering in, and the green of the plants helps you focus and stay calm. Now take some time to analyze this room. How does this make you feel? Do you feel anxious? Does the piece of art with eyes kind of feel a little eerie to you? Living rooms are typically used to unwind or to spend some time with family or friends. This space doesn't seem like one that I would want to be spending a lot of time in. We're now moving on to the elements of design, which will give you a little bit more insight on what aspects of design are important. The elements and principles of design, which we'll talk about next, are the tools and guidelines designers use to create, discuss, and evaluate good design in aesthetics and also function. Lines, shape, form, space, texture, pattern, color, and light are all elements of design. The elements of design all appeal to pathos because they help direct the behavior and mood of the user. Designers can use these elements to positively impact their audience. Now we move on to the principles of design. The principles of design are proportion, scale, focal point, also referred to as emphasis, balance, rhythm, and harmony. The principles, like the elements, refer to pathos because they help a design feel more comfortable and also help relieve anxiety when everything is taken into account properly. These are the 7 main color schemes. Colors, which is one of the elements of design, are everywhere, and they can highly influence the experiences we are having. Arguably, color is one of the most important factors when appealing to pathos in design. Some examples of the impact of color is evident through these color schemes, such as monochromatic and analogous color schemes help create a harmony that is calm and can help relieve anxiety due to the lack of high contrasting colors. And many complementary colors are used for sports teams because it brings about the feelings of both strength and power. Different colors can affect people's productivity, mood, and attitude. Colors within homes, offices, and public spaces all help how the space will be perceived and how it will affect the users and their actions. Although not all colors affect everyone in the same way. Culturally, colors can affect people in different ways, but colors can also affect individuals in a myriad of ways. This has to do with the individual taste and the liking of colors. Many designers take into consideration the wants of the client. Here are some examples of what colors generally mean and how they affect us. Red is associated with excitement and is very stimulating. It increases blood pressure and respiratory rate. Orange represents boldness, cheer, activity, happiness, and endurance. It can encourage movement and can help strengthen the immune system and aid in digestion. A bold, bright yellow can enhance self-confidence, while a dull yellow can bring about fear. Blue can help suppress appetite and help regulate sleep cycles. Brown is associated with nature, safety, and comfort, but it can also cause boredom. Physically, there's no response in people when they see either white or gray. Some examples of differences of the color meanings in other cultures include the following. White represents mourning or death in East Asia and Italy, while the color brown symbolizes mourning in India. In Nigeria, red is an unlucky color, but red represents good luck and celebration in China, Denmark, and Argentina. In Ukraine, orange signifies strength, but in Japan, it signifies courage and love. The last thing that we'll be talking about in relation to pathos today is design for human comfort. Anthropometrics is the study of human body measurements as compared to space. In modern-day anthropometrics, studies find that data compare heights, widths, and sizes of people, whether they're standing, sitting, or reaching for an object. An example of when anthropometry is used is on an airplane. While a lot of airplanes have tight space, anthropometrics help determine how wide aisles need to be and how far seats need to be away from each other in order to have enough legroom. Proxemics is the study of how humans use space and how it relates to environmental and cultural factors. Proxemics takes a look at personal, interpersonal, and public space interactions. Ergonomics concerns the design and arrangement of things people use so that the people and things interact efficiently and safely. An example of the use of ergonomics is a workspace. Now we're moving on to design style and how it relates to ethos or credibility. When considering rhetoric and writing, the author is analyzed. When considering spatial rhetoric, the author is the designer and their credibility is being examined. The design style that the designer is using also appeals to ethos because the design styles have a history and the style's credibility comes into question by the client. Some design styles can feel more credible to a client based solely on their taste and not on fact. Some examples of different time periods that can be utilized through styles are neoclassical, Baroque, Shaker, Chippendale, and colonial Georgian. Some popular design styles in America are contemporary, Mediterranean, shabby chic, southwestern, Tuscan, and modern farmhouse. Now moving on to the rhetorical appeal of logos in the science of design. In order to create a functional and successful space or object, physics and engineering help the design flourish. While the emotion that a design evokes is important for people to notice, when it comes down to it, the design needs to be functional and user-friendly. The best way to make this happen is to have the science behind the design worked out and be successful. In order to boost the appeal of logos, the designer needs to understand everything about materials and processes to make sure that their design is the most aesthetically pleasing as it can be, while it is the most functional that it can be. Now that we've discussed all this, what exactly is spatial rhetoric? At a glance, spatial rhetoric is an analysis of the ways in which individuals can be rhetorically affected by design. Spatial rhetoric refers to the idea of thoughts and emotions brought about when entering a space or exploring an object through touch, and also how people can be rhetorically influenced into enjoying, feeling tired or energized, or feeling uncomfortable in an area. Designers can use spatial rhetoric to understand how their choices affect the thoughts and emotions of their users. Within a capitalist society, designers can use an ethical approach to design by utilizing rhetoric appropriately and positively. By doing so, designers can rescue the notion of rhetoric by using it in better ways and therefore can have a productive impact that can last for generations to come. I want to thank everyone who came to watch this presentation today, and I especially want to thank Dr. Megan Hughes-Zarzo for all of her help and feedback through this process. And I also want to thank my advisor, Amy Kern, for taking time to meet with me and help me throughout this process and help me finish this project on time.
Thank you, Anna. Great job. Next up, we have Colton, and afterwards we'll get right into the Q&A. I'm seeing some questions are starting to pop up in the chats. Are you ready to go, Colton?
Yes. Thank you, Anna, and thank you, Dr. Megan Hughes-Zarzo. Just before I start, to acknowledge something first, for anyone unable to see or hear my presentation, I failed at getting subtitled captions for my presentation. That being said, I thought to myself, okay, I could just post a transcript of my presentation in the chats of Teams and YouTube, and it'll be okay. And I just tried to in YouTube, and I have just found out that there is a character limit. So for anyone watching in the YouTube live stream, if you would like a transcript of my presentation, you are welcome to just reach out to me and let me know. With that being said, I shall now get started.
Hey, Colton. There is also, in Teams, there is a way to turn on captions. Did you just say that?
Yeah, I failed at that, but it's fine. I provided it in the chat and Teams anyway. So in any case, I'll get started now.
Okay.
Good day. My name is Colton Lee. I am from Aurora, Colorado. And first, I would like to acknowledge that I am recording this on land that did not originally belong to me. My thesis topic is the infinite predicate of God. And what does even that mean? Well, a predicate is a term designating a property or relation. So, in other words, the infinite property or quality of God. My project is on the topic of God being infinite. Now, let me get into it. People have called God infinite by saying God is infinite. Here I am saying, what does that mean? Well, let us find out. First, let us break it down. I shall simply into those three words. God is infinite. First, God. Which God? There's about 3,000 to choose from, and that's just the good ones. I am defining God as the traditional Abrahamic Judeo-Christian God, the God of the Holy Bible, the Torah, and the Quran. Colton, those are three different sacred texts, three different religions, so three different gods, you may say. Yes, I know. I am considering these gods, for all intents and purposes, as the same God, and here is why. Within philosophy of religion, this God, the traditional Abrahamic Judeo-Christian God, is considered to be the same philosophical concept of God, partly because they have many similarities, all of them being personal gods, for example, meaning, for the lack of a better term, they are anthropomorphized, in the sense that this God has human qualities, characteristics, and traits. One example being that this God experiences emotions. He gets angry, jealous, and so on. Within the sacred texts of the associated religions, he is also referred to with he, him, his pronouns, which is why I am referring to him as such within this project. So, for this presentation, this is as specific as I can get in defining this God. Now, the phrase, God is infinite. Let us move on to the second and penultimate word, is. As evidenced from the individual in this image, the definition of the word is varies. The definition of the word is depends on who you ask. But we have already gone through this, yes? The infinite predicate of God. Here, I use the word is in the sense that something has a quality, characteristic, property, attribute. So in the phrase, it means that God has the quality, has the property of being infinite. The attribute of infinitude belongs to God, if you will. Now, let us move on to the next word, infinite. What is infinity? This may be a bit more difficult. Mathematically, it is a bit controversial. You see, what comes to mind for you? If something is infinite, it means that it is never ending, has no beginning nor end, is eternal, meaning living or existing forever. Yes? Well, part of the point of my project is that there is no good definition of infinite. In part because when I apply the quality of being infinite to God, it does not make sense, which I will soon demonstrate. There are multiple different ways that something can be infinite. And when I apply those ways to God, weird stuff happens, which is the majority of my project. Here are some highlights. Let us take the definition of infinity of something that has no beginning nor end. Let us take a set. For example, the set of decimals between two whole numbers with a difference of 1. There are an infinite amount of decimal numbers between these two whole numbers. An infinite amount, yet having both a definite beginning and a definite end, being the two whole numbers. So this is an example of an infinite set, an infinite amount of something, an infinite system, if you will, that has a beginning and end. So infinity is something that has no beginning nor end? Well, that does not work. Let us apply it to God now. This God is infinite? This God has no beginning nor end? Well, something can be infinite and still have a beginning and end, which means that it is possible for this God to be infinite and still have both a beginning and end. This makes no sense, though, for this God, as this God's definition includes eternal. This God is never born and never dies completely. So that does not work. Let us look at another way, this time starting with examples from God. The Abrahamic Judeo-Christian God was never born nor created, and this God is a creator God. In addition to being infinite, this God is also called loving, good, knowing, powerful, and so on. Let us say that God is infinite in all of these ways as well. Well, how can God be infinitely loving and infinitely powerful and allow the amount of evil and suffering in the world? For I grant that some of the amount of evil and suffering in the world is not logically necessary. This is not original to bring up. Many of you know this as the problem of evil, a concept within philosophy of religion and theology. One response to this is, well, it is not that God allows evil and suffering, that is just what comes with free will. Well, the problem with that is that I do not grant the veridicality of free will. For if God has an infinite amount of knowledge, that means that God knows all possible past, present, and future events, and knows what will not happen and what will happen. This enables me to challenge the possibility of free will. For how is anything ever a choice if everything is always known? In this case as well, definitions may be refined. In any case, the possibility for God to be infinite in love, knowledge, power, et alia, can all be called into question. So, what do rhetoric and the creation of the universe have in common? Well, they both pertain to intent, purpose, and design, of course. They are both things from which meaning may be derived, be it a phrase or sentence, be it a room with eyes in it versus a room with green foliage in it, be it the universe itself, or even be it a library. Now, what was the point of this? I mean, what have we learned? Well, there are problems with both the definition for infinity and God. There are exceptions to some definitions for infinity, so it can be refined. I asked what people mean when they say that God is infinite. Part of the problem is a lack of specificity. For God can be infinite in multiple ways. It is possible that this God is not infinite. For it is possible that it is impossible for this God to be infinite. And if the definition of God can be called into question upon further inquiry, so too can the existence of God be called into question. Now, let me look at the rest of the panel title for Anna and I. A ver. A beginner's guide to designing a library. Yeesh, I do not know if we can live up to that. Other than saying this from experience. It all begins with just one book. Thank you.
Thank you, Colton. Okay.
Great job, Colton.
We have arrived at the Q&A, and we have got quite a few questions starting to pop up. So let's go ahead and get started. And remember that you are welcome to submit your question in the Q&A, and you're also welcome to go ahead and ask for permission to address the panelists directly if you'd like. We will take both kinds of questions. We'll get started with one for Anna. And you may have answered it, I think, after the question was even written, Anna, but there was a question about the color ideas. Are they universal or cultural? You want to go into that a little more?
Yeah, so the first definitions of color that I gave was based on the United States, but once I went on it, I talked more about how it's cultural and how in every country it's completely different. And the physiological response that people can have can change depending on where they're from.
Okay, great. Also, I want to reiterate briefly and quickly that we would definitely like to invite your advisors to jump in if you, Amy Kern is here and would like to address Anna directly. We'd love to have you do that if you'd like to. So let's see what else we've got here. Question for Colton from Andrew Pena. Did you include this part between the numbers between 2 and 3 just to appeal to my crusted mathematician heart?
Thank you, Andrew. That's you said that's Andrew Pena?
Yes.
Let's late to that.
Okay. Thank you, Andrew Pena, for your question. I shall repeat back the question, my interpretation of it, and attempt to address it. Yeah, one of my biggest weaknesses, I would say, in this project is the area of maths. This project, as a total for me, has become much more about infinity than God, and yeah, I hear your question to be yeah, like what about the math side and the maths portion of it, and I don't get into that. Like one area being, I don't address that there are infinities of different sizes. But the reason why I included that, Andrew, was for my love of you and everyone else in the world.
Okay, another question for Colton. In considering the problem of evil, you're tangling with the same questions that early American Protestants did. If God is all-powerful and all-good, where does sin come from? From Dr. Balick. Not that sin comes from Dr. Balick, the question comes from Dr. Balick. Clarification.
Yeah, may you repeat the question?
In considering the problem of evil, you're tangling with the same questions that early American Protestants did. If God is all-powerful and all-good, where does sin come from?
if I may just interject, I wasn't even necessarily asking Colton the question. I was just sort of observing intersections between what he's thinking about and what I'm often thinking about, and that, you know, thinking about God as infinite and the source of good, that raises a very serious question about where evil comes from. If God is the source of everything and all understanding. It was more of an observation and a response.
Sure. Well, I can respond to it. Where does evil come from, or where does evil or suffering come from? Like, if you prescribe to a creator God, then and God created everything in the universe, then God definitely may have created all good and all evil. Or thinking through something like the fall, sin may have originated in man. Etc. There are different theories of evil and what evil is. There's the privation theory of evil that I like, just being that evil is not really an actual thing or substance. Evil is just the lack of good, and the only thing that exists is good. And what we may perceive or observe to be evil is not actually evil, it's just the absence of good. So yeah, where does evil or suffering come from? I may know as much as you.
Thank you.
Can I ask Colton something?
Yes.
Here? Thank you. Colton, I did not know that you knew Professor Hansberger. Is Professor Hansberger here in the
I'm not sure. I'm not aware. But
okay.
But so the question is on William Hansberger, and who may that be? In my acknowledgments, I include many people who I consider to be my teachers and people who have influenced me and helped shape and just change me as a person, who have really helped educate me. Once I started my degree in philosophy, the first class that I took in that, Intro to Philosophy, I had an instructor named William Hansberger, and I loved the class, and that is part of what started this. So yeah.
Thank you. I just wanted to say I know him very well, and he's practically family, and I know how he feels about your presentation. And I just wondered if you knew how he felt, and if you ever asked him these questions, he would go on and on to talk with you about these. And as I'm sure you knew since you've taken him.
Yeah, thank you. I take your question. At the end of that class, the final in that class, actually, Intro to Philosophy, the final in that class was a debate. And Professor Hansberger and I have never spoken personally, but in that debate, the final in the class, I argued against the teleological argument for the existence of God. But yeah, so no, connect us at Jeancasia. But speaking of that, though,
and he would love to talk.
Thank you. Yeah, speaking of the teleological argument for the existence of God, another word for that argument is the argument for design. Bringing up in intelligent design, bringing up like who's a better or greater designer than God. And I just love thank you, Anna, for us being able to present together. Thank you.
I like that. I like somehow this the fact that your presentation, Anna, you asked the question about ethical design. Now I'm gonna keep thinking and formulating a question for both of you about that. Okay, so another question. I'm just going to take these in the order that we've gotten them. A question for Colton from Gabriel Grunsteiner. Hi, Colton. Why does knowing something will happen preclude the agent of that action exhibiting free will?
Yes, thank you, Gabriel, for your question. I hear that to mean something along the lines of, and if I don't interpret it correctly, please interrupt me. But yeah, why does knowing something or even the outcome of something means that there's possibly no choice within it? Well, one thing that I get into more in my written portion, not as much here, is I end that section a little bit with saying that that definitions may be refined here as well, and I'm referring to free will as well in terms of choice. What is choice? And defining free will and determinism. So yeah, I think to be rudimentary, if what will happen is known, that could mean that the individual may have never had a choice, even though they may have thought that they did. Thank you.
Thank you. Anna, question for you. Coming from Lisa, and I'm not sure, I don't have Lisa's last name in this document yet, but it says, as a designer, what is your brand design style and what emotions do you think you might elicit from your clients through your work?
That's a really good question. I think it depends on what I'm designing specifically. I think mostly I really like more like contemporary Scandinavian, like minimal, clean lines, bright white, which I think that doesn't always like resonate with a bunch of other people. So if I was working with a client, they could definitely see that as cold and not very inviting. So when it comes to working with a client, you really have to listen to what they like and actually take into consideration their wants and not just push your own brand on those people.
Thank you. I'm going to follow that up with a quick question on this topic of ethical design. And my question to you, Anna, is what are some of the barriers to ethical design? You mentioned that in your presentation just a bit, but I'm wondering about if you could elaborate on that just a little bit more, because there are a couple of questions that I think bring that question together.
I think when it comes to ethical design, I like my example that I used with you the other day. Like McDonald's is a great example of their logo. They use red to make people feel hungry. And I think that big corporations do this because they can, first off. And when it comes down to it, they just want to make more money. And moving forward to create more ethical design, we need to take into consideration what can help people and how we can incorporate new design strategies into a more ethical design style and more ethic in life in general.
Thank you. Riley wants to ask Colton a question. Go ahead, Riley.
Hi, Colton. You knew I had to harass you just a little bit. So this topic I loved, and I'm so glad that you spoke on it, because this is actually, believe it or not, something that I've been thinking about lately that has been like turning my brain in knots. And so first of all, I wanted to know what prompted you to go in this direction with your senior thesis.
Yeah, what prompted me to go this direction with my senior thesis? Well, I could speak a little to recently. I do like acknowledge to myself pretty constantly that I have given many different versions of the same presentation. So it started a while ago, but I mean, honestly, one way it was just started through, like I said, that final in Professor Hansberger's class, being that debate. I wanted to know more about like arguments for and against the existence of different gods. And one thing that I'll say now that I didn't say in this presentation is that I did say when I presented on this topic at Montana State University, being that I very much want people to have the best possible reasons to either believe or not believe in God. I feel that personally. I feel that the belief in God is a very influential belief and very significant one. So in terms of just looking at arguments both for and against, just having the best reasons for why, that's part of why I went in this direction.
Side note, I commend you for your neutrality, honestly. Like, not even a hint of I take this side or this side throughout your entire and that response, just incredible. And then just lastly, the parallelism that stood out to me was your closing notes, the library. It just starts with one book, and I completely agreed. And similarly, a word, such as in this case, infinity, starts with one definition and then grows from there, just like your library with one book. A word starts with one meaning and grows and grows and grows. And at first I was like, how is that relevant? And then I sat and I thought about it for a minute, and I was like, I forgot that Colton's a genius. So I just wanted to inquire about the, reasoning behind why you delved into this topic, and just point out that I picked up on that incredible ending of yours. And thank you for an incredible presentation. I will let others give you their questions.
Thank you, Riley. In my written portion, I very much attempt to take a stance of agnosticism throughout. So yeah, thank you for that.
Feel free to email that to me.
Sure thing.
Okay, so I'm getting questions on 3 different channels here. So on my phone too, you guys, you're really inspiring your audience. People are finding a way to ask you. Okay, so Colton, the set you proposed has by definition a beginning and end. Was your point simply that infinities with borders are possible, or that God is also an example of such an infinity? That's from Jared Dubiel.
Yeah, Jared, do you want to ask that question yourself?
No, no, I'm just kidding. Is my camera on? Oh, there we go. Hi, everyone. Yeah, so I just wanted to follow up on that one and clarify your point, because I think you mentioned in response to Andrew's question that there are different types of infinities and some are longer than others. So I just wanted to see what it was that you were trying to point out with that one.
Yeah, so I like I said, I provided an example of an infinity or an infinite system with both a beginning and end. So through that, I make it analogous that I express that it's possible that like if a being is also infinite, then this being can still be infinite yet have a beginning and end, but that's not as compatible with this philosophical concept of God. And I want to take that, though, for time and turn it back to Anna a little bit. I have a question for you, one quickly. Just being that you mentioned ethics, and one of my favorite parts of your presentation is the mug example. I was wondering if you could speak more about like how can design be ethical, include, like, are you talking about in terms of waste? Yeah.
I think design can be ethical in so many different ways, and definitely sustainability is a major way that designers can work towards being ethical. And with the example of the mug, I guess, like, in terms of ethical design, mugs have been around for a very long time, and they have the same shape. And I think designers can use innovation to push themselves further into a new design. Like, maybe you could say that the double glass on the mug is more ethical in a sense because it's safer for the user so that they don't burn themselves. Something along that line.
Thank you. I'm going to read a question from my phone from one of our alumni. So Anna clearly illustrates the influence of cultural perspective with regard to design. I'm wondering if Colton could entertain the influence of perspective with regard to evil or sin, and if God perhaps does exist in a reality free from evil in a culture that doesn't perceive certain actions to be evil or sinful. That's from Becky Alter.
Can you repeat it?
Anna clearly illustrates the influence of cultural perspective with regard to design. I'm wondering if Colton could entertain the influence of perspective with regard to evil or sin, and if God perhaps does exist in a reality free from evil in a culture that doesn't perceive certain actions to be evil or sinful.
Right. So when I hear like exists in a world without evil or sin, one thing I hear is possibly a different universe, and that's definitely what multiple universes and multiple different universes is definitely one thing I entertain within my project. And yeah, just really quick shout out to Liam Price also for helping me include something that I refer to as Price's multiverse paradox that I have yet to even include in my written portion of my thesis. But is it possible for God to exist in a universe or reality, if you will, that has no evil or suffering, especially if this God is a good God or loving God? I would say that is possible, and what I ask though and attempt to explore is how that's possible though, and the specifics of that.
Thank you. And I think we'll just add one last question, and I'm sorry we can't get to all of them. There are more questions on the list, but the next one in the lineup is from Michaela Mudge, and it is to Colton saying, is the argument of free will the only argument attempting to address the problem of evil?
Is the argument of free will the only argument in attempt to address the argument of free will? No, definitely not. There is one argument from apologists that is known as soul development. And the reason why there exists evil and suffering, and God allows it or enables it, etc., maybe because like soul development is this concept of like a possible necessary aspect to experience bad things, which yeah I'm not totally convinced by, in part because I attempt to refute and address that a little bit just by mentioning my stance that the amount of evil and suffering in the world is not logically necessary. But yeah, no, that's definitely not the only argument. Thank you.
Okay. In interest of time, I think we need to wrap it up here. We have another panel scheduled to begin in 5 minutes. But thank you so much. Let's congratulate our two presenters on this panel. Everyone can unmute their microphones and let's give them a round of applause. Thank you everyone for being here. We hope that you'll stay with us for the next panel. The next panel is titled, It's a Dirty World, Who's Going to Clean It Up? We have two presenters presenting on this topic, and we will have one panel after that. So we've got two more coming up, and we're excited to have many of you here with us.
Melissa Camp
is now exiting.
We'll be back in about 5 minutes. Feel free to continue to chat with each other in the meantime, if you like, in this space.
Colton, are you still here?
I'll always be with you, Jeancasia.
I have a question, Colton, and feel free to not answer it if you don't want to, if you don't feel comfortable. But I am fascinated now that I know that you took Bill's class, Mr. Hunt, or whatever, Professor Hunter, because I've never called him anything else. But anyway, what year was it?
Whew. Let me think for a second.
Okay.
It's spring of 2015, around there.
Okay. About 5 years ago, I guess, huh?
Yeah.
And what school was that?
I won't answer it right now, just for the sake of
Okay.
like privacy. But yeah, no,
Yeah,
I'll tell
sure,
you.
of course. Yeah, no, of course. I understand. I didn't expect you to, but I was just gonna throw it out there.
Okay, yeah.
Like I told you, I know him really well, and I've known him for a really long time. And my son has taken his class too. And it was a really hard class. If it's the same class, because he teaches a couple different classes. Did you find it difficult?
Yeah. It was intro to philosophy. We used the textbook a lot, but I was also introduced to many complex concepts that I've never been before introduced to. So, like, yeah, intellectually, in terms of comprehension and understanding, I did find it very difficult, yes. But one thing I love about philosophy is how difficult it is.
Sure, yeah. Did you find the professor, do you think he was pretty knowledgeable about these things, like philosophy and that sort of thing?
Yeah.
Yeah. Cool. I think I haven't talked to him, of course, but within the last half an hour. But if you wanted to, I'm sure he would love to talk to you about a lot of the questions you brought up and the things you brought up in your presentation. I mean, he could probably go on and on and on and on and on. So.
Oh, I know. Yeah.
I know you know, right? So, all right, cool. Thank you.
Yeah, thank you.
Mm-hmm.
Sarah, I see you there. You can go ahead and start getting your presentation ready if you like. And we'll do introductions here in just a minute.
Okay, cool. Sounds good. Do you want me to project it on the thing right now?
Sure, you can go ahead. Mm-hmm. Looks like it's ready to go, huh?
Already. Can everyone see it? It's like lagging on my screen.
I can see it just fine. I'm assuming that others can too. Okay. Well, we are going to go ahead and get started. Thank you again, everyone, for being here. My name is Dr. Megan Hughes-Arzo, and welcome to the 4th panel of the Honors Thesis Symposium Spring 2020. We're so excited to have so many attending today online and sharing in these students' projects. So that you know, the last panel session was a great example of a session in which we weren't able to get to all of the questions, but we will be collecting all of those questions and forwarding them with your names and the information that the questions you ask and thoughts you provide to the panelists. We invite you all to participate during this panel as well. During the panel presentation, please keep your microphones muted and your cameras off so that the presenters can concentrate on what they're doing. And then afterwards, we invite you to participate either in live form asking a question or submitting your question through the chat. You can submit your questions in the chat as soon as you come up with a question, and we'll start to put those into a document and work through them once we get to the Q&A. So feel free to do that along the way. And we will go ahead and get started with panel 4. The title of this panel is It's a Dirty World, Who's Going to Clean It Up? And we have 2 presenters, Sarah DeHabra and Nick Sundstrom, and they are ready to tell you about their projects.
Alrighty, thank you, Megan. My name is Sarah DeHabra, and I will be presenting a program analysis to assess the effectiveness of the Paris Climate Agreement by comparing the outcomes and processes of 2 case studies, China and Ethiopia. So the Paris Agreement is under the United Nations Framework Convention on Climate Change, and it was actually adopted in December 2015, and it basically aimed to reduce the toxic emissions that contribute to climate change. The Paris Agreement set out to improve and replace the Kyoto Protocol, which was actually an earlier international treaty that was designed to curb the release of greenhouse gases. It went into force on November 4th, 2016, and it's been signed by about 197 countries as of January 2019. So by law, every public program has to be evaluated at some point. It's not a sure thing that the organization will read the evaluation, but the audit must be done by law. These are basically the 5 pillars necessary to generate an audit or a program evaluation. There's the needs assessment, evaluating logic assessment, the implementation assessment, the assessment to assess effectiveness of the intervention, and finally, the cost-benefit analysis. So the section that I will be focusing on is the tool to assess the effectiveness of the intervention. The intervention in this scenario is the Paris Agreement, and I want to know what the outcomes were for this policy. Throughout my research, I will ask questions like, are the outcome goals and objectives being achieved? What effects do the services have on the target population? Were they good? Were they not good? And basically, has the program intervention been useful to the target population? So in order to assess the effectiveness of the Paris Treaty, I will compare and contrast Ethiopia, which is a developing country, and China, which is also actually considered a developing country as well. China is starting to become a moderately well-off society, meaning that their economy is rapidly growing. So as the largest manufacturer in the world, China remains a developing country or an emerging economy. However, China's key industries are far from reaching the level of other advanced industrial countries. The economy in Ethiopia is a mixed and transition economy with a large public sector. So they're emerging as a low-income economy. China has also been the catalyst for pollution due to their rapid growth, while Ethiopia wants to prevent this same thing from occurring in their economy. So my objectives are to basically just determine how effective the agreement was in reducing greenhouse gas emissions in both Ethiopia and China. It's important to keep in mind that even though China's economy is more advanced when it compared to Ethiopia, since they're labeled as a developing country, that means that China also has fewer commitments to abide by, just like Ethiopia. So the Paris Agreement basically aims to strengthen the ability of countries to deal with the negative impacts of climate change. And in order to reach these desirous goals, there needs to be appropriate financial flows, new technology frameworks, and an enhanced capacity building framework that will be put in place. So now I'm going to focus on Ethiopia's outcomes, processes, their history, and implementation of the Paris Agreement. So Ethiopia has been attempting to increase its efforts to address climate change long before they ratified the Paris Agreement. Their national adaptation plan focused on the country's development policy framework, so when they began increasing their rate of development, they wanted to prevent hurting the environment around them. All of these efforts had the same goal, and that was to reduce the vulnerability to the impacts of climate change by building adaptive infrastructure and resilience to climate change. So all of these efforts were necessary for the development of Ethiopia, but at the cost of the environment around them. The Paris Agreement is put into play to allow these efforts to continue, but to also control the ways in which these goals are being reached. Building new, stronger structures in Ethiopia means more resources. Then more pollution follows that. Also, Ethiopia is still a developing country, and they also need assistance with things like enhancing food security by improving things like agriculture in a climate-smart manner and improving access to potable water. They also need assistance with strengthening sustainable natural resources management through safeguarding landscapes and watersheds, and among many other things. So according to the Paris Agreement's Executive Summary, or AES, Ethiopia ranks as one of the countries at extreme risk of climate change. A large percentage of Ethiopia's population relies on rain-fed agriculture, and climate change is actually having a significant implication on this important element for Ethiopia's resilience. The droughts are so dangerous in Ethiopia that in 2015, 10.3 million people, which is approximately 1/10 of the country's population, were threatened with catastrophic food shortages due to the lack of growth in their agriculture because of no rainfall. So in order to maximize the amount of benefits that Ethiopia receives, there are three main elements that will be incorporated. It involves including solar-powered water pumping, small-scale irrigation, and the rehabilitation and management of degraded lands around water sources, and creating an enabling environment by raising awareness. So as you can see on their project timeline, which is currently live, the project has an estimated lifespan of about 5 years, and over 50% of the beneficiaries will be women. The current status of this project is under implementation and still has a long way to go, but from this timeline provided by the Green Climate Fund, it shows us that this region in Africa is actually on track. As of January 31st, 2020, $5.4 billion is the current amount that was allocated to projects in priority countries like Ethiopia instead of $100 billion. So part of the agreement's success requires that economically developed countries commit money towards developing countries. This has not yet happened for a couple of reasons. One being this is a new policy and it takes time. Second, countries are committing the minimum amount of funds, which limits the amount of money each developing country receives, especially if you're splitting like $1 million between 2,000 projects around the world. One project that's being funded is in Ethiopia, and it includes providing rural communities with critical water supplies for year-round drinking water and small-scale irrigation to address the risks of drought and other climate impacts. So the Paris Treaty has allotted Ethiopia an 8% disbursement of over $45 million in grants with a co-financing clause that gives Ethiopia an extra $4.9 million. Since Ethiopia is now a democracy in the parliamentary republic, all of the finances coming in is due to the agreement, and it's actually handed down to the National Designated Authority, which is overlooked by GCF, or the Green Climate Fund. And given Ethiopia's general low level of economic development, they're particularly vulnerable to the negative impacts of climate change. This is actually pretty significant because the level of funding that Ethiopia's project is given is enough to get the job done and reach their goals. The size of this project is actually considered to be small, so the amount of money given to Ethiopia right now is pretty good. The key actors and stakeholders that allowed for this type of positive implementation to occur is mainly from the government of Ethiopia and the citizens there as well. So now I'm going to focus on China's outcomes, processes, their history, and implementation of the Paris Agreement. So China is the world's largest polluter because they account for more than a quarter of the world's emissions currently, which makes this specific nation a crucial part of any effort to avoid irreversible damage from climate change. So before China ratified the Paris Agreement, there was actually an analysis made by the EPA, or the Environmental Protection Agency, and they actually found that China's emissions could peak at 13 to 16 gigatons of CO2 between 2021 and 2025. So a gigaton is 1 billion tons, and it's the only way in which scientists can actually accurately assess the amount of carbon dioxide that is in the atmosphere due to its high levels. So if you take a look here at my very scientific scale, 1 gigaton is roughly 200 million elephants, which is enough to stretch from the Earth to the moon. On September 3rd, 2016, China ratified the Paris Agreement and they submitted their NDC to the United Nations Framework Convention on Climate Change, which includes a number of elements. First, to peak CO2 emissions by 2030 or earlier if possible, because CO2 emissions are still rising rapidly in China with no end in sight. It's also important to find that peak for CO2 emissions because that shows us that this is the highest level of CO2 in the atmosphere. Now we can focus on reducing that number, and this peak helps experts expose what and who is maintaining this peak. That's when we can begin to slowly decline from that initial peak. It's also important to increase the share of non-fossil energy sources in the total primary energy supply to around 20% by 2030. Currently, China's primary source for energy is fossil fuels and other non-renewable resources, which is helping, account for their high rates of pollution. So for China's 2020 pledge, it consists of reducing the overall reduction of CO2 emissions per unit of gross domestic product, or GDP. China also pledged to increase their forest coverage by 100 acres and forest stock volume by 1.3 billion cubic meters by 2020. So if these goals that are set for China are actually reached, it actually still won't be enough to lower these CO2 emissions. This is good, but it's not good enough. The damage goes further than that. So according to the Green Climate Fund, there is currently one project being financed, and it's in Shandong, China. The Shandong province has the highest energy consumption and produces the most amount of CO2 in China. The total financing for this project is currently $100 million. The total project value for this one project is $1.4 billion. So this is a lot of money being funded to a project that will have little to no impactful results to the overall scale of climate change. It's important to remember that without China's efforts to reduce their emissions, climate change will continue to worsen since China is, again, the largest polluter in the world. So the theme that China's program has adopted is called cross-cutting, which means that the result areas of the program are intertwined and create this domino effect on the rest of the country. The three main result areas that are being positively affected are buildings, industries and appliances, energy generation and access, forests, and land use. This theme for China is actually well suited for them because they're basically taking what they already have and improving upon it. This theme promotes a wide positive impact, but it also takes a lot of time and consistency. Lastly, I will be contrasting Ethiopia and China with regard to the Paris Accord, the result outcomes of both countries. So these two countries have very different roles in the agreement. Ethiopia is a beneficiary trying to invasively grow their economy, and China is an entity that's equipped with a rapidly growing economy and who's implementing change. Ethiopia's theme focuses on adaptation, while China's theme focuses on developing better ways to do things with what they already have. In Ethiopia, this theme comprises of three main goals, which is to help adapt and create new and stronger ecosystems, increase the quality of healthcare and food, and focus on increasing the quality of life for communities. In China, however, they want to focus on building environmentally friendly buildings and finding new renewable sources to run their industries, while also giving access to clean energy for people who actually don't have access in China and enhancing the ways of them using their land. So in Ethiopia, the program's effectiveness will be decided by the amount of beneficiaries that are being reached, the type of adaptation that prevents adolescent deaths due to preventable and curable diseases, and creating better ecosystems and infrastructure that can actually adapt to the climate in that specific region. In contrast, China's project is actually trying to turn pollution into money, meaning the project title for China is literally called Catalyzing Climate Finance, and their main objective, next to reducing pollution, is to actually create a green economy they can maintain in the future. China will reduce emissions in the Shandong region specifically by having energy access and power generation. They want to make sure that people who are unable to obtain energy the most common way will have access regardless by the use of our natural surrounding environment. The second way that China will reduce emissions from the Shandong region is obtaining low-emission transport, like building a high-speed rail and a rapid bus system which will run on renewable energy. It will actually also eliminate emissions that come from motor vehicles because the assumption here is people will use public transportation if it's a lot faster to get to one place than if they drove. So in addition, the results and monitoring of the project in China is very different when compared to the results and monitoring process in Ethiopia. So as you can see, China has more oversight and supervision than Ethiopia. This is due to the fact that China hasn't been completely forthcoming in the past. China has had many incidences where they weren't reporting accurate numbers when it came to the amount of pollution produced in that country. So the Paris Agreement just wants to reinforce their notion of transparency and, just make sure that the numbers being reported from every single country is accurate and reliable. So the fund management company will also conduct audits annually for the project in Shandong, China, in accordance with their international standards on auditing and, of course, with China's government's audit regulations. These measures are necessary because there's a lot of money involved here with this agreement. And, the last thing we need is projects put on hold because funds are being misused. In Ethiopia, the program presently encompasses 1.3 million beneficiaries, which is amazing given their limited funds currently. The number of beneficiaries for the project in China is a lot higher than Ethiopia because China has a greater population than Ethiopia. In fact, in 2017, Ethiopia had a population of 105 million and China had a population of 1.3 billion. That means that for every 13 Chinese citizens, there's one Ethiopian citizens, or 13.2 to be exact. So one of the results expected from the project in China is to actually increase the resilience of vulnerable communities through adaptation projects, just like in Ethiopia. Lastly, I just want to thank my advisor, Dr. Thangsami, for helping me with my thesis and adapting with the current circumstances. And I also want to shout out Dr. Megan Hughes, for all her effort and time. Thank you, everyone, for your time.
Thank you, Sarah. I'm sorry, my microphone wouldn't unmute there for a second, but thank you so much for that presentation. We are going to invite Nick to present. And then soon we'll get to the Q&A for this panel. Are you ready? Okay.
Can everybody see that?
I can see it.
Hello, my name is Nick Sundstrom, and I'm a senior at MSU Denver studying environmental science. Today, I will be presenting my thesis, Can Golf Lessons Help Save the Environment? The Effects of Various Aqueous Conditions on Golf Ball Degradation. Thanks for joining. Pebble Beach Golf Course is in a class all its own. Ask any avid golfer to think of the perfect finishing hole, and often the 18th at Pebble is what their minds draw up. The 18th and final hole is a 550-yard par 5 which wraps itself around the north shore of Carmel Bay. Out of bounds protects the right, with the Pacific defending the left. A seawall running most of the final length to the green was constructed in 1997 to protect the sea from claiming most of the 18th fairway due to years of erosion. As charming as this hole seems, it is also considerably difficult to play. In fact, not every ball that starts this hole makes it off the 18th green. In 2016, local teenager Alex Weber and her friend Jack made a startling discovery in the bottom of the bay. Golf balls. Thousands of them. On one of their first recovery missions, Alex and Jack collected nearly 2,000 balls, but they didn't stop there. Over the span of 26 months, Alex, Jack, and their team recovered nearly 40,000 golf balls, weighing nearly 2.5 tons from the small coastal area near Pebble Beach Resort. Over half the balls recovered were from the areas just off the 18th hole. If the sheer number of balls found were not alarming enough, the condition that many were found in should be. The balls were found in various states of degradation, owing much, I'm sure, to tidal and other erosional forces. They estimated nearly 28 kilograms of plastic was lost to the ocean just from the collected balls. As shocking as I found Alex's research, it did bring some questions to mind. Outside of physical forces, to what extent, if any, do aqueous conditions play a role in golf ball degradation? And if they do, how concerned should we be about finding these types of conditions in water features on golf courses? Not every golf course is nestled along the ocean, but there are over 33,000 golf courses worldwide, and modern course design often incorporates rivers, creeks, ponds, or lakes for a number of different purposes, such as a challenge for golfers, for stormwater collection, or for course irrigation. The ubiquitous nature of water on golf courses makes it extremely likely that these features end up being the final resting place for someone's errant tee shot. This leads us to seek answers to our questions. What are the effects of various aqueous conditions on golf ball degradation? Well, to begin to answer this, we first need to understand what a golf ball is made of. Modern golf balls are generally of a 2, 3, or 4-piece design, but the two main components are the core and the cover. On a high-performance golf ball, like this Titleist Pro V1, the cover material usually consists of ionomers of polyurethane or polyurea. Polyurethane is easily shaped, it's durable, elastic, and can be made using a variety of different additives per the manufacturer's specifications. Polyurethane is an organic polymer joined together by carbamate links. More specifically, it is a proprietary combination of polyols and diisocyanates. Proprietary because the exact formula is specific to its intended use and manufacturing process. A polyol is an organic compound which contains multiple hydroxyl groups, which consists of one hydrogen and one oxygen. Diisocyanates, as the name implies, consists of two isocyanate groups, each of those consisting of one nitrogen, one carbon, and one oxygen. Therefore, if we combine polyols, diisocyanates, plus catalysts and additives under the proper conditions, it will give us something similar to this generic formula to create the outer covering of our modern golf ball. Even though we haven't fully answered our first question, let's address the second before circling back. If we make the assumption that certain aqueous conditions are favorable for golf ball degradation, then how concerned should we be from an environmental standpoint? I mean, what harm can a little plastic in the water do, right? As it turns out, most of the issue is a little hard to see. Overall, plastic is thought to make up between 80 to 85% of all marine pollution. But while large floating debris fields and the ocean cleanup project generally take center stage, a much smaller threat is slipping through the net, quite literally. Microplastics. Microplastics are defined as plastic particles less than 5 millimeters in length and are thought to account for between 93 to 236,000 metric tons of pollution in the world's oceans. To put that in perspective, that's the equivalent mass of about 60,000 full-grown Asian elephants, and we're just talking about microplastics. Microplastics are created as larger pieces of plastic break down physically. Plastic decomposition and degradation can vary by conditions and chemical composition, but in general occurs via UV radiation exposure, chemically, via wave mechanics, or by aquatic organisms. Research indicates that chemical or biological decomposition is highly dependent on time. It can take years, decades, centuries, or even longer to break down plastic into its core components. A physical breakdown of plastic can occur more rapidly, making it more available or likely to be ingested by marine organisms, which can cause chronic or acute toxicity. This image depicts how plastic can bioaccumulate and biomagnify. On the top, you can see that over time, the amount of plastic inside the fish grows as the plastic they consume goes undigested. This is bioaccumulation, an increase in concentration in a single organism. The bottom shows how that plastic, which has been bioaccumulated by the fish, can be passed along to species of a higher trophic level through consumption. This is biomagnification, or when that same plastic gets passed through different trophic levels. To make matters worse, certain studies have implied microplastic exposure could cause a significant reduction in the growth of certain primary producers, such as microalgae. Algae are not only a key food source for many marine organisms, but their photosynthetic reduction could have devastating consequences regarding the cycling of atmospheric carbon and oxygen. If you're undecided on the severity of microplastic pollution, let me leave you some final thoughts on the topic. Current research has found microplastics in drinking water, rainwater, and even human feces. The World Health Organization even acknowledges that microplastics are ubiquitous, but they stop short of concluding that they pose a significant human health risk. So what do golf balls have to do with microplastic pollution? Well, let's get back to polyurethane, which is in itself a plastic. Studies under laboratory conditions have shown that the tensile strength of polyurethane can be reduced under direct exposure to UV radiation and as temperature was increased. The tensile strength is the maximum stress a material can withstand while being stretched or pulled before breaking. Research indicates a reduction in tensile strength to be directly linked with the material's molecular structure, while additional research reiterates the idea that the material composition is a central factor when it comes to polyurethane degradation, in addition to environmental factors. While current literature regarding the nature of polyurethane degradation is extensive, literature specific to golf ball degradation is essentially non-existent, which is where the study comes into play. A study was designed and implemented to help identify aqueous conditions which promoted the degradation of golf balls in the hopes of ultimately better understanding microplastics' overall effects on aquatic ecosystems and what role, if any, golf balls play. The study exposed modern golf balls to aqueous solutions with differing levels of alkalinity, salinity, pH, and UV exposure for a period of 154 days. This slide shows an overview of the various treatment and control conditions and the differing levels of each factor. The levels for salinity, alkalinity, and pH were chosen to replicate levels that could be found in aqueous environments near or on golf courses. Each treatment factor consisted of multiple levels or concentrations. For example, we created pH solutions of 7.22, 7.96, 10.01, and 11.96. We hypothesized that a statistically significant change in total carbon of solutions would occur in the treatment solutions versus the control solutions, indicating a chemical breakdown of the ball's polyurethane cover. The total carbon of a sample is a measure of all carbon atoms contained in the molecules found in that solution, both in an organic form, like a sugar, or in an inorganic form, like carbon dioxide. This is an important point to note for the study, and we'll revisit this later on. 3 golf balls of different models but from the same manufacturer were added to each treatment condition. Different models were utilized to control external variable introduction which may have arose due to the specific model's properties. Control groups did not have any golf balls added. The models we used were all made by Titleist, a leading golf ball manufacturer. They were the DT TrueSoft, TourSoft, and Pro V1. A decision to use a large manufacturer was made as it was assumed consistency in manufacturing processes and quality control would be held to the highest degree. For UV treatments, exposure apparatuses were made out of cardboard boxes and utilized a 6-watt UVA blacklight. One treatment received direct exposure while the other 2 received filtered exposure, which was accomplished using sheets of acrylic glass as filters. The results of the study proved to be interesting, if yet slightly inconclusive. The total carbon for every control and treatment condition was tested both before and after the study. The change between these 2 values was analyzed via an analysis of variance or ANOVA test. The ANOVA results gave us a p-value that we can use to compare against our chosen level of significance. A p-value greater than our level of significance means the results failed to reject the null hypothesis. The null hypothesis being that the mean change in total carbon of the control group is equal to the mean change in the treatment group, i.e., there is no difference. The alternative hypothesis says that there is a significant difference between the control and treatment groups. A summary of the results is shown here. As you can see from the p-values in red, all are above our level of significance of 5%, meaning that we failed to reject all of our null hypotheses. That is, there is no statistically significant change in the total carbon concentration between the control or treatment groups for any of our conditions. While null results can be viewed as negative, it was understood from the beginning that this could be a very real possibility given what we know about plastic degradation. Without the aid of mechanical methods of degradation such as wave or tidal forces as you would find in the ocean, the chemical breakdown of the polyurethane cover of these balls would more than likely need a lot longer than 154 days in order for us to see significant results. However, to say nothing occurred during or can be learned from this study would be incorrect. A quick glance at the graphical representation of the data does show differences between the control and treatment groups, albeit not significant. And if we look closely, we can see that in some instances, the change in total carbon in the control groups was greater than that of the treatment groups. Here is a better look at our alkalinity graph. As you can see, there was a change in total carbon in the control groups, which remember, had no golf balls added to them. So if they had no golf balls added, why did we observe a change in total carbon? The best answer is there appears to be an externality at play. In this case, inorganic carbon in the form of atmospheric carbon dioxide. Dissolved CO2 exists in most aqueous solutions. This is very common. During our study, what likely occurred is a pressure differential between the atmospheric CO2 and the solution's dissolved CO2 caused more carbon dioxide from the ambient air to dissolve in our control and treatment solutions. In hindsight, testing for only organic carbon versus total carbon would have allowed us to better isolate any material in solution that was specific to the golf ball's polyurethane cover. Another observation to discuss was that upon physical inspection of the golf balls in the UV treatments, some physical deformation had occurred, and because of this, a Phase 2 UV study was devised and carried out. In Phase 2, golf balls were placed into either a deionized solution mimicking fresh water or a saline solution mimicking salt water, and then exposed to direct UV radiation. In this part of the study, we were only looking for a yes or no answer to whether physical deformation occurred. As you can see from the pie chart on the left, nearly 95% of the balls in the deionized solution showed some form of deformation, versus only 5% of the balls in the saline solution, as shown on the chart on the right. These results indicate that UV-exposed golf balls in a freshwater system may be more affected than balls in a saltwater system. In fact, there is research which suggests an increase in dissolved molecules, particularly dissolved organic carbons, can limit UV penetration. Overall, I hope you've come to some of the same conclusions I have. Plastic production and consumption is continuing to grow, and by extension, plastic pollution, putting additional pressure on already fragile ecosystems. The degradation potential of synthetic plastics is often dependent on a combination of its chemical makeup as well as its environment. In particular, UV exposure was demonstrated to cause physical deformation of golf balls. It is also worth mentioning the limitations of the study, namely that it was not set up to mimic natural conditions, nor did it look at the interaction effects of multiple variables. Time was a major limiting factor in that chemical degradation could take many decades or centuries to occur, far longer than the length of this study. In terms of answering our questions, I believe the door is open to further investigate the degradation potential of golf balls, particularly mimicking more natural environments, but this study does suggest that ultraviolet light in particular plays a role. In regard to how concerned we should be when you're out on the course, I think we're okay to knock a few balls into the pond without causing dire environmental consequences. Retrieval, if possible, would be ideal, but if you ever get the chance to play Pebble Beach, a few lessons beforehand may make your round that much more enjoyable.
Thank you, Nick. Thank you both of you for great presentations. We've got a few questions popping up in both chats, so everybody who is listening, feel free to send us your questions and or request a chance to talk to our panelists. So let's go ahead and get started. Sarah, I have a question from someone on the YouTube channel who goes by Little Wolf Movement, right? So the rate of China will surpass the world, making Chinese the most spoken language in the world. I think that's the end of the question.
I don't know.
I wasn't sure if that one was directly related.
I'm reading it. It says over Mandalorian. I think he meant to say Mandarin.
Over Mandarin. Okay, yes, I'm seeing that now.
They, sorry, I don't know if it's a he. Yeah, I don't know about the language, but yeah, China has definitely surpassed. It has surpassed and will continue probably to surpass us in, manufacturing and pollution for sure. If that's just to.
Mm-hmm. Yeah. Right. Okay. We'll move on to the next one. For Nick, a question from Brianna Winkler. So why is it that companies still produce plastic if it's clear that it is drastically damaging the environment and the ecosystem? Is there a way to ensure that these companies are forced to stop producing them? What materials can be used instead of plastic, and how do they shape up compared to plastic in terms of price, sustainability, and environmental impact?
Who was this question for?
This was for Nick, and it's from Brianna Winkler. But I feel that, Sarah, if you have something to add afterwards, you can also jump in.
Okay.
I think that's a really interesting question, and the short and simple answer is plastics are cheap and easy to produce. But it's a combination of factors. It's not just that the companies are producing it; they're producing it because they're going off of consumer behavior. If you go to the grocery store and you buy some prepackaged item, just take an account of how much plastic is on there, and that's how they're getting that item to the store, because it extends shelf life, or it's easy for transport, or a number of business decisions that are made along that line. But ultimately, it's driven by consumer behavior. So I think to get away from plastics, I really don't know of any good alternatives, to be honest. I think we just have to be more conscious of the types of products that we're purchasing as consumers, and maybe that will filter into the companies that are making these products and how they go about choosing their packaging.
Okay. Sarah, did you want to jump in on that one?
I don't know about the rate, of plastic that's being manufactured. But I mean, it's a lot more expensive to find renewable or to use renewable resources like bamboo or paper. It takes a lot more time and effort, and there's rules that you have to abide by to make sure that they don't go bad. But yeah.
Okay. Thank you.
You're muted, Dr. Megan Hughes-Zarza.
Oh, thank you. I'm sorry. I was trying to gather in the questions here. Thank you both for your responses. Okay, so Nick, what materials can be used instead of plastic? Hang on. There was a question that was copied there twice. Okay, if you were going to repeat the study, how would you alter your method? This is a question from Dr. Schliemann.
I think the first thing that we would have done is we would have not looked at total carbon in the aggregate, but we would have looked specifically for organic carbon, while also testing for inorganic carbon separately, because I think I underestimated how much impact the pressure differential of the atmospheric CO2 was going to play into the results. So I think it muddies the results a little bit. I don't know if we would have gotten different results if we would have just looked at total organics right away. To even go further down, we could have looked at specific molecules that are specific to the actual polyurethane that they use in the balls covering, which we could do if given we have the right equipment. I think given the limitations of the study and just the time frame that I was okay with just doing total carbon up front, but obviously we see that may have not been the best choice in hindsight.
So Dr. Schliemann also wants to ask, if you were to give advice to managers of golf courses, what would you recommend?
I think it would depend on the location of the course. For instance, most inland courses, we don't have to worry about things like the balls getting lost in the ocean and then being subjective to wave mechanics. And in fact, in most freshwater ponds or lakes on golf courses, they do go in and retrieve the balls. Generally, every season or so, there's usually companies that contract in. They'll come in and they'll send divers in to recover the balls, and then they'll clean them up and sell the ones that they can. So balls in a freshwater course situation, an inland course situation, they don't necessarily sit there very long. But I think that's a little bit different story if you have coastal golf courses, and I think this is where the Pebble Beach story comes into play, in that they don't recover those balls generally. It took a 16-year-old girl and her dad and friends to really drive the effort to go clean up the area around Pebble Beach. So maybe for some of the coastal golf course managers, you could look into being proactive and maybe adding certain nettings in. I know that ruins some aesthetics of the course. But there's also things you could do, like maybe having an extra fee added on, a small fee added on to the round, charge that goes into a fund that pays a group to go in and clean up the balls that do make it into the ocean after the fact. So that's a good question, and I'm sure there are a couple different avenues you could look at to fix that.
Great, thank you, Nick. Sarah, I'm going to give you a question from your advisor as well, from Dr. Sangasamy. First of all, he says, wonderful presentation. How much does the type of political system matter for the quality of the implementation of the Paris Agreement programs? China is communist versus Ethiopia is a democracy. What did you find?
Okay, that's a really good question. Hi, Dr. Thanksami. So yeah, the type of government and political system that a country has is a big indicator of how a policy like the Paris Agreement will end up working or not working. You know, China, since it is a communist political system, you know, if the person in charge doesn't want to implement everything in the Paris Agreement, you know, no one can really say, but look at all this facts, you know what I mean? But Ethiopia is a democracy, you know, and their government and all their citizens actually had a say in the Paris Agreement. And this is why they're, you know, they're on track. It's going well. I'm not saying it's not going well in China too. They're doing great things too, but the type of government will affect how the policy is implemented, how quick it's implemented, how far the target population will reach, and a lot of important things like that will determine the effectiveness of the Paris Agreement.
Great, thank you. I have a question for both of you. Again, from one of our alumni, Becky Alter. As all nations are looking to reduce reliance on oil and coal and shifting to greater use of renewable resources, what do you think about using natural gas, a 90.3% cleaner energy source, in combination with renewable sources like solar and wind to accomplish our energy production needs?
It's a long question. Can you repeat it? I'm sorry.
Reread it? I can reread it. Okay. As all nations are looking to reduce reliance on oil and coal and shifting to greater use of renewable sources, what do you think about using natural gas, a 90.3% cleaner energy source, in combination with renewable sources like solar and wind to accomplish our energy production needs?
So I don't know much about the natural gas, but I know that, for example, the wind, when we use wind power, it doesn't generate a lot of energy. So I'm curious to see how much this gas, how much energy this gas generates, because, for example, like hydropower generates a lot of energy, but it's really bad for the environment. So yeah, I mean, I'm open for it. It's interesting. Like, I want to see what it's done, how much energy it produces, and the effects that it has on reducing CO2 emissions.
Thank you.
I have some additional thoughts on that. And yes, I do agree that natural gas burns quite a bit cleaner than, say, coal. But I want to make sure that everyone realizes that clean doesn't mean that there's no issues associated with it, because to obtain natural gas, you still need to extract it like you would oil or like you would coal. Or even when you're talking about wind and solar generation, we still have to mine metals to make those apparatuses. So nothing's totally clean. One of the things that I think we need to really look at is when we talk about green economies or green development, we're still talking about development. And from an economic sense, development, the way we run economies, is linear. Going back to that infinite predicate, where is the limit of development in a finite world? So when we talk about green economy and green development, what we're really talking about is trying to move away from fossil fuels and just inject what we would deem renewables or cleaner burning sources, less carbon emitting sources of energy as a source. But we still have issues that we need to take into account, considering that we don't have unlimited resources. So I think natural gas is definitely a step above coal, but we still need to do better in terms of not just energy source, but energy use.
Thanks, Nick. And thanks for the connection to the last panel as well. That was great. Just to tag on to that, well, anyway, we can talk about more of the connections later on, but we'll keep going with the questions. Okay, so here's another one. This is from Andrew Pena for Nick. Considering that a multi-decades-long study might fall into the range of too little too late, is there a way to do an accelerated degradation that would mimic natural plastic breakdown, but in a fraction of the time, i.e. 300% normal UV exposure or increased water agitation past what normal waves would produce, etc.?
That's a good question, and I think we need to understand that we generally don't want plastic to break down physically. We'd want to break it down chemically into its core constituents. So if we increase UV exposure, if we do things like increase wave mechanics, we're not really breaking it down to its core components. We're just breaking it down into smaller and smaller pieces, which then becomes a lot easier to bioaccumulate. It's harder to get out of natural ecosystems. So the way to go we'd want to look at chemical degradation, which there was a group of scientists that found a bacterium in a landfill. I believe it was in Japan last year, maybe it was about 18 months ago, that broke down the specific component of plastic bottles, PEP. And I know they're looking into using bioorganisms as a way to basically decompose plastic. And I think that's where we should spend more time, money, energy, is to looking into things like that. I'm also, on the flip side of that, a little hesitant to just unleash some microbe into a natural system and hope that they just stop at plastic.
Thank you. Sarah, another question for you. This is from Jeancasia Nolen. Do you think that since many countries are vowing to not export from China anymore, will this have a big impact on their pollution output?
Hi, Jeancasia. Great question. I'm in between. It can and it can't, because one of the top exporters, other than the United States, are other countries are like Hong Kong, South Korea. So I'm not sure. If you take all of these large exporters, like if it's 4 or 5 exporters, it's not going to do a difference. If it's like more than half of China's exporters, then yes, it can definitely drop the pollution levels, because manufacturing will go down. Mm-hmm. So yeah, that's. I didn't know that. Yeah, go ahead. Sorry.
In today's current times of a pandemic, I know that more and more countries are saying we're not going to deal with China anymore in any way, like that, in goods and all kinds of things. And I don't know how serious they are, but potentially it could have a huge impact on our exports from China.
Yeah, so. Definitely can. Yeah, that's really interesting.
Mm-hmm.
Thank you. And I have one final question in the list. I think we can get through all of them on this panel and then take a break. So for Nick from Sonia Lushik, Nick, do you think the golf courses should have better controls in their cleanup processes to ensure that golf balls don't affect ecosystems as much? Kind of going back to Dr. Schlieman's question about how we could manage this.
Yeah, I think that just creating more awareness in general, with people understanding that something as tiny as a golf ball, eventually if they add up, it's going to cause an issue. And that's not just on the golf courses, that's on all the patrons as well that go there. But I do think that it's a much bigger issue on coastal courses versus these freshwater courses, because the freshwater courses, like I mentioned, they do go in there and they do extract the balls at some point. So they're not necessarily in that system for as long a period of time. They're not subjected to a lot of the physical forces that's going to cause an actual physical breakdown of the balls. Generally, most of the balls that you pull out of the water on a freshwater course or freshwater pond are in fairly good condition. I would be concerned about too much plastic, too many balls going in the water off of a coastal course. So I think that, again, it's just a little bit more awareness on everyone's part. If there's certain areas of the course that are prone to it, which if you've golfed, you know that there are certain holes that are harder, there's certain holes that are easier, and you have a pretty good idea of where those balls are going to end up. You could try to be proactive and put some physical barriers in place, possibly to prevent those.
Great, thank you. And it may be a sort of trifling element, but I wanted to let you both know that I think you did not coordinate your plans to use elephants as scientific units of measurement, right?
No, I laughed.
But it is helpful for those of us who are trying to understand, and I understand why you both chose that to try to help understand the metric.
I think we should petition for elephants to be an SI unit.
Yes, it would be helpful to communicate the message, right? So thank you. And on that note, let's give these two panelists a round of applause. Everyone. You can unmute your microphones.
Come here.
Thank you. Okay, so we have about 10 minutes, maybe 9 minutes till panel 5. We hope that most of you are able to stay with us. I know a couple of people have class even at this late hour on Friday, but hopefully most of you can stay with us for the 5th and final panel of the day. We will go to the profit motive, deregulation, and their impacts on aviation and private prisons in just a few minutes. We'll be back. Thank you. Wow, so much happens in the chat if you leave for 4 minutes.
Speaking of raptors, during the last panel, a Cooper's hawk flew, chased a dove into my window, and then picked the bird off the ground, and
Really?
is now having lunch in the backyard.
Wow. So, Jan and Stephen, you're both here, right? I see Stephen. I see Jan as well. Jan, you are presenting first, correct?
Yes, ma'am.
Okay, would you like to cue it up so we can be ready here in just a couple of minutes?
If I absolutely have to, I will.
Are you not ready? You're ready.
Yeah, let me find it. I thought it would pop up, but.
Good to see you. Hi.
It's good to see you too. All right, hopefully that's good.
I can see it. Okay.
Whenever, do I have to start whenever, or are we waiting a minute?
I'll go ahead and get us started here. So let's see. Yeah, I wanted to just give some opening instructions here. Yeah. Good afternoon, everybody. Welcome to the final panel of the Spring 2020 Honors Thesis Symposium. My name is Dr. Megan Hughes-Arzo, and we are super excited to have been able to host this day and to be wrapping up here with our last hour. And this panel, panel 5, is titled The Profit Motive, Deregulation, and Their Impacts on Aviation and Private Prisons. We have two presenters, Jan Villalobos and Stephen Liu, are going to present their projects to you. And we would like to ask that everyone please mute their microphones and turn off cameras during the presentations. Both panelists will present, and then we will dialogue with them in the Q&A session afterwards. You are welcome to go ahead and submit your questions during the presentations if you like, in both the chat on Teams and or the chat on the YouTube live stream. We will collect those questions and be ready to present them to the panelists afterwards. And if you'd like to speak to the panelists live, you're welcome to do that too after we get the Q&A started. So yeah, I think we'll go ahead and let Jan get us started with this panel.
Okay. Thank you, Dr. Hughes. So my name's Jan Villalobos, and I'm a criminal justice major with a minor in legal studies, and I decided to do my senior thesis on private prisons in the United States. I kept my title short and snappy to the point, Inmates for Profit. I'd also like to give a big thank you to Dr. Hughes for helping us get through this tough month, and my two advisors, Dr. Andrea Borrego and Barbara Kohler. You guys are the best. So we're gonna jump right in because there's so much for you guys to learn in so little time. So the first thing that you guys need to know is that the United States
holds 5% of the entire world's population, but we also hold 25% of the entire world's prison population. We beat out every first, second, and third world country of having the highest incarceration rates in the world. We have a prison rate 4 times higher than Britain, 4 times higher than China, and 14 times higher than Japan. And it's not necessarily because we have more crime, but because the way the United States chooses to respond to that crime. So we're going to look at the prison rates and how they evolved over time. If you look at the graph, you'll see how the prison rates have just skyrocketed, particularly around the 80s, when Nixon, Reagan, and Clinton were pushing for the tough on crime approach in the United States. You know, the war on drugs pushed through low-income areas, locking people up for longer periods of time for low-level offenses. Essentially, it created mass incarceration, and today we have 1.5 million people incarcerated in prisons in the United States. We also have 2.2 million people incarcerated in jails and prisons today. So mass incarceration is certainly the best term to define this, what is happening right now. So mass incarceration created a huge problem. Our prisons were not ready for the boom of incarceration. By the year 2000, state prisons were operating at 15% beyond full capacity, and federal prisons were operating at 31% beyond full capacity. They had no room for these inmates. And a lot of lawsuits were coming against the prisons for inhumane conditions due to overcrowding. And the government and states were both facing a lot of pressure from the judicial branches to alleviate this overcrowding. And so the government came up with a response. They responded by implementing private prisons. A private prison is a private corporation that builds or purchases a prison, and then they offer their services to the government for a fee per person. Per person. And so essentially, the corporation gets paid a certain amount of dollars per inmate per day. So the government pays, the corporation maintains. There were many perceived advantages of why the government chose this route. Number one, it helped alleviate overcrowding faster than the government could have. There was no bureaucratic red tape, meaning that for a government to build a facility, it could take years and a lot of money. They would have to get approval and funding, and it could take a long time. But for a private corporation to do that, they build the prison, and then they just have the government give them a contract stating how much they would get paid per prisoner in order to house the inmates for the government. So it could happen a lot faster than the government could do for itself. Also, the corporations advertised that they could maintain and operate these facilities at a lower cost than the state and federal prisons could. And not only that, they stated they could provide better and equal services. So why not go the cheaper route when it's just as effective? If you look at the chart, you'll see how private prison rates have grown since the year 2000. In 2000, there was about 87,000 inmates incarcerated in the private facilities, and by 2016, that number grew to 128,000. And if you look at the federal facilities, the private facilities, that in the year 2000, there's about 15,000, and we've seen a 120% increase. And by 2016, there was 34,000 private federal facilities. And we also seen a 31% increase in state private facilities. So this was the solution the government essentially created. However, there was a lot of controversies with it. The number one being that the profit overrides the need for justice. So Core Civic, MTC, and GEO are the 3 biggest corporations for private prisons right now. The 3 of those combined own 96% of the private prison market, with a lot of money to be made as well. In 2018, the private prison industry turned into a $5 billion industry. And in 2016, Core Civic alone made a $382 million profit. That means after paying all their bills, that's what they took home. So there was massive amounts of money we made off the backs of inmates. And not only that, there's no real data proving that they are cheaper and as effective. Studies have been done, but they yield mixed results. One study says, yes, they are cheaper. One study says, no, they're not cheaper. One study says, oh, yeah, they do have better programs. One study says, no, they don't. And there's essentially no way to really compare them. It's like comparing apples and oranges. You know, we have low-risk facilities, high-risk facilities. We have facilities with 500 inmates. We have facilities with 1,500 inmates. And just no 2 prisons are the same. And it's very hard to say, yes, they are cheaper and as effective. Not only that, but we see that private prisons do a lot of cost-cutting measures in order to make more money. It's all about making an extra buck here and there, so they cut every corner they can. And one way they do that is by avoiding sick and elderly inmates. They actually have it written in their contracts that they will not take a sick or elderly inmate because they cost more to house in case they get sick or need doctor care, things like that. They also understaff, undertrain, and provide less resources because all of that costs money, and the less they have to pay, and the more they take home at the end of the day. And a more serious case that we've seen is at this Walnut Grove Youth Correctional Facility in Mississippi. This is a private facility run by MTC, and in 2010, this facility had several lawsuits brought against it because of the cesspool of inhumane conditions. There was rampant violence. There was youth-on-youth sexual assaults, correction officer-on-youth sexual assaults. There was gladiator-style fights where the guards were betting on who would win. In 2013, Walnut Grove Youth Correctional Facility was listed as one of the top 10 worst prisons in the United States of America. And by 2016, under the state order, they were made to close because it was just terrible and they couldn't get it to where it was supposed to be. And another more recent incident in 2017, a Florida facility also managed by MTC had been found to have been cutting off the heat and hot water to inmates for months to save money and, you know, to make more profit. And these are just a few of the examples that we see of cost-cutting measures that are just wrong, and people's lives are being altered by this, by these private corporations that are just looking to save money. So some more controversies we see, more in the corruption aspect, is CoreCivic, the private corporation, attempted to purchase all the prisons in the state of Tennessee. Tennessee had a major overcrowding issue as well, and CoreCivic offered to buy them for a lump sum of money, and of course the state would have to pay CoreCivic to house the inmates once they purchased them. And the governor was really pushing hard for the state to accept CoreCivic's offer. And Tennessee declined. They said, no, we're not going to sell our prisons. And it later came out that the governor was pushing so hard because his wife and best friend were investors in CoreCivic Corporation. So that's one example. And the governor would later go on to pass a bill allowing for private prison operation within the state of Tennessee. So they did end up getting some private prisons out there. Another case we see, which is more disturbing, is the sale of children to these private corporations. In 2011, 2 judges were caught to have been paid $2.6 million by a private facility in the area to send youth offenders to that correctional facility. So we're essentially seeing the sale of children to these facilities. I mean, $2.6 million, that's a lot, but the corporation knew that the more children they got there, they would make well over that in return. So these are just a few of the cases of corruption we see of, you know, of the private prison industry that goes with a for-profit organization. So there are a few things that I found in the end. Particularly that private prisons promoted false promises of cheaper costs and better services, and instead the United States has seen cost-cutting measures, corruption, and a desire to keep mass incarceration rates high. So the purpose of my study that I completed was to examine the different perspectives on private prison industry and the different ideology individuals may have about it. I wanted to get a wide variety of mixed thoughts on it. So I did have to submit an application to the IRB to get approval to do this study. I had a very hard time getting participants for this study. Many political workers turned me down because they were afraid if the word got out they did this interview and expressed their thoughts, they would lose their job. A lot of previous offenders also declined. They just weren't, they were the consequences as well, but in their own aspects. So in all, I was able to get 7 people to interview. I did the interviews by phone, secure communication platform, and some in person. I did a snowball and availability sampling. So basically people I know are people that I know who know people. So it was all very close tight. I did do people that were 18 years or older and could consent legally. All of the interviews were anonymous. And in the end, I was able to get 2 previous offenders, an attorney, an employee of a criminal justice advocacy group, a political worker, and 2 employees of private prison corporations. And if you look at the chart, I did get a wide mixture of thoughts about the private prison industry. 2 people were strongly for private prisons. 3 people were strongly against. And 2 people were in the middle. They had things to say for and against on both sides. So these are some of the questions that I asked them. Please describe your history and knowledge of private prison facilities in the United States of America. And what are/were your impressions of your experience with private prisons? Do you believe that private prisons are an asset or hindrance to society? And would you change anything about how private prisons are currently run? And do you believe that private prisons are an asset or hindrance to the rehabilitation of those incarcerated in for-profit prisons? So as you can see, I left very open-ended questions so the participant could take the answer any way they wanted it to go. So some of the findings I found is that a major theme that was mentioned across many interviews was the economic impact. Specifically, participant A stated that these private facilities are intentionally placed in rural areas to help economically depressed areas with currency and jobs. Participant E also acknowledged that this is done, but stated that it actually hurts the facility more than helps because it makes them have major staffing issues. The employees who work there have very long commutes from their home. They have very low salaries, and they're not government employees, so they don't get government benefits. And most of them see it as a job and not as a career, so they do have a high turnover rate for employment in these facilities. Another theme we see are contracts and programs. Participant A stated that these private corporations would love to do more for the inmates. They'd love to have more programs and better programs, but they could only do what is stated in their contracts that they signed and agreed to with the government. However, participant F stated, yes, there are limitations to what they can do that are stated in the contract. However, the contract is a mutual agreement from the corporation and the government, both agreeing on it, and alterations are constantly being made to these contracts every time they're up for renewal every few years. So you're not stuck to what's in the contract. It can be changed. And programs are another huge thing because programs help with rehabilitation. Are these facilities have good enough programs to rehabilitate offenders? Participant A had a spouse who served time at a Colorado private facility. Their spouse did not get any programs and just did their time. Participant A, however, also stated that if the inmate wanted programs, they should simply just move to a state facility where they could get them. So that sounds, very simple. Participant B stated that they did not receive any programs while being incarcerated either, and they just served their time and left. Participant F, who is a political worker, talked about the programs and how there are less programs in these facilities because less programs means the less they have to pay. And not only that, more money because more people coming back, more people not being rehabilitated. Participant C had a different experience in private facilities. Participant C served time in a California private facility, and they stated they had lots of activities. They had sports there, they had junk food, they even had a soda machine in the prison. Essentially, if you had money, you had it all in this facility. Participant C stated that it was so comfortable there that he even heard people say, I might come back again, just because of how cozy it was, versus when they served time at a state facility, they had no intention of ever going back. Participant G, who is also an employee of a private prison corporation, stated that they have plenty of programs, but didn't go too in depth to what or how many, but they did state that they did have them. Another finding is the monitoring aspect in these private facilities. So these private facilities have minimal monitoring from the government. The government really don't go in there too often because they're not really allowed to, and they have no way of knowing if these corporations are doing what they're supposed to be doing and not engaging in cost-cutting measures. So one of the participants stated that if we must keep private prisons, we have to have better monitoring over them. We have to make sure they're doing what they stated they would do in their contract. The final theme that 50% of the participants expressed a concern for was the for-profit motivation. A lot of the participants stated that trading inmates for money was very concerning to them, and that the bottom line is that rehabilitation does not help these corporations. If people were rehabilitated, that would mean lower recidivism rates, that would mean less people in jail, in prison, and the less people are in prison, the less money they make. In order for them to make a substantial amount of money, they need a substantial amount of people incarcerated, and rehabilitation does not do that for them. Participant D stated that the justice system is not private. The government prosecutes, the government sentences, the government should be responsible for housing. They should not hand that over to a private corporation who could profit off of that. And participant D also stated that it's not a fair trade-off. Even if the government is saving a buck by sending people there, it's not a fair trade-off to send inmates to inhumane conditions and less rehabilitation efforts in these facilities just to save $1. It's not worth it. So in the end, there's a few discussion points I'd like to bring up is that the United States is allowing profit motivation to override the concept of justice. These corporations will always be for profit because there's millions to be made, and they will always push for mass incarceration because that's how they make their money. Using offenders' lives to save $1 is not a fair trade-off. We should not be sending people to these facilities where they will be sure to come back because they will not receive the rehabilitation treatment they need. And rehabilitation efforts will not succeed as long as private prisons are still operating and pushing for mass incarceration. It just will not happen. So thank you guys for listening to me, and thank you again to my advisors for the help on this amazing project. And I hope you guys took something away from this because not many people know about private prisons and that so many people are profiting off of the backs of inmates, and it's not right. Thank you so much.
Thank you, Jayanne. We're looking forward to dialoguing with you in a few minutes. Stephen, are you ready?
Believe so.
Okay.
But Jayanne, you're still showing your screen.
Oh, okay. There we go.
Good afternoon, everyone. This is Captain Stephen Liu. Thank you so much for joining me on this flight today. We have a few stops to make before landing at our final destination. First, we'll travel to the history of aviation, then to why we economically regulated the industry, to the reasons for deregulation and the impact it has had on us today. So please sit back and relax. I'll let you know when we get ready for landing. In the meantime, something to consider is, while economically regulating the industry is an emerging trend, do you think we should, or is it time to consider a fusion of both regulation and deregulation to make a hybrid approach? To start off with some aviation history, after World War I ended, planes demonstrated how advantageous they are with their speed and efficiency in getting around the country. After a few more years of the post office experimenting with airplanes and carrying mail, the Mail Air Act of 1925 was passed, authorizing the government to enter contracts through a bidding process with private companies to carry the mail. The shift from airplanes being owned and operated by the government to private enterprises would aid in the genesis and stimulation of the commercial aviation business because it gave airplane manufacturers an incentive to construct airplanes to specifically meet the needs. Come the following year, 1926, the Air Commerce Act was passed, which promoted additional aviation growth and fostered a degree of air safety in the industry. By the mid-1930s, it was apparent that the industry was heading into a nosedive. The level of safety did not entice people to fly, as you had a fatality rate 1,500 times that of the railroads and 900 times of that of buses. An amendment to the AML Act in 1934 changed the bidding process and cut payments to contracts, erupting into bankruptcies and reorganizations. Interestingly, this is how United and American Airlines came to be. Airfare prices remained unregulated, and prices were kept low in order to compete for demand. And all with horrible safety records, low profit, and competition, the Federal Aviation Commission, created by the President to study the industry, recommended regulation to allow for sustained controlled growth. The government responded by passing the Civil Aeronautics Act of 1938. It essentially created two things. First, the Administrator of Civil Aeronautics to promote safety, and the Civil Aeronautics Board, or CAB, to economically regulate the industry. How the CAB regulated the industry essentially revolved around three tactics. First, Certificate of Public Convenience and Necessity. If you wanted to engage in air transportation, you needed the certificate. The only exception was the original 16 established airlines, as they were grandfathered into this new system. Second, formal tariffs. Airlines had to establish formal tariffs of prices they were going to charge, though it was only accepted if it meant a reasonable rate of return. And third, route control. If you wanted to enter or leave a market, you needed authorization from the CAB. Given how new the industry was in World War II, the CAB received little criticism for the next 30 years. However, by the 1970s, the deregulation movement had started. The economy was entering into a recession and faced with a fuel price increase, resulting from the 1973 oil crisis. Passenger demand was falling, creating excess capacity, resulting from the investment into wide-body aircraft. The CAB responded by raising airfare prices by 20%, rejecting route expansions, and brought charter operators under regulation to stabilize the industry. Airlines were dissatisfied, and consumers felt that the increase in higher prices was anti-consumer. Adding to the movement was that it was discovered that the CAB chairman, Robert Tim, was in a few political scandals, accepting many free trips paid by the airlines to go to Florida or Europe. And it was discovered that he attempted to throw in an investigation into illegal airline contribution into Nixon's re-election campaign. On top of that, reports that were conducted on the CAB revealed that the industry is naturally competitive and should be deregulated to help in sustaining low prices to be able to reach the average citizen. With both unfavorable regulatory policies and political scandals, it aided in the first deregulation bill being sponsored in 1975, eventually leading to a free market in 1978 with the Deregulation Act. Now with a free market, airfare prices are now established by private companies. So what has this led? If we look at this first graph, the average round-trip ticket starting in 1990 was about $289, with a gradual increase throughout the years. By 2019, the average price is $367. This is a 27% increase. However, when the average airfare is adjusted for inflation here in the second graph, in 1990, it's about $566, but this time with a gradual decreasing trend. By 2019, we have reached a nearly 35% decrease. Therefore, with deregulation, the average price of airfares is cheaper, allowing to reach a further range of socioeconomic passengers. On the other hand, without financial security given by regulation, the industry has been known to be cyclical, as profits fluctuate back and forth. There are a few reasons for this. First, with deregulation, competition has led to irrational pricing of airfares, coupled with increased barriers of entry from the established airlines as they attempt to dominate the market through their economies of scale. Second, being that majority of airfares are for leisure travel, industry success is dependent on the financial health of the economy. When the economy is booming and consumer confidence is strong, demand grows, helping to improve load factors and subsequently raise yields and profitability. When the economy tanks due to a recession, unemployment grows, and consumer confidence declines. Therefore, travel will be postponed, which will then decrease load factor, yields, and profitability. Third, the industry is capital intensive. In 1980, World Airlines spent about $147 billion on capital. By 2000, airlines have spent about $815 billion. This is a 455% increase. With industry being labor and fuel intensive, it requires tremendous investment to operating equipment, facilities, servicing, overhaul, and replacement. While the industry is deemed cyclical, it is also known to be an oligopoly. In an oligopoly, there is limited competition and the market is shared by only a few producers or sellers of the same product. After deregulation, the industry had over 240 certificate airline operators. 10 years later, only a little more than 70 remain. In total, the industry has experienced 40 airline mergers or acquisitions, 24 airline liquidations, and over 180 Chapter 11 bankruptcies. While merging with another airline allows you to quickly gain another airline's infrastructure and market share, this level of consolidation has led to fewer choices for consumers, concentration of airlines at airports, and contradicts deregulation's vision of providing a healthy competitive sphere. An example of high concentration of airlines are its hub and spoke airports. Here we have United Airlines, its 6 contiguous hub and spoke airports, and its market share percentage. How a hub and spoke works is an airline will funnel majority of its operations to these hub airports, where flights will arrive in close proximity to each other to allow passengers to readily connect. This requires heavy investment into an airport's infrastructure, work personnel, and may cause delays due to high traffic. Although this model is highly popular after deregulation due to its economic impact, as it exponentially increases the number of possible city pairs an airline can serve. Therefore, this increases load factor and profits. Adversely, hubs are known to deter competition from entering, which may translate into higher airfare prices. If we look back onto the map, United Airlines has a high market share in Newark, Washington Dulles, George Bush Intercontinental Airport, and even San Francisco. New entrants will find it difficult entering into these airports as majority of the airport's resources are already consumed, such as gate space and landing slots, by the majority airline. Additionally, the established airline has greater marketing power, economy of scale, and loyalty program. Lastly, even if a new entrant were to able to enter the market to provide lower airfare prices due to their lower operational costs, the incumbent airline is willing to compete with you on that route, even if it results in a negative profit for them, because the incumbent airline has a bigger network, allowing the losses to be compensated by other profitable cities. Therefore, this model of flight scheduling has led to predation and monopoly pricing. Formal discussion of reregulating the industry stems back to 2007 when merger discussion was taking place between American, Northwest, United, and Continental Airlines. By 2014, top 8 of the major players had consolidated down to what the industry now calls as the Big Four, being that they collectively control almost 67% of the total market share in the U.S. Aviation experts argue that consolidation in the industry reduces competition, ultimately creating monopolies at select concentrated airports. Using an HHI index to measure level of competition, if an airport has an HHI value of 2,500 or more, the market is more concentrated and the level of competition is less. If a merger results in an increase of more than 200 points, it means that the merger is anti-competitive. While when U.S. Airways merged with American Airlines, their overall score increased by 1,500 points and many cities exceeded 2,500 points after merging. Keeping in mind the U.S. General Accounting Office found when comparing 15 concentrated airports and 38 unconcentrated airports, prices were 27% higher in the concentrated airports. Therefore, with the Department of Justice allowing the top 8 players to consolidate down to 4, highlights the trend of re-regulation, as during re-regulation, competition is not promoted but rather preserved. Another reason why experts believe re-regulation is emerging is because economic re-regulation may be thought as of a synergistic loop rather than a linear model progression. In a synergistic loop, knowledge and wisdom from one era is used to propel and educate change for future governmental control. The historic development of economic regulation and the synergistic loop begins first with the transition from a centralized control of the British mercantile system to a competitive capitalism phase between 1776 until 1880, leading to our first loop that is in the color red. The market begins to rationalize by industry into corporate capitalism of the progressive era from about 1890 to 1918 until establishment of regulation to control monopolies through antitrust laws. The second loop, that is in blue, encompasses the period from 1920 to 1978, where the market begins re-rationalizing through economic regulation into corporate capitalism in the form of a public utility. In the airline industry, this leads us up to the Civil Aeronautics Act of 1938, which created the CAB to monitor the industry. And the third loop, colored green, is from about 1978 to 1987. The market is deconstructed by the government through the Airline Deregulation Act to form a competitive capitalism. The current evolutionary loop representing the 1990s and beyond is left dangling and in speculation. While current regulatory policy for air transportation is nearly non-existent, if we look at history during the Industrial Revolution and the Progressive Era, when infrastructure industries were left to compete without governmental intervention, it resulted in collusion, mergers, and monopoly. Following this economic abuse was always governmental oversight. Therefore, given the airline industry is considerably downsizing with noticeable concentration, re-regulation may be needed to protect the consumer and subdue monopoly pricing. On the other side, a study concluded by the USGA office found that re-regulating the airline industry would reverse consumer benefits that many of us have enjoyed, such as lower airfares, which is one of the reasons why we deregulated in the first place. Also, higher airfares could shift about 670 million domestic airline passengers to other modes of transportation that are not as safe or efficient as flying. Having both sides, price cap regulation has been adopted in some industries and is suggested. In this regulatory model, a regulator sets an overall rate of price increase which is allowed. Carriers are free to determine which markets will or will not have price increases, as long as the weighted average of the price increase does not exceed the price cap. As a result, carriers may still vary prices and charge inelastic demand markets more, while elastic demand markets would have lower prices. Although while in this study it was not effective in sustaining profitability, this regulatory model could be effective in restraining monopoly pricing that we see in concentrated airports. Another approach follows more of a hybrid approach, combining both regulation and deregulation, such that airlines are liberated, but the government maintains a majority of the shares in the company. This way, the government is ensuring that corporate management is making sound and strategic decisions. With that said, to better represent interests of all stakeholders, it could be beneficial in operating under a shared executive governance, where instead of a single CEO to lead the company, you have 2 or 3 individuals to weigh in on decision-making processes. Lastly, like the CAB, initiate a similar board to provide regulatory oversight, although this time with a pool of representatives with different backgrounds to include airline management, consumer interests, retired pilots, to protect the interests of all parties, to include capital investors, organized labor, and the public. All right, folks, it looks like we're coming in for a landing. To wrap up, aviation is an important facet to the United States economy. While my project aimed at exploring the outcomes of deregulation and the trends for re-regulation, being a dynamic industry, it will require additional analysis for the upcoming years to delineate the trend, especially after the recession we are entering now due to COVID-19. While we are currently in the state of economically deregulated era, I do see re-regulation in some aspects to be a probable solution to some of the challenges the industry faces today, such as cyclical profits, concentration of airports, and destructive competition. Regardless, the development of the industry in terms of maturity will be felt across the board. With that said, thank you so much for joining me on this flight today. I hope to see you all again very soon. Take care.
Thank you for that presentation, Stephen. So we are ready to move into our final Q&A for the day. Let me see what we've got here. Remember, everyone, that you are welcome to join us and interact directly with the panelists or submit your questions in the chat. It looks like I have a question here for JN from Little Wolf Movement on the live stream from YouTube. It says a study shows that since 2016, the inmate assaults dropped from 28% to 18% in 2020, surpassing the assault rate compared to public prisons. It also shows a major increase of jobs for communities surrounding these prisons. So would this be considered good for the economy and the change of behavior of inmates in the prison systems?
Of course, jobs are always good for the community, but the issue is they have a hard time finding people who'd even last there for over 3 years. The turnover rate is very high. So yeah, it does bring money there, but I mean, jobs, when most of the people won't stay, I mean, it's not that good. And for the lower assault rates, I think it's very easy to be like, oh yeah, look at the private prisons, they have lower assault rates than state. But like I said before, that private prisons choose who go into their facilities. They don't take sick, they won't take elderly, and they won't take high-risk offenders because those 3 groups of people cost more to house. So yeah, it's easier to have a lower assault rate when all you have in your facility is low-risk offenders, either there for lower crimes or non-violent offenses. So yeah, I mean, it's like comparing apples and oranges, like I said before. It's easier to be like, oh, well, this is lower than this when they're not the same. So yeah.
Okay, and we have another question from one of your advisors, from Barbara Kohler. Do you think a form of oversight would make any difference in the private prisons?
Thank you, Professor Kohler. You're such an amazing professor. I do think more oversight would make the world. I mean, if you have a job and your boss never checks on you, you're essentially going to do whatever you want. Unless your boss is constantly there checking on you, then you're probably going to do your job. But I feel like if, like the situation in Florida where the hot water and heat were cut off for months, it shouldn't have took months for that to be found out. It should have been found out right away. But it just goes to show that the oversight's not there. And if it was there, that wouldn't have happened. So yeah, I think oversight makes the world of difference.
Thank you. I'm just wanting to remind advisors that we are definitely wanting to welcome you to ask the first round of questions. So if any of the advisors want to weigh in, go ahead and do so. And if you want to address your student directly, that's fine as well. In the meantime, another question from Enrique Avila Martinez asks Jayanne, what is the concept of justice here? Overall, how are private prisons overriding justice?
The way we look at it is that they're overriding justice because justice is, you know, when you commit a crime, you get sentenced, you should be given the fair sentence, and you should also have the chance to come out and be a productive member of society. And the thing is that these for-profit organizations want mass incarceration. So they are for the tough on crime approach. They are for mandatory minimum sentences. They want people to spend the rest of their lives in prison. So they're for all that harsh punishment. And that's not justice. Sending someone to prison for life over a minor offense isn't justice. And not providing them the tools they need to come out rehabilitated and integrate successfully back in society is not justice.
Thank you, Jayanne. Okay, I see another question in the chat from Dr. Borrego. Great presentations. My questions can relate to both presentations. If decisions of the government and private corporations affect everyday citizens, how can you get people to care? And how can they play a role, if any, to hold government and private corporations accountable? So either of you can go ahead and take that, and then we'll switch to the other one.
I think if Stephen wants to talk for a little bit, he can.
Well, at least in aviation, we know that. Sorry, I'm just rereading the question. Well, being that we're currently in an era where travelers are very price sensitive, so I think government involvement would be beneficial in that, and that the airlines won't start monopoly pricing, especially at concentrated airports. In one of my studies, looking back in 1994, there was United, U.S. Airways, and Continental. U.S. Airways actually left, Continental left in 1994, and United Airlines skyrocketed their tickets up to 27% until U.S. Airways re-entered the market in Denver. In response, we saw United drop their ticket prices by 7%. So I think government involvement will be beneficial in keeping consumers happy, because that was one of the reasons why deregulation happened.
Thanks, Stephen. Go ahead, Jayanne, if you want to add to that.
How to get people to care is a hard one, because a lot of people don't particularly care about a situation until it affects them. But I think the number one step is making people aware of the issue, because many people don't know about these for-profit corporations. I've even seen people say, how can you make money from prisons? There's no money to be made there. And I'm like, oh, but there's billions to be made. So getting people to care, I mean, just letting them know that, you know, there's so many people in prisons that don't need to be there. You know, there's people serving life for low-level nonviolent drug offenses. So getting people to care that, you know, there is a way to save money, and there is a way to have more people come out and successfully reintegrate into society is a start. You know, when it comes to money, people always care about that. So if there's a way for the government to save a buck and put it into our schools and higher education, people would probably be more for that.
Thank you both.
Thank you, guys.
Joanne, can I ask a question real quick?
Yeah, it's Jan.
Sorry.
Fine.
My font is so small, I can't even read some of these things. I'm so sorry. I just wanted your thoughts on the disproportionate amount of minorities behind bars and how it's a crime to be poor in and of itself. Meaning, I'm pretty sure you know what I mean. Meaning, they will jail people for not being able to post bond, for not being able to pay fines, for not being able to afford an attorney, and that will put somebody in jail in and of itself, not having enough money. And also, there's also people who can afford attorneys who can put them into nicer facilities. So they get to pick and choose where they serve their time because they research and see which is a nicer facility. What are your thoughts on these things?
Yeah, so everyone has a lot of thoughts on this topic. I actually didn't touch on it too much because if I did, I probably would have went on for hours.
Right.
It is heartbreaking that more people of color are, you know, in prison than, you know, obviously people of Caucasian descent. And I mean, there's so many aspects I could touch on it. It's a crime to be poor. Yeah, if you're a person of color, you're more likely to be pulled over. You're more likely to be stopped and searched, even though people of Caucasian descent are more likely to have drugs on them than a person of color. And I think that has a lot to do with the tough on crime approach and the war on drugs that took place, is because police officers were told, hey, you know, target the drug dealers. Oh, wait, that's the poor. Let's go to the poor neighborhoods and target all the people of color because we know they have drugs. Versus, you know, teenagers of Caucasian descent that sell drugs at their high school, you know, they're not as concerned with them. And I definitely think it's going to be extremely hard to move past that. I don't know if we ever really can. I mean, I guess we could start by letting like the 500,000 people that are in prison for low-level drug offenses that are non-violent out of prison, because that's how many people are in there for low-level non-violent drug offenses. And yeah, it's all about money in this industry. If you have money, you probably won't serve as much time as someone who doesn't. So it's an extremely heartbreaking topic.
Thank you. Colton Lee wants to ask a question. Colton, go ahead.
Yes, thank you. For both of you, just on a more personal note, I wanted to ask, what does the future hold for you two, especially you, Stephen, just in light of the current times. But yeah, what are your futures look like, if you know?
Well, for me personally, just due to the crisis right now, I know I had 3 internships lined up, but unfortunately they all got canceled. So that does stink, but knowing the industry, it will bounce back. I know airlines are downsizing right now, but I think in the future, really, it will ramp up again. So the future is bright. I'm positive about it.
Are you talking about like our personal futures or the future of our topics?
Yeah. What are your goals, and do you intend to like work within what you presented on, Jan?
Oh, definitely. So I'm actually a legal assistant right now for defense attorneys. So I've already got my foot in that field, and I'm starting at Creighton Law in the fall, making the big move to Omaha. Lots of corn, I heard, thanks to news.
Yeah, if you need to talk about corn with me, just give me a call.
I need to learn everything there is to know. Yeah, so I definitely plan on going into the field, and I think there's a lot of underrepresented people that can't afford attorneys that, you know, need help. And I want to be there to help them. You know, there's most attorneys go in wanting to make a lot of money. Oh, I'm going to go into, you know, like lawsuits or, you know, health and things like that. But I think there's an issue in our prison system that people either know about and don't want to talk about it, or just don't know about them in general. And that's super heartbreaking. And I think there's a lot of people serving life sentences that shouldn't even be there. And I think that's why I did this topic, is because I'm so passionate for it. And it's just heartbreaking overall. Like I've said before, it's a tough topic, and not many people like to hear about it because it's so harsh. You know, the examples I gave are just a few of many thousands of the mistreatment people receive in these facilities. And then we as a country wonder why we have so many people in prisons and why our recidivism rates are so high when we're not giving these people the second chance they need to come out successful.
Thank you, and congratulations, by the way. And yeah, great presentations to both of you. Thank you.
Yeah, definitely. Jan, I have a question for you.
Okay.
Please, sorry, just real quick. What can we do to like? Here, I'll show my face. Why not?
Okay, that'll be good. I'm talking.
Yeah, we've never met, but nice to meet you. I'm Elise. What can we do to help or make a difference in? I mean, is there anything we can do to help prison inmates get better treatment and like not let the corporations be so influential in the justice system?
Your question is very big, and we hear it all the time, you know, like these people wanting to go out and change the entire world. And the fact is no, you can make a difference. I don't know if it'll be the entire world, but to one person, like every person I've worked with that's incarcerated, I've seen a change. You know, they're, you know, like they have someone to vent to, they have someone to talk to, their frustrations, and definitely just getting the word out there, because nobody knows about this problem. Like, I would ask how many people knew about it, but I'm bet you half of them didn't, because I never even knew about private prisons until like my first year of college. So definitely become aware, and volunteering too. There's a lot of places that take volunteers. When I was looking for an internship, I volunteered for free with the Alternative Defense Council, and I was there for about 2 years. And I've been here for a while, but after 2 months, they offered me a paid position. Just because, you know, they said they liked my work. So if you're that passionate about it, I say just get in there and start learning about it and start doing what you can from your standpoint. And obviously, once I finish law school, I hope I could do a lot more than what I'm doing now.
Yeah. It just takes one person at a time. That's what I tell people. If like one person just believes that they're completely ineffectual and don't make a difference, then that's how change doesn't happen. So.
Yeah, definitely. And that's how I see it too. If I could change one person's life, then I'm happy with that. You know, that's one more than I previously changed. So
definitely. Well, thanks for answering my question.
You're welcome.
Thank you all. I want to invite Dr. Simmons to address the panel.
Yeah, hi to both of you. Great jobs. Stephen, I like the way that you put all that together after so many drafts we worked on, and I thought it was really good. And Jayanne, I like yours too. Interesting topic, and you really wrapped it up very nicely. So both of you did a great job.
Thank you, Dr. Simmons.
You're very welcome.
Thank you so much.
And the industry will bounce back, Stephen. You're right. It might take a while, but it will.
Mm-hmm. Your next semester class is going to be interesting.
Wait, you're graduating, aren't you?
I am. For your future students.
Oh, you're right. Yeah, there's plenty to talk about. I see what you mean.
Mm-hmm.
Absolutely. Things have changed a lot.
So, Stephen, I'm going to ask you one last question. There's kind of a pile up of questions here, and we're not going to have time for all of them. But I do have one question that was in the queue here, again from Becky Alter, one of our alumni. How do you think the government should manage the financial repercussions of COVID on the airline industry? I think this is a question that a lot of us are thinking about. So I wanted you to be able to address this one.
Wow. If you don't mind, can you repeat the question?
Sure. How do you think the government should manage the financial repercussions of COVID on the airline industry?
Well,
your project, as you said, started before this, right?
It did.
And so this was already like a big question previous to this moment, but now we've got this added thing, and I know you mentioned it, but I think many of us are thinking, and is there another layer now to all of what you said? And maybe you have or haven't thought about it, but.
To be honest, I haven't thought about it too much, but certainly the government support. I know the CARES Bills Act was passed, helping airlines. I currently work at Frontier right now. I know that has helped us financially. I think really just the support from the government. I know just hypothesizing, I know the airline industry is probably going to have negative profits for the next few years. So that's going to be an impact. But from this point, I don't know if maybe mandating a price regulation on airfares is going to be beneficial, being there's low demand. But I guess anything to support the airlines right now will be imperative.
Okay, thank you. Well, I think that we are officially out of time. We're about 8 minutes over, but you guys did a great job, and I think that we should all give you a round of applause. Let's unmute our microphones and give this panel a group of round of applause. Thank you so much to both of you, to your advisors, to everybody that's participated today, and all the hard work that you've done. We will be in touch. I'll be in touch with all of you, with the students and with the advisors on the final grades, and also we will also be sending out official thank yous to the advisors for all your hard work, probably coming out in the mail next week. So thank you again, and yeah, we'll be in touch, everybody. Congratulations to the graduates.
Indeed.
Thank you.
Yay, lots of congrats in the chat. Good job, everybody.
Thank you, Dr. Megan Hughes-Zarzo.
You're welcome.
What are you going to do now?
Me?
Yes.
I am going to go play with the kids probably for a while.
It's good.
And then sleep eventually. What are you all going to do?
I say you crack open a bottle of wine. All of you who are of age.
There might be
if you prefer.
Occasion for that. Thank you for being here, Dr. Parmalee.
Congratulations all. You did